Good morning. Could I get everybody please to get seated? We're going to go ahead and get started with today's program. I know there's a line outside in the parking garage, so people will be trickling in as we get started. My name is Dr. Rola El-Serag, and I am the director of the Center for Health and Biosciences at Rice University's Baker's Institute for Public Policy. It is with great pleasure that I welcome you to today's event, Preventing a Firearm Injury in the Greater Houston Area Through Purpose and Policy. The Center for Health and Biosciences is committed to producing rigorous scientific research in relevant public health areas and translating this research into meaningful action as community outreach and interventions and effective policy and legislation with the ultimate goal of safeguarding and improving the lives of people in our communities. Today, we intend to do just that with what has become, unfortunately, one of the most critical public health crises in our nation: firearm-related injuries and death. My first major initiative as the new director of the CHB was to establish a program dedicated to firearm injury prevention and safety by recruiting two experts in the field as senior fellows, Drs. Bindi Nayak and Sandra McKay, who will be leading our event today. And I thank them very much, as well as Caitlin May and Jackie Klotz, for their vision and hard work in planning today's event. I would like to take a few moments to discuss why it is so important that we have a section of the CHB devoted to firearm injury prevention and safety. Across the country, firearm-related injuries and deaths have been rising at an alarming rate, especially among youth and young adults. The increasing number of adolescents experiencing mental health issues and the surge in homicides, unintentional shootings, and school-based violence are among the factors contributing to the record number of deaths. Firearm injury is the leading cause of death in children ages 1 through 19 since 2019. In 2020, more than 45,000 Americans were killed by firearms, a 15% increase from the year before. More than 115,000 people annually are injured by firearms in the U.S., and since approximately 40% of U.S. households contain firearms, we need to make firearms safer. Unfortunately, these deaths and injuries were both predictable and preventable. So where did we go wrong? As a nation, we have failed to address this tragedy systematically and effectively as a public health crisis. Political ideologies, misperceptions, and reactivity have failed to produce any meaningful legislation to make our communities safer from firearm injuries. Gun violence costs more than $220 billion annually in the United States, exceeding the health care costs of obesity. Despite this staggering figure, federal funding of research on gun violence and injury was frozen for 22 years, undermining critical research that should have been conducted to drive public policy effectively and meaningfully. Going forward, it is imperative that we focus on studying firearm injuries and deaths in its many forms and utilizing the results of such scientific data to guide public policy and community strategies. In essence, using a public health approach. Today, you will hear about the current state of firearm violence in the greater Houston area from our experts and our mayor, the Honorable Sylvester Turner. You will then hear scientific data and analyses on firearm injury and unintentional shootings, suicides, school-based violence, and interpersonal violence, followed by presentations of current community intervention efforts and their successes. Finally, after a review of the current Texas state policies regarding firearms, a panel discussion of policy experts will be held, including our HPD Chief of Police Troy Finner, Harris County Sheriff Ed Gonzalez, Texas State Representative Ann Johnson, Texas Senator John Whitmire, and Harris County District Attorney Kim Ogg, with the goal of defining future steps forward. This, we hope, will be the first of many relevant discussions and community partnerships focused on improving policy and interventions in the Houston area and Texas as a whole, where evidence-based research is translated into meaningful action and change. It is difficult to live in a world where parents send their children to school in fear and where gun violence is personal, having touched the lives of so many. In the wake of recent horrific tragedies such as Uvalde, today's discussion will likely be challenging, emotional, and hopefully eye-opening for all of us. But it is time to open the dialogue, however difficult it may be, in order to create a safer tomorrow. A few logistics. We will not be taking questions during the lectures or the talks. You all have question cards on your tables, so please go ahead and write your questions down, and they will be collected and be attended to. It gives me great pleasure to introduce our first speaker today, Dr. Bindi Nayak. Dr. Nayak is a pediatric trauma surgeon and associate professor of surgery and pediatrics at Baylor College of Medicine, who has experienced firsthand the tragedy of firearm death and injury in children. She developed and led the Level 1 pediatric trauma program at Texas Children's Hospital for over 10 years and is an avid researcher in pediatric trauma, injury prevention, surgical outcomes, and health services. She holds an MD from Texas A&M University College of Medicine, an MPH from Johns Hopkins Bloomberg School of Public Health, and received advanced training from Baylor and Children's Hospital of Los Angeles. Please join me in welcoming Dr. Bindi Nayak. You want to go ahead and introduce him? Okay.
Sorry. Good morning. Thank you so much. Perfect timing. Just before we get started, we have been joined by the mayor. I believe I saw him somewhere. Mayor Turner. Thank you so much. We're so honored that the mayor could join us this morning. He will be saying a few words, and then I will continue with my presentation. Thank you. I don't know where he went.
Well, let me say good morning, and especially after an extended weekend, so it's good to be with each and every one of you. And look, I know you got a long agenda for today with a number of speakers, so let me kind of just dive right in. As I was thinking about my comments this morning, the pandemic, COVID, has been and is a global pandemic. Global in nature, all countries involved. Gun violence, however, is an American problem. And it is an American public health problem, the way I look at it. But there is no other country outside of the United States that are facing the issues surrounding gun violence like the United States. This just happens to be uniquely American. I was listening to this morning on CBS News, getting ready. There have already been like 278 mass shootings this year. So more shootings per day than there are days in the United States. And it just things just keep happening. In fact, and if you just drill down to Houston itself, and prior to, in 2019 and before, in terms of homicides, Houston faced less than 300. In 2019, I think it was something like 278. And then in 2020, it jumped more than 350 plus. In 2021, it was 475. And where we are as of this morning, 219 homicides. Now, ironically, it is 1% less than where we were last year. So in almost every category of violent crime in the city of Houston, our numbers are starting to trend down when you compare where we were last year, which is good news. And then domestic violence in 2021 was up more than 40%. So there are a number of elements. I simply want to, we already know that we have a problem. Just wanted to highlight some of them, the magnitude of our problems. But the reality is there are a lot of guns in this country. There are a lot of guns. In fact, there are almost 393 million plus guns. There are more guns in this country than there are people in this country. The United States makes up 4% of the world's population, but over 50% of the guns are in our possession. And then even when you drill down to Texas, I was in the legislature for some 27 years. Then the big focus, the big push was the concealed handgun. That came through. People had to get their license, their permits, and it required training. But in the last legislative session, now we have permitless carry, House Bill 1927. No license, no permit, no training. And so instead of pulling back on the reins, in the state of Texas, it's just moving forward at an aggressive pace. And then, so you got, which helps to create even a greater market or a greater love affair with guns. And it just doesn't appear that even now, the Texas legislature on its own is going to address the situation. And then locally, in terms of what's exacerbating the problems, when you add on to more guns, legislature making it more attractive, easier for people to get guns. Oh, let me also add, they lowered the age for guns from 21 to 18, okay? So it's harder to get cigarettes than it is to get a gun in the state of Texas. And then when you drill down in Harris County, for example, we have a huge criminal case backlog in Harris County, misdemeanor and felony cases, and I underscore felony cases. The backlog in Harris County is larger than the backlog of any county in the United States. And that's primarily for several reasons. When Hurricane Harvey came in 2017, it put a lot of our criminal courts out of commission. And quite frankly, many of those courts are not back online. When COVID came, no jury trials, so that created the backlog. So we have a huge criminal court backlog, cases ready to go. What that means is that there are people who have committed crimes who, their trials may be 2, 3, 4 years down the pike. And then when you add to the fact we don't have enough criminal courts, quite frankly, I think the state has only created one additional criminal court since the mid-'80s in Harris County. So we don't have enough criminal courts. And then we have too many people who are out on bail who are recommitting crimes. And then when you combine all of that to the fact that there are still too many people who are in crisis mode within our city. All of these elements, when you put it into the mix, makes it much very difficult. What are the steps that we are taking locally? About 4 years ago, I established the Mayor's Commission on Gun Violence. Doctor here was a part of that. Came up with a number of recommendations. They did a lot of hard work. I give a lot of credit to Haley Carter, who was a part of that. But it also required the legislature to take some definitive steps. That has not occurred, so we just have to continue to work on that. And then in February of this year, I put forth an initiative, One Safe Houston, holistic in its approach, not just one element or two elements, but very holistic. And it calls for more police in terms of even bringing more police to our cadet classes as well as overtime. So it calls for more police. It calls for the use of more technology because we have about 5,200 police officers in the city of Houston. Very difficult to cover 640 square miles. And so it also requires for the use of greater technology, ShotSpotter, license plate readers, cameras as a part of the mix. It also called for a gun buyback initiative, which will take place in July of this year. And then it spends a great deal of resources on our crisis intervention, people who are suffering from mental behavioral health issues, people who are suffering from substance abuse. We are spending almost $30 million just on our crisis intervention. Recognizing the fact that the number of domestic abuse cases has gone up, we've put together a domestic abuse response team, DART, and put a lot of resources in there and working with many of the stakeholders in this field to try to get to these situations much, much sooner. We are investing in our reentry program. Every year, there are about 13,000 people released from the Texas Department of Criminal Justice coming back into Houston-Harris County. And so we're investing more money in reentry. They need jobs and they need housing. And what we have found is that our reentry program is much more effective than even the state's program. It's working, so we're investing more resources there. And then we're utilizing our community assets. So putting resources into our violent interrupters program, credible messengers program, our youth initiative. Quite frankly, the city's summer internship program is a part of that. When I came in as mayor almost 7 years ago, 450 positions for summer interns, paid summer interns. This year, the number is more than 14,000. Because what we also recognize is that population between 16 and 24 are driving many of our crimes. And so the jobs program, the summer internship program, is for people 16 to 24. And our that young population are responding. And I want to thank the business community for responding, because over 400 businesses in our city are responding. The city is only offering 450 summer paid interns, but the private sector is offering the other 13,500 plus. And so it's law enforcement, but it's also community, and it's also investing in communities that have been underserved. So it is a more holistic approach. And is it working? I will tell you that in January of this year, and I look at the numbers every single morning, in January of this year in terms of homicide, we were about 65% above where we were last year. As of this morning, we are 1% less than where we were. So we've gone from 65% down to 1%, and in most of the categories, it's going down. So it is working. But let me quickly give a caveat. We are on the front line. The legislature does not allow us to restrict gun access or the venues. So we can't step into that space. Our hands are tied. The legislature needs to repeal House Bill 1927, permitless carry. It makes absolutely no sense. And it was said by all of law enforcement, the major police chiefs in the state of Texas, that if the legislature passed it, the crimes would go up. It took effect in September of last year, and the crimes did go up. So the legislature needs to act. And then there are a number of Texas big city mayors that met a week or two ago and decided, and Republican and Democrats, big city, decided that it was important for us to weigh in to the Texas legislature. So there's a letter that's already being prepared in which mayors and big city mayors in Texas are saying to the legislature, number one, you need to be meeting right now. There needs to be a special session right now. Saying to them that you need to implement universal background checks. You need to increase the age from 18 to 21. Reverse what you did a year ago and increase the age from 18 to 21, or at a minimum put in place a waiting period. We are saying the red flag laws, that needs to be done. Those are things you can do right now, and most of these measures are supported even by most Texans. And then we are saying that you keep pointing in the direction of mental health. And quite frankly, every country has mental health issues. I just think that's a red herring. But nonetheless, if you keep pointing into mental health, then Texas needs to stop being in the bottom 10 in terms of mental health funding. So if you're saying it's mental health, then you need to, in a real way, fund mental health, fund community mental behavioral health initiative, if you say that is the cause. But you can't say it's the cause and not provide the funding and then expect things to change. So you can't have it both ways. And then lastly, what we are saying is that as elected officials, we are employees. The people like yourselves, you are the employers. We work for you. And in this country, we've kind of gotten things twisted. So if Americans are saying, if 90% are saying universal background checks is what is okay, if the majority of Americans said red flag laws, we need to do that. If Americans are saying we need to address mental health funding, but if we keep voting in different ways, then things are not going to change. The question then is, who works for whom? So Americans, voters, moms, dads, need to decide how big is this issue and whether or not saving the lives of our children is even more important than dealing with inflation. So which one is heavier? Okay? Which one is more important? Because no single elected official has lost his job on these issues. And as long as that happens, nothing changes. So elected officials have to do more. But quite frankly, the voters themselves have to vote consistent with their interests. So this is a very heavy topic, but it's not going to change unless we drive the change. I'm a person of faith. I offer my prayers and my condolences, but my faith also says that prayer without work is dead. So you have to do more. And Texas needs to do more. And we need to demand that our legislature do more. So it's very real. School will be going back, opening up again in the fall. And let me tell you, as I close, how the legislature works. The session will start in January of 2023. When people put forth committees, that's just what I call a cooling off period. Because when the session starts in January, the hope is the focus will be on other things and that people will have changed and start focusing on other things, and then very few things change. There needs to really to be a special session now before our kids return to school in the fall of this year. Anything less is putting our kids in harm's way, and that makes no sense. And so I'm hoping that moms and dads will speak for their kids. Because if you think, as one mother said, that you will not find yourself in the same situation as many moms and dads in Uvalde, then simply do nothing. But it is time for all of us to draw the line and say no more. So thank you for having me. Thanks for having this conference today. Quite timely, quite needed. But my hope is that after we go through these forums, that we will tell your employees, people like myself, to do their job or get fired. Thank you very much.
What a great way to start the morning. Thank you so much, Mayor Turner, for your words of wisdom. Okay, so thank you for the opportunity. I'm Bindi Naik Mathuria. As Rola said, I'm a pediatric surgeon. I'm also honored to recently join Baker Institute as a fellow to start this initiative in firearm safety, and we're very excited today to have this conference. The work I'm going to do today, present today, is funded by the CDC. And please note that a lot of the data that I'm presenting here today is preliminary. So specifically for the slides that say preliminary data, please don't share that. Please don't quote that. Please don't put it on social media because it's not quite ready yet. We know this is a problem. I don't have to go through this again. Every day in America, a lot of people are killed by guns compared to other developed countries where 26 times worse. More than 40,000 Americans are killed per year. There's undeniable disparities. Black Americans are 10 times more likely to be killed by guns. Domestic violence is a real problem, especially for women. Firearm deaths and homicides are on the rise, both suicides and homicides. This report from the CDC was presented this year as a public health emergency because look at the very sharp rise between 2019 and 2020. And children are also suffering from this. So in 2019, death by firearm became the #1 cause of death in children in the country, surpassing that from motor vehicle crashes. Just take a second to think about that if you didn't already know this. That's really, really significant and really, really sad as someone who spends my life taking care of children. There are many types of gun violence. Most of the attention is focused on fatal injuries, right? Homicides, suicides. All the data I showed you, all the data anyone quotes is talking about deaths. But what about those that don't die? There's a lot more non-fatal injuries than fatal injuries. As a trauma surgeon, I see, especially in children, a lot more children coming into the trauma centers and being shot and injured and maybe have significant disabilities or certainly psychological trauma. But that counts too, right? And so we're not even talking about that when we're talking about death, it being the #1 cause of death. The burden is even bigger than that. And there's very different types. It's a very complex problem. It's not as easy as saying, oh, let's just give bike helmets to everyone and stop, crashes from bikes. It is a multifaceted problem. There's different types of firearm violence. The assault homicide is by far the most common, by far, especially in major cities, especially in urban centers. This includes interpersonal violence. This includes domestic violence. This includes mass shootings. Mass shootings get a lot of attention, as they should. It's horrible, especially what happened recently. But it is a small proportion of the overall injuries and deaths from guns. The second major type, especially in children, is unintentional, or some people say accidental. We try to avoid the word accidental, and in the rest of this presentation, I won't be using that word. And the reason for that is because we're trying to make the point that it's not just an accident. This was due to negligent storage, and these weren't intentional. A lot of times the kids shoot themselves or shoot each other, and therefore they are considered unintentional. The other one is suicide, major problem, especially in adults, but rising in children and adolescents, also sometimes referred to as intentional self-harm. And then one that's not talked about much, but one that we focused on in our study is a bystander shootings, or straight bullets, just being in the wrong place at the wrong time. As a trauma surgeon, I see a lot of these kids come in, especially in Houston. The bullets could just come through the walls of the homes, through the doors, or they're just standing at the bus stop. These are also a major problem. On the day I was preparing this presentation, I just pulled up the top stories in Houston. They're all regarding guns and deaths. I can't even turn on the news anymore because my 8-year-old is just, is already numb to this, sadly, but still, I don't turn on the news anymore because this is all they ever talk about. It's undeniable that Houston, we have a problem, but what can we do about it? Dr. Levine, my associate, is going to be presenting next, and he's going to go into this in more detail, but the murder rate in Houston has been rising for a while. It's definitely worse now, but it has been rising for a while. We've always had a problem. I've worked in trauma centers such as Ben Taub, and then in Los Angeles, and here, many of my colleagues who are trauma surgeons know this. We take care of a lot of people injured by guns. The problem is we only see one small side of it. There's a lot more to it. And so when we thought about how we can tackle this problem, we just wanted to know more. We wanted to know about the full spectrum. How many total firearm injuries are happening here in our county, both fatal and non-fatal? Where are these injuries happening? Who are they happening to? Why are they happening? And so using a public health approach to injury prevention, the public health framework is first to define the problem. Well, with this ban on firearm funding for the last 25 years, we're still at step one. We still need to define the problem. And so our work here today is focusing on the first two steps of this framework, which is defining the problem and trying to identify some risk and protective factors. And this is our program here. Basically, it's combining as much data as we can from as many sources as we can to try to get a full picture. And that's including all the data from all the level 1 trauma centers in Houston. That includes the non-fatal injuries, the fatal injuries, the shooting locations, shooting intent, and as many social correlates as we can find, including data on the shooter if we can find it. Definitely on the victims, where they come from, what they do, what their background was. And then combining that with medical examiner records, because a lot of the deaths that died, people that died at the scene, we never see at the trauma centers, and we're missing that data if we don't count them. So that's fatal injuries, it's residents in shooting locations. Shooting intent is a big one. We spent a lot of time really trying to figure out what the intent was and why it happened from the data that we have. And then combining police records of all crimes involving guns with or without injury or death, because if there was a gun there, then there could have been an injury or death, and that's still a risk factor. And also focusing on where these injuries are happening to try to identify hotspots. All of this is then analyzed, and part of the analysis is geospatial analysis using Census Bureau and Planning Agency. In Houston, it's the Houston Galveston Area Council, which has a lot of really detailed neighborhood level information that can then give us neighborhood level risk factors and hotspots. And the goal of this is based around the injury prevention framework, the socio-ecological model, to try to identify individual, relationship, community, and societal factors that all lead to gun violence, each per different shooting intent, because they're also different. Okay, so what do we have so far? This is the data in adults. You can see that there's definitely been a rise between 2018 and 2019. There was a 50% increase. Note that non-fatal injuries were 2 times more common than fatal injuries in adults. So another way of putting that is that 1 in 3 adults who were shot died. In 2020, more than 2,000 adults were injured or killed by firearm in Harris County. So again, you heard the mayor say about 300 homicides. That is a number that's quoted a lot, but 2,000 were shot and got injured. So when you add in the non-fatal injuries, it's even bigger. It's an even bigger problem. Okay, and this is corroborated by the HFD data. So this is pre-hospital data from HFD showing that in 2020, there was a sharp spike in these shootings. Whether or not that's related to the pandemic, I'm not here to make any assumptions. I think it's a multifaceted problem. This is just the data showing that there has been a rise since around that time. And you can see some of the hot spots of the shooting locations in that picture there. When you compare the Harris County adult firearm death intent to national data, it's actually interesting. We have more homicides than suicides, and this has been consistent for the past few years. So in our time period, 2018 to 2020, about 59% of the deaths in adults were from homicide and 40% were from suicide. Unintentional is a very small problem in adults. Whereas nationally, 60% are from suicide and 36% are from homicide. We're still collecting data on the adults, so again, this is extremely preliminary, but we are working towards. I just wanted to show an example of the types of data that we're collecting, and that some of the conclusions that we might have. For instance, for suicides, we know that it's about 40% of firearm deaths. When you look at all the suicides in Harris County, about 60% were from guns. Median age is about 40s. Most commonly affects males, white non-Hispanic ethnicity. They usually occurred at home using home firearms, and they were more common in suburban areas, and there was mental illness about 50% of the time. Again, preliminary data. This is still work in progress, but we have collected a lot of the pediatric data, and so I'm going to go into a little bit more detail on that. So the pediatric data in Harris County, and the pediatric means under 18, of 0 to 17 is how we defined it for this study. First of all, it's clear that there's a huge increase. Look, between 2018 and 2020, 76% increase. Remember, this is fatal and non-fatal injuries. That's a lot, right? You can see the breakdown there on the injury types. I'll go into that in a little bit more detail. In 2020, more than 200 children and adolescents were injured or killed by firearm in Harris County. It's a lot, too many. How are they injured, or why? That's what we're trying to figure out. So 54% of them were by assault. Unintentional was 19%. That's really high. I don't know if you follow any of these numbers, but if you look at the national data on unintentional shootings, it's talking about homicides. It's usually about 4% or 5%. So some people may make the argument, oh, okay, fine, it's just such a small problem. Why are we focusing on safe storage so much when there's so many bigger fish to tackle? Well, it turns out if you combine fatal and non-fatal injuries, it actually is a really big problem in children. Almost 20% of children could have been prevented from being shot. And then on top of that, there's a suicide, which they usually, happens from guns finding at home. It's low. It's actually 6% in our data here. I think that is rising, but this is the data that we have for those 3 years. Bystander shootings, which we very carefully separated from assault because they have different risk factors, are about 10%. And then in 10%, we just couldn't figure out why they got shot. 1% of cases were from Russian roulette, which is we didn't know whether to classify that as intentional or unintentional because it's Russian roulette. But sadly, that also happened here. So in children, non-fatal injuries were 3 times more common than fatal injuries. Another way of putting that is that 1 in 4 children who were shot died. And when you look at the breakdown, these icons are representative of the proportions. So you can see that Black children were by far most affected. 15 to 17-year-old range age group were by far more affected. But then look at the others. Hispanic was not far behind, Asian or other races, and then white was least commonly affected. And then the 0 to 5, 6 to 11 age groups were low, but still significant. I mean, these children should not be getting shot, and they were. 84% were male. However, the shooting intent breakdown was interesting. So whereas assault and unintentional injuries were similar, the bystander shootings were certainly more in females, just wrong place at wrong time. And then the suicides were certainly higher in the females, proportionally to males. 13% of the females that were injured or killed by guns was because of suicide. So breaking it down a little bit more by age, certainly the 15 to 17-year-old age group is the most affected, but you could see that the unintentional shootings, those marked by orange there, were really high, were much higher in proportion in the younger age group. You can see that suicides marked by the gray boxes there started around the middle school age. That bystander shootings were across all races, and unintentional shootings were also across all races. When you break it down by race, these are crude rates that are shown here. You can see that in proportion to in proportion to the population of Black children below 18 in Harris County, they were significantly affected by assault, as with the Hispanic population, but that suicides was highest in the white cohort. But the odds of dying by suicide is about 3 times higher in white children than Black children. And then unintentional shootings were common in all 4. Or not common, but the kind of similar prevalence in all 4 race groups. What about the injuries? So these are the injuries that we saw at the trauma centers. You could see that about a third of them were superficial, so those are the non-fatal ones, but there's certainly some serious ones. 27% of them required ICU, 58% of them were serious enough to require operation. But when you think about the non-fatal ones, the 24% of them had residual symptoms after 3 months, so maybe they couldn't walk, or they had a lot of pain, or they had a lot of issues, and we're not even measuring the psychological impact because there's not a good measure for it. I assure you it's more than 24%. And then 12% of the children that come to the trauma centers, that made it to the trauma centers with firearm injuries, died, vast majority from brain injury. Those are the ones that can't be saved. We have excellent trauma centers here in Houston, and because they're so centrally located, the survival when people are brought to trauma centers with gunshot injuries is high. So that doesn't mean that they weren't serious. They could still be serious if they survive. This is one of my favorite patients, and the reason that I really got inspired to do this. This is a little boy who was shot just sitting in his home, and a bullet came through the door. And he survived, but he was in the hospital for a really, really long time. He went through so much pain. It was so hard watching him, watching his family. They were completely destroyed. He could barely walk. He had so many problems. He's doing fine now, thank God. But it took a really long time, and he's never going to recover from that. He's never going to have a normal life. And so this is why I want you to, again, making the point that non-fatal injuries from guns are just as bad. And we need to include them when talking about gun violence. So we look for some social correlates. Why are these things happening? Who are they happening to? Some proxies for poverty or lack of insurance. So 86% of our cohort had public or no insurance. The majority of these were in the assault and bystander group and in the unintentional shooting group. 39% of them lived in apartments, so that was about half the assault and bystander group, about a quarter of the unintentional group. The children that committed suicide were much less likely to live in apartments, much more likely to live at homes. 52% of them had single-parent households, and again, this was more common in the assault bystander group. This all kind of goes to this concept of structural violence, which you may have heard about, but it's a way of describing gun violence that goes to the root causes of economic inequalities, particularly in Houston and other large urban centers. It has to do with segregated housing and underinvested neighborhoods. And here are some more social correlates. So alcohol or drug use was about 29%. Reported history of interpersonal violence, about 30%. Criminal activity during the shooting, as far as we could find, was low, 16%, and gang affiliation was also low. But note that a lot of this data could not be found, and the place we got this from was from the hospital charts and a little bit from the death records. And so in order for us to really know what's going on, we really need to, as at trauma centers, make better efforts to collect and document this data, because it's really important for surveillance and for future planning. When we looked at risk factors regarding shooting location, and looked at home, whether the shootings happened at home, whether the guns were found from home or at a home of a family or friend. 90% of the suicides, not surprisingly, I guess, happened at home. 76% of them, of the unintentional ones, home or home of a family or a friend. And a lot of the bystander ones, poor kids are just sitting at home and got shot. It's really sad. 19% of the assaults. And then if you look at the cars, for the unintentional and the suicides ones, these were usually because of family guns that were left in the cars, another 7% and another 3% of suicides. The assault bystander ones were most commonly in the street or parking lots, and we looked at public parks, and the incidence of this was low, which I guess is good in a way. So in summary of this slide, secure household firearm storage could have potentially prevented 93% of suicides and 83% of unintentional shootings, or overall 1 in 4 pediatric injuries or deaths. Digging a little bit deeper into suicide risk factors, known mental health or illness, most commonly depression, was found in 65%. Known suicidal ideation, where they had mentioned to a family or friend that they were thinking about suicide, was really low. And if you look at the family-related stressors, the events that occurred right before the shooting happened, it's about 30%, and these were arguments with parents fight or divorce, parents took away cell phones. I have a 13-year-old, so it's a little bit scary because this happens every single day, right? And then the other thing we found is that 20% of the teenagers were able to access firearms that were stored in safes that were locked. They knew how to get them. And drug use, most commonly marijuana, was about a third. Known alcohol use was low. This is data from Dr. Levine that I'm showing a little bit here just to give you a brief overview of where these shootings are occurring. And you can see that the intentional and the bystander shootings occur in similar areas, kind of inside of Beltway 8. And then the unintentional and this injuries happen in the urban and suburban areas of Harris County, whereas the suicides are happening in the suburban and rural areas of the county. So again, this all goes to kind of different risk factors for each shooting intent. So putting this all together, again, this is very preliminary, but this is a potential framework for suicide, for pediatric suicide in our county, and you can look at what we found so far regarding factors that go to individual relationship, community and societal factors. You can imagine how a lot of this can be used for injury planning efforts in the future. And then here's one for unintentional shootings that's a little bit different because there are different risk factors involved. So to summarize, firearm injury for people of all ages is on a rapid rise in Greater Houston, as it is nationally. Homicides are more prevalent than suicides. in both adults and pediatrics. In children and adolescents, 20% of injuries are unintentional. Combined with suicides, safe or out-of-home firearm storage could have potentially prevented 1 in 4 pediatric injuries and deaths. Disparities in race or ethnic group, gender, and socioeconomic status exist regarding shooting intent. Social, individual, and neighborhood correlates can serve as risk factors that can guide injury prevention program planning. And finally, a plea. Trauma centers should record more risk factors and shooting intent information for us to improve ongoing firearm injury surveillance. Thank you so much. I'd like to thank my research team, without whom none of this would have been possible. My collaborators, Dr. Pompey, Dr. Oluyomi, Dr. Kane, Levine, who we'll hear from soon, and my collaborators at UT, at the Forensic Institute, and then our law enforcement, HPD, Harris County Sheriff's Office, Houston Fire Department. Thank you to the Texas Children's and Baylor Departments of Surgery for grant support, assistance, and Baylor iQuest, Baker Institute for their support and for hosting this wonderful conference today, and finally to the CDC for their support of our work. Next, I'd like to introduce my colleague, Dr. Levine. Ned Levine is an expert in geospatial analysis. He's an urban statistician. He's been doing this for many, many years. He's worked with crime data. He has also looked at the homicides in Harris County in much more detail than we're doing right now. He's been doing this for many, many years, and so it's an honor to have him here to share his wisdom with us today. Thank you.
Okay, thank you. First of all, how do I flip this thing? Is this it here? No, oh, this,
The big button.
the big button. So how do I go back?
Probably this.
This goes back. Okay, all right. Okay, good morning. I want to thank Dr. Nayak and Dr. El-Serag for inviting me to this, I think, very prestigious and very important conference. As Dr. Nayak said, I'm a sort of urban researcher, urban statistician. And consequently, I tend to look at firearm violence from a data viewpoint. So I'm going to give you that perspective. Good. The first thing to realize is that firearm crime is a very rare event. And by rare, it means only a small percentage of the population are involved in firearm violence, either as a perpetrator or as a victim. The vast majority of people do not experience this in any one time period. This means, I mean, if you think of it in terms of trying to understand it, it's not a behavior that's common. And consequently, explaining it and modeling it is very difficult because we're talking about really small proportions of the population. And I mean very small proportions of the population. Now, we have a long history of research on violence in America, well over 100 years worth of research. And if you want, the environmental or neighborhood correlates of violent crime are pretty well known. You know, dozens and dozens of studies have been done on this. I mean, we have poverty and all its associated characteristics associated with poverty. You know, broken families, alcoholism, drug use, high unemployment rates, dysfunctional children leaving school early and, you know, getting into trouble and so forth. Lots of research have shown this. There's a lack of legal employment opportunities, and consequently illegal employment opportunities emerge in such communities. Discrimination, the refusal of banks to loan money to homeowners in those areas, the refusal of businesses to invest in those areas because of high crime are well known. Lack of community amenities are there. You know, weak community organizations, and so on and so forth. We have tons of that research, as I said, 100 years worth. But these are not causes. These are correlates. Essentially, these are places where firearm events occur, even though the vast majority of people who live in those communities do not get involved in violent events. I mean, that's what we're talking about here. Consequently, in the last 20, maybe 30 years, there's been a shift to trying to analyze the triggers of violence, the individual characteristics associated with people who commit violence or, in turn, who are victimized by violence. And some things are known. Several studies have shown physical and sexual abuse in childhood is associated with violence later in life. Alcohol and drug abuse is associated with it. Dr. Nayak's study is showing that. There's also, there are also prolific offenders. There are people who commit an enormous number of crimes, both property crimes and violent crimes. And these have been documented in a number of cities, and I suspect it's true here in Houston as well. And so actually a sizable proportion of all the crimes that are committed by really a handful of people. And so that's why I said trying to understand and trying to isolate these individuals is very difficult. Dr. Nayak's study is important because she's trying to link individual characteristics, at least as measured by the medical records, with the environmental correlates. And that's what we hope to do. There are also, and this is what I'm going to talk about for the rest of my time, is macro societal factors that affect violent behavior. And they're not really very well understood. People for a long time have been trying to explain them, but they're not easily understood. Let me try to show you why. First, let me jump here. In the United States, there are two measures at the national level of homicides. There's the FBI's data set, which comes from the Uniform Crime Report, but with much more information from what's known as the Supplementary Homicide Report. These are reports from law enforcement agencies. Over 18,000 law enforcement agencies in the United States send reports annually to the FBI, who compile them. The FBI pays them. It's on a voluntary basis, but since they get paid, they tend to do it. And they put out a crime rate, an annual crime rate. The second source is the National Vital Statistics System, which is managed by the National Center for Health Statistics, which is part of CDC. This is where these are reports from the medical examiner and coroner's offices, who then send it to the state, who compile it, who then send it to NCHS. Now, the two data sets, they have a lot in common. The Vital Statistics System is a mandatory, so all deaths are registered by definition, whereas the FBI system is voluntary. But they tend to track each other well. Typically, the NCHS system, the Vital Statistics System, gives about 5 or 10% more, let's say murders, homicides, than the FBI system, but they track each other well. So like here's a study that looked at the two over a 20-year period, 1981 to 2011. And you can see, the Vital Statistics System is slightly more, but the two tend to go in tandem. So let me go back, and where are we going? Oh, sorry, I'm going back. I got to go in the wrong way. Here we are. This is what I wanted to show you. I was able to obtain data from the FBI system going back to 1950. Okay, I haven't yet found one for the Vital Statistics, but we're looking for it. Okay. Now, what you see here is an interesting thing. If we start, I don't know what was happening after the late 40s, but let's say is there a cursor I can, does this thing work for that? this, I can push the button there. Oh, you do it on the screen. Oh, hold it, wait a minute, I'm gonna go back here. So this points,
Yeah.
okay, new technology. All right, I still can't see what I'm doing. All right, anyway, you can see it. All right, so, you know, early 50s, it's sort of flat, the murder rate. This is the number of murders and non-negligent manslaughters. That's how the FBI defines it, per 100,000 persons in the US. It's flat. But starting sort of in the late 50s, there's an uptick, and it rises for, is this? Nah. And it rises for 20, 25 years. It just keeps going up, it keeps going up, and it hits a kind of a peak in the late 70s. Okay. Then it sort of bounces around for another 15 years, going down, then it goes back up, and then it goes down again for 4 or 5 years, then it goes up again. And so if you can think of this, these are phases here. So we have an up phase, which raises the murder rate to a quite high level, something in the order of 10 per 100,000. And it sort of bounces around for about 15 years. And then there's a long down period that's going on, starting about I think 1993 is sort of the last year. Then it sort of drops precipitously. Now, researchers have tried to explain this, and nothing really explains it. Demographic factors can't explain it, economic factors, political, correctional policies. Further, if different people, different researchers, different time periods would interpret this differently. Somebody who's looking at it, say, in 1980 would say, wait, we've had this huge increase. Why is it going on? What can we do about it? You know, somebody looking at it in 1993 says, well, it's sort of stable. And then, you know, and somebody looking at it in 2011, 2012, will say, wow, it's been going down. We've got control over this problem. But then look what happens. It starts going up again. The low point is 2013 in the latest, and now we're on an uptick. Okay? Now, is that a blip or is that a trend? I don't know, you know. Let me see the next one, go to the next one, it showed that. All right, so let me go back for a second. Go back. Here we are. No, it's the same. I'm having trouble with it. I have data on Houston going back to 1995. So let's look at Houston here. What am I doing? I'm going the wrong way, sorry. Okay. Excuse me for, there we are, Houston. Here we are. This is what was reported to the FBI. The FBI provides data on Houston up through 2018. For 2019, 20, and 21, we use the data that we got from HPD to do the count. But what you see is, you know, there's a down for a while. Then there's a jump in the middle of the 2000, 2005, 6, 7, something like that. And then it starts dropping again. So it's more volatile than the national rates. The low point is hit 2011, then it starts up. Now, there's a jump in 2020, and so the COVID year probably had something to do with it. But this trend started well before COVID came along, okay? And what I fear is that it's going to continue well past the COVID period. The FBI also collects data, documents data on violent crime. Violent crime are things like assault, aggravated assault, rape, murder, of course. Yeah, I think those are the three big ones. And they, again, provide data on Houston through, through 2018. And again, the last 3 years we calculated from the data HPD sent us. And you see this thing is going up. You know, it's again, this trend started well before COVID, okay? Okay, here's the data we got from them so far. What do I have, 5 more minutes? 2 more minutes? 2 more minutes, okay, all right. So between 2018 and 2021, there were 41,358 incidents in the city of Houston involving a firearm. That's a 4-year period, so it's, a little over 10,000 a year. Okay, here is the types of crimes involved. They're mostly aggravated assault and robberies. These include crimes where somebody was injured, somebody was shot, where a gun was discharged but no one was shot, where a gun was used but not discharged, such as a robbery, and this category called weapons law violations, which we still don't understand. But the 2 big ones are ag assault and robbery. And further, this is the increase we're seeing in the data over the 4 years. That yes, there was a big increase in 2020, but there was a big increase the year before, and there's a big increase the year after. All right, so here are the conclusions, and they're tentative. Much as I find it difficult to accept, I think firearm violence will probably continue to increase at least another 5 to 10 years from now. I hope I'm wrong. I really do hope I'm wrong, but I fear I'm not. There's too much momentum. You see these long waves here. This is going to have some implications. First, more resources are going to be needed to address this problem. That's going to affect law enforcement, it's going to affect EMS, it's going to affect medical treatment, community youth programs, after-school programs, gang intervention programs. And most of these programs are struggle to get resources at the best of times. Just imagine an increase in violence that is coming, what pressures it's going to place on them. And that's a problem. Secondly, in addition, elected officials are going to get some of the blowback. You know it's going to happen, because people will start saying, why haven't you done anything about the firearm violence? And finally, the final point is, this is a more in the weeds type of methodological comment, but for people who run programs, they're going to need to try to evaluate those programs. They have to anticipate that there might be an increase just simply due to these systemic kind of societal forces that we don't really completely understand. And there are methods, there are Bayesian methods that try to correct for this, where you forecast the expected number if nothing changes, and then you can compare whatever you're doing to that expected number. But I think we have to live with this for a while. Anyway, thank you very much, and Andy, yes, okay.
Thank you. We don't have time for questions because it's time for a coffee break, but if you do have any for us, then write them down, and in the next Q&A, we could try to address them, or we can email you if you don't have time. Thank you. I'm sorry, it's not time for coffee break. But you can go and get a quick cup if you need to. I'm sorry, we were supposed to move on with the next session. That was my fault. Dr. Aiken, am I supposed to introduce her? Oops. Okay, sorry. Sandy, would you like to introduce Dr. Aiken?
I could do it. It's fine.
Okay.
Dr. Hafiz, do you want to come up? Go ahead and have a seat. Sandy Elwood. Good morning. Our next session is on unintentional injury. I'll let the panelists come and join us. I'm not sure where Ms. Ross is, if she can join us. Come on up and join us. My name is Mary Aiken. I'm a pediatrician. I'm the chair of the Department of Pediatrics at the McGovern Medical School at UT Health here in Houston. I am also an injury prevention epidemiologist. And it's my real pleasure to be here today and to share all this vital information with you about unintentional injury. For this session, there are 3 speakers, and we'll let them each present their research and programmatic efforts in this area. And following the 3 talks, we'll collect the cards that are on your table that look like this, if you have questions, and we'll take questions as a group. So our first speaker this morning in this session is Dr. Sandra McKay, one of the co-conveners today. Dr. McKay is a non-resident fellow here at the Center for Health and Biosciences at Baker Institute. She's an associate professor in the Department of Pediatrics at McGovern Medical School, UT Health Houston. A practicing general pediatrician, Dr. McKay's research focus is on innovative programs in injury prevention education, and particularly around firearms injury. And she is a strong advocate for children's health in a variety of areas. Please welcome Dr. McKay.
Thank you so much for having me today. I obviously have no relevant financial disclosures. We're going to go over a review of the need for education on safe storage counseling with our healthcare providers and understand a little bit of the patient preferences on receiving safe storage counseling and reflect on some of the opportunities that we have for novel partnerships in firearm safe storage. We all know why we're here today. This crossover from motor vehicle accidents being the leading cause of death in children to firearms has been something that we are all deeply concerned about, and that's why we're here. What we know about parents is that we know that parents do think that pediatricians should be advising about safe storage counseling within the clinical encounter, and only a small percentage of parents would even firearm-owning parents would even be offended if we had advised them to remove the firearms from their home for safety purposes. But only a small percentage of pediatricians actually do routine counseling on safe storage, and only even more rare pediatricians will actually provide safety devices during the clinical encounter. So why is this the reason? Because we have a consistent lack of comprehensive education at the undergraduate or graduate medical education level. At the time of the Parkland shooting, there were only 2 medical schools in the country that were doing any kind of education on gun violence. And I'm proud to say that McGovern Medical School was one of those 2 schools. And currently, there's only about 1/3 of pediatric residency training programs that offer any kind of formal firearm safety counseling. And when you talk to pediatric residents, only about 50% do any kind of routine counseling on safe storage. And they report that they don't have any training, they don't have any time, and they don't want to upset or offend their parents. So this is something that we can definitely help and intervene with. So what we developed with at UT was a 2-hour live workshop that we did. Initially, we incorporated within this workshop a live presentation from our campus police about firearm safety principles, which we later adapted to a video presentation that I did with my personal firearm. And then we also incorporated epidemiology and firearm safety counseling, and then did these role-playing scenarios to allow the resident to develop some skill-building session on how they could do counseling with their patient and with their families. And what we found was, in general, residents don't own firearms. They don't have a lot of background with what firearms are, and so they felt very uncomfortable even addressing those conversations. And overall, after the workshop, we saw a significant increase in their comfort in asking, discussing, and even believing that it was an effective intervention. And what you can see here is looking at the blue line, because this is kind of a busy slide. Blue line was before the workshop. And then we looked at intervals at immediately, 3 months, and 6 months after. And you can see that at all points afterwards, we saw that they all surpassed the blue line in their self-comfort on asking, initiating conversations, and viewing as effective interventions. And even 6 months after the workshop, residents were 5 times as likely to counsel about firearm safe storage. So if you train people, they're educated, they'll learn, and you can have good interventions. And what COVID did was it gave us this wonderful gift to be able to implement this workshop in a virtual platform, because I have to look at the silver lining when we can have it. So we utilized our partnerships and leverages with UT Southwestern and was able to see how we can implement this on a virtual platform and compare it to what we did here at UT Health. And what we found was with our firearm safety counseling patterns, we saw this shift where you can see here in blue was what the reports were at 6 months after at UT, and you can see that the pattern of rarely counseling 6 months after the workshop, you see that shift happen where they were reporting they were rarely not counseling where they were rarely counseling not counseling at that 6-month mark. So we saw that pattern was very similar between the UT and the UT Southwestern program, showing that our intervention did work. So that virtual versus the in-person was very similar in our results. So it was very promising to us. We were able to expand this workshop to both not only pediatrics, but also to other specialties as well, internal medicine, psychiatry. So this is very exciting for us as an organization. And also we were able to develop partnerships and leverages to take the framework of this and collaborate with Vanderbilt University to create a completely asynchronous platform as well. So this platform was used for this program called SAFER, which is available through the American Academy of Pediatrics in a collaboration with Vanderbilt, and I serve on the steering committee in the development of this. And this is another opportunity for people to become educated on how you can provide safe storage counseling. But as we're educating ourselves on having these more competent relationships with our patients and talking and screening, it got us thinking, what do our patients and parents really want to hear? And so we surveyed our patients. And so looking at our pediatric clinic population, this is our primary care pediatric clinic that's across the street over at UT Health, where we service about 4,400 well child visits annually. It is a primarily managed care Medicaid clinic where we have about 83% of our patients are managed care Medicaid. We predominantly service patients that are low socioeconomic status, a lot of diversity within our clinic where 55% of our patients are Black, 25% Hispanic, and what we asked them was a 22-question survey where we asked them a bunch of questions. Gun ownership, what do their current safety storage practices are. We asked them a lot of questions about their risk perceptions, and you'll hear a little bit more about that from Dr. Hafiz in a little bit. We also asked them about who their preferred messengers were, and we saw some of these wonderful responses here. And what we found was when we asked them, should the pediatrician provide firearm safety counseling at the well visit? And it wasn't a slam dunk. So you can see here the questions were really kind of mixed. And when we look at the strongly or somewhat agree here in blue, it's about a little over a quarter of the patients that were strongly agreeing that the pediatrician should be talking about it. And about 37% of the people were strongly or somewhat disagree. So it really got us thinking, who do they really want to hear from? And so that was one of the other questions that we had. And the messengers that they prefer to talk to about safe storage were family members, law enforcement, and firearm retailers. In fact, doctors were like the last one that they had ranked on this list. So that got us to surveying our firearm retailers and asking them, who are they talking to about this? This is like, we know what law enforcement is saying because we hear their public service campaigns, but we don't really know what firearm retailers are talking to their customers about firearm safety. So we asked them. And so within our survey that we did, we talked to a total of 85 ranges and retailers in the greater Houston area. We asked them initially, what safe storage devices do you sell along with the safe storage device that typically comes with the firearm purchase? And we found that in general, locks and safes are the preferred device that is sold with on top of what comes with your typical device. But what we also found was that retailers and ranges, by far the majority of them, provide additional safety information above what is typically provided with point of sale, right? All firearms handgun sales have to come with the ATF's child safety handout. And everyone says that most everyone says that they provide additional firearm safety counseling. But the variability is wide. So what we'll find is retailers like to provide additional handouts. The most common one that they reported was the National Shooting Sports Foundation handout that they like to additionally provide. But then there's also several that do a lot of additional verbal counseling. They said that they will talk to their customers, ask them what they are preferring to do. They said they'll talk with them about scenarios, may talk with them about hunting, and they'll go through a lot of various different things that they'll talk with them about, as opposed to ranges, which will tend to refer them to a variety of different classes. Additionally, 20% of them reported providing suicide prevention materials as well. So that got us thinking about opportunities for collaboration within our community. So we identified this gap of not having consistent messaging around safe storage, especially when we're looking within our community, as well as finding this trusted messenger concept of maybe the patient's not really wanting to hear all these messages from us in that healthcare setting. And honestly, they're coming to us once they hit age 3. They're only visiting us once a year anyway in the primary care well child visit. Are there other opportunities for us to engage within the community? And then trying to find that right partner with us as far as who can we collaborate with in the community and how do we build those bridges? And what we did was we were able to secure a grant with the Safe States Alliance and develop a relationship with the local firearm range, the Texas Gun Club, to develop a program where we could reduce firearm injury by promoting safe storage counseling efforts at point of sale. And so what we've been doing is a series of qualitative interviews with all of their retailers at all points of contact, whether it be the president of their organization, all the way to the person who is hitting the button at the customer cashier counter line, and looking at their knowledge and attitude around providing safe storage counseling at all the various levels of contact that they have, whether it be the gunsmith, the range handler, whoever's providing their classes, looking at their barriers, effectiveness, ease of integration, and whatever resources that they may provide. And we've learned a lot of information as we've been conducting our interviews, and a shout out to my team collaborators, Mike Garcia and Caitlin Jetelina, because they've been a great team as we've been collaborating and learning all this really rich qualitative data. And so some of our preliminary results as we've been continuing to kind of weave through these hours and hours of data and interviews that we've been doing is the first thing that we're learning is language matters, right? So we've been developing this kind of almost data dictionary. So what we've learned is there are certain terms and terminology that are really important for the firearm retailer. So one of the first things that came out is like the word firearm is important. So the preferred term is firearm and not gun. So when they're talking in that encounter, in that space, we want to use the word firearm and not gun because that's really important for them. And then other themes that have emerged are this kind of idea of reframing the concept of dangerous, right? For the firearm retailer and for most firearm owners, especially if it's where they're in the business of having their firearm for, like, you know, if they're a law enforcement or if there's something that they're using their firearm on a regular basis, they're not seeing their firearm as a weapon. They see it as a tool, as something that they use on a regular basis. So if you're using messaging on safe storage as, hey, that's dangerous, you need to lock it up, it's not going to resonate with them because they're not seeing it as something that's dangerous. So using that danger mechanism in your messaging is really not going to be as effective for you, right? And so maybe you need to reframe how your messaging is when you're thinking about that dangerous concept. The time is there. They spend a lot of time with their transactions because they want to make sure that the person, the customer that they're serving is actually purchasing the right firearm for them, you know, and they actually went through and discussed, you know, like they spend a lot of time with their transactions. They don't want the customer to not buy the right firearm for their purchase either. So, you know, they have a lot of time during these transactions. There's a lot of time that they're spent, you know, going through the background checks. So they have time. They feel like doing this type of program is something where they could incorporate safe storage counseling within their procedures because it's not a rushed transaction. You're not going through an express lane checkout when you're doing these kinds of things. There's adequate time for them. But they also commented on the resources. They commented that some of the handouts are really poor, they're very wordy, a lot of legalese within them, and there might be some opportunities to improve some of those resources that they could have. They do feel like they're the experts on firearm safety. They're the experts on firearms, so they feel like they could really, you know, speak safely on safety, and that they feel like they could really, you know, take ownership of that. They felt also that this might be a space to discuss something around, you know, suicide prevention. However, they did feel like they had some concerns on that because they're not trained to recognize red flags on mental health, but would ask, you know, if that was something that they could maybe explore some opportunities for learning about these red flags because, hey, you know, people are coming there to buy firearms. Firearms are dangerous to some people, right? And so it would be important to learn about these red flags on mental health when they're purchasing them so that they could become more equipped on this. And finally, we learned that they want to be involved. Actually, some of the first things that I heard was like, hey, no one's ever come to us before. Why hasn't anyone ever come to us before? We really want you guys to come talking to us. This term was thrown around a lot of the almighty academia sitting up there in your ivory towers making decisions without involving us before. Why haven't you guys come talk to us? Because we deal with this all the time, and we know firearms. We sell them. We deal with them all the time. Why don't you guys get us involved? Because we we are players, we're in the same field here. And also the idea of giving each other shared credibility, because the message that I give into the clinical encounter when I say you should lock up your guns becomes much more credible when the firearm retailer also gives that exact same message. So having that shared and unified message can give each other credibility, especially when we're discussing that with a patient and trying to improve safety. And then we also have had shared, they've shared really rich personal stories on their experiences during those firearm sales when they've said, we really had to, deny sale to someone because of, they gave us a lot of really rich personal examples, which, as we continue to do our data analysis, it's going to be really exciting for us as a team. So in conclusion, when we look at firearm safe storage counseling, it's really important that we find the right language in order to develop that right messaging. And that messaging should be consistent across multiple areas, healthcare, law enforcement, and our retailers, so that we can continue to develop our educational priorities and disseminate that across multiple platforms, and how we can develop an incorporation of safety device distribution so that way we can amplify our messaging throughout all of our clinical partners so that we can have that ideal platform. And I just like to display this pin because this is my very favorite messaging that's come across the American Academy of Pediatrics, because it's clear, consistent, and concise. And how we can do that within firearm safe storage counseling, I think, will be the best thing that we can do. Thank you so much for your time.
Thank you so much, Sandy. Continuing the theme of how we can help families avoid unintentional shooting injuries in their family, I'd like to welcome Dr. Zoaib Hafiz. He is presenting on temporary emergency storage options and parental risk perception. Dr. Hafiz is an assistant professor at the McGovern Medical School Department of Pediatrics and is a pediatric hospitalist at Children's Memorial Hermann Hospital. His research focuses on geospatial analysis of public health issues, including unintentional injury, transportation injury, and gun violence. Welcome, Dr. Hafiz.
All right. Hey, everyone. Thank you for having me. Let me just experiment with this real quick like everyone else does. So this and then this. Okay, thanks, everybody. I have no disclosures. So for this talk, I'm just going to speak briefly about 4 core concepts that we'll get through, 4 core objectives. One is we'll talk a little bit about parents' perception of their children's risk of firearm injury in whatever community they live in, both in the academic literature as well as locally. We'll compare those perceptions against what we're actually seeing out in the area, the Houston area and Harris County, in terms of where actual pediatric firearm injuries are affecting communities. We'll talk about temporary storage as an option to offset some of that. And finally, we'll talk about some potential predictive metrics that could identify areas at risk for future pediatric injury. So first is risk perception. There's not a whole bunch out there in terms of academic literature. In fact, one of the major articles is written by Dr. Aiken, or led by Dr. Aiken, published 2 years ago. And one of the quotes that stood out to me in that article was the second bullet point, which is, "I am more worried about snakes in my yard than the guns in my home. So when kids come over to play, that's what I say, watch for snakes." So it's common for firearm owners to talk to their kids about gun safety, but maybe the perception of risk for their children isn't there, which is not surprising and not unusual. So what about here in Houston? So this is Dr. Aiken's study that she was referring to in her talk. The question on the left is, can your child access firearms? Of the 36 people that own firearms in the study, 100% said no, they can't access it. But if you look to the right, one of the questions was, or a series of questions asking, do you keep your firearm unloaded? Do you keep your firearm locked? And only about a quarter of the people asked, of the 36 people asked, answered that they did both those things. From the same survey, when it comes to safe storage, is money a factor? 96% of the 73 people who answered said no. But when asked, do you know what to do if you had to remove your firearm from your home for safety? About 40% said they wouldn't know. This question was a very interesting question, which we'll keep going back to during the duration of my talk. And they effectively asked, 122 respondents asked, do you believe your children are at risk of gun violence? And They had 5 different options, and you could see that overwhelmingly it skewed to the not at all side. In fact, over 80% said either not at all or probably not. And we'll map out where in Houston these answers are in just a moment, so keep that in your head. Then there's the actual pediatric firearm injuries. This data is from Dr. Levine, who noted that of the 3 major pediatric trauma centers in Houston, which is us at Children's Memorial Hermann Hospital at UT Health at Houston, Texas Children's, which is affiliated with Baylor, and Ben Taub, which is affiliated with Harris Health, they see about 160 kids a year. The data set that I'm about to present comes from Children's Memorial Hermann Hospital, TMC, and we see about 50 a year. We're going to map about 105, or exactly 105, but, for the years 2019 and 2020. And I apologize, the actual ages are the same for both Dr. Levine's data and our data, 0 to 17. So this is what we saw. Just to orient you guys, let's see if I can figure this out. I'm not going to get that. So very quickly, you can see that right in the middle, that deep red area is 77004. That's 3rd Ward, Museum District area, just to the east of us right here. They saw the most firearm injuries. And you could see, just to kind of orient you, it's center out to the bottom right where the legend is. That's Galveston Bay. You can see I-10, 610, Beltway. You're essentially looking at the greater Houston area. I'm going to try one thing. I'm going to try to touch it. No, it didn't work. Okay, so I'm not going to figure out the pointer. So hopefully you guys can get a little bit oriented there. And I'm going to show you a different map. This is the risk perception in firearm owning families. So when they were asked, are your children at risk of gun violence? If you see a light yellow, that means they were 0 to 1. Not at all at risk to probably not at risk. And let's overlay these 2 maps. And just for context, this was 122 respondents. This is the overlay of those 2 maps. So again, this is that map of are your children at risk of gun violence? And what we did was if that particular zip code had a pediatric firearm injury that it came to our ED, we put hash marks on it. So I think most of us are probably from the Houston area. Point at the screen. I keep trying to do that. I can't do it. Oh, I figured it out. Excellent. Okay, so, but I have to turn my head away, so I don't think I'll do it. So, but what I'll say is a couple of things that stood out to me here. One was if you look at the south side of the loop, where 3rd Ward, what's right, Old Spanish Trail, Sunnyside area, from the loop all the way down to the Beltway, you see a grouping of pediatric violence, pediatric firearm violence. And you see variations in perception. Some places think they're safe, some places maybe inaccurately, some places realize that like 77004 thinks they're safe, but they actually have a very high pediatric firearm violence rate. Same thing's true with the northeast of Houston. That's where Trinity Gardens is, the neighborhood of East Houston, and San Jacinto Community College's North Campus is out there. Same thing. They have maybe a incorrect perception that their children are safe from firearm violence, but we're seeing a lot of kids come from there. And then the I-10 corridor towards the west. If you're driving towards Katy and you're outside of the loop inside the Beltway and you look to your left, it's a very diverse area of West Houston. They have that similar potential misperception, and even out in Katy, you see a lot of gun violence events with a perception that their kids are not at all at risk. So what are some options? One is temporary storage, which Dr. McKay alluded to. What is that? It's a simple concept. Firearm ranges and stores that could temporarily store your firearms for a small fee. This was originally created by the Colorado Firearm Safety Coalition. With a focus initially on suicide prevention, they created this really cool map that is publicly available for the residents of Colorado. And they're collaborating with our team here in Houston on both research design and strategic planning. So our team here identified 161 stores and ranges, and 21 already offer temporary storage options. Storage typically fees range from $8 to $40, so not too expensive. And if you remember our initial survey, expense wasn't really a big roadblock. It was really knowledge of where I can store my firearms. So why do temporary storage? Well, one thing is maybe you have a teenager or another person in your household who is in crisis and at risk for suicide, And you know it. You're knowledgeable about it. You know that your family is going through a tough time, your household is going through a tough time. You just need the ability to push your firearms somewhere safe. Maybe you don't typically have a child in your home, your grandkids are visiting, and they're coming in for a couple of weeks, and you don't have a safe place to put it while they're here. I will tell you, I'm a pediatric hospitalist. We are absolutely seeing a mental health crisis. Things that I saw once every 5 years, I'm seeing once every 2 months. For example, children, preteens trying to harm themselves, or accidental injuries. This is absolutely something that could be a resource for those kind of families. A lot of times it doesn't come out of the blue. They knew that their child was at risk. Here in Houston, the Department of Pediatrics Population Health Initiative at UT Health at Houston has been working with firearm ranges and stores to create a centralized database of temporary storage facilities, and very exciting, here's a sneak peek. They're about 2/3 of the way done. They're going through 1,800 ranges in the state, and you can see that they've identified a whole bunch of places all throughout the state. But let's look at the greater Houston area. This is our map that we were looking at before, a little bit zoomed out. And you can see that there are, those black dots are temporary gun storage facilities that are already offering the service. You can see all the way up to Conroe and the Woodlands, there are options. Down to Clute, Lake Jackson, where I'm from, there are options. I think that's Hempstead in the northwest, all the way down to Pasadena, and a whole bunch of places in between. We can zoom in a little bit closer to that original map that we were looking at. And you can see that I-10 corridor is pretty well served. It might just be a question of education and getting those parents aware that hey, look, your neighborhood might be at risk and there are options for you. There's opportunities to improve. That northeast corridor, where East Houston and Trinity Gardens is not well served currently. And that hot spot in South Houston, where Sunnyside, all the way up to Third Ward is also a place that there's an opportunity to work with maybe local clubs and ranges. So what are some next steps? Well, what if we could identify some of these areas as at risk before pediatric gun injuries actually occur? The first question is, do national level studies apply? What are the variables? And one variable that's been brought up before by Dr. Naik and Dr. Levine is the potential for poverty being associated. And there was hot off the press from JAMA Pediatrics, a journal of a medical association, pediatrics section, had an article published this year looking at the national level study and looking at different counties throughout the country. And essentially what they found was the higher the poverty concentration of your county, the more likely that county was to have pediatric firearm deaths of all causes, accidental, non-accidental, whatever. And this was after correcting for a whole bunch of stuff, demographic factors, including gun prevalence in your state. So this is the poverty rate in Houston. I'm sure a lot of you guys have seen this map. This is from Harris Health. You could see that East Houston, including the inner loop, is affected, and North Houston outside of the loop, between the loop and the Beltway, is affected, and a bunch of other places. And this is our firearm injury map. Now, I'll give you a couple of caveats. One is this. So this is the home addresses on the left. These are the home addresses, the homes of these children that are getting injured and killed by firearms. And we're still early. It's only 2 years worth of data, but I don't really see much of an association. It doesn't line up like I thought it would when I started putting this together. So maybe we can dig a little bit deeper. The CDC has a social vulnerability index. The social vulnerability index is a whole bunch of variables, which you can see on the right column, that they've grouped into 4 major themes to try to identify neighborhoods and counties and areas that are high risk for social vulnerability. Poverty is one of them, but there's a whole bunch of other ones. And when you look at the overall social vulnerability index score, it looks pretty similar to the poverty map, which shouldn't be a surprise. But they have 4 different themes. And the question is, maybe do one of these themes, and even a subset of these themes, could they help us identify these different neighborhoods that might be at risk? And I'll save you the trouble. One of the themes seems to correlate to some degree. This is the household composition theme. This theme is made up of 4 variables. This theme is made up of proportion elderly, proportion of children, which absolutely, maybe the issue is just, if you have a lot of children, you have a lot of children at risk of gun violence. I don't know if I buy that, but it's possible. Proportion of disabled in your community and proportion of single-family households. So what are some lessons for future study? Is there an association maybe with one of those variables or some other variable that we're not even thinking about, or variables that are in the literature and we just need more data on, that can help us predict using machine learning and other options to figure out where we can use advocacy, work with community advocates and other groups to identify neighborhoods in the Houston area before they reach epidemic levels. One is, and this alludes to Dr. Nayak and Dr. Levine, is it maybe, Dr. Levine's done a great job on this, combining the data sets for Texas Children's, Ben Taub, and us, to create more complete data sets and to engage in machine learning with those data sets. Understanding our limitations. We're still early in collecting data. COVID, Dr. Levine, I keep referring to his talk, he's talking about an increase that occurred start before COVID, but I will tell you on the ground level, something happened with COVID with kids and mental health. Absolutely. Nobody's going to convince me that's not true. I don't think we know what's going to happen in the future and how our data sets are going to change as time goes on. And finally, this offers the opportunity for local level dialogue, education, advocacy, and interventions. Thanks, guys.
Thank you, Dr. Hafiz. Our final speaker in this session on unintentional shooting risk is Lisa Ross, who will be speaking about community-based safe storage interventions that work. Ms. Ross is the founder of Lock Arms for Life, an organization dedicated to ensuring all gun owners use and store their firearms safely. A mother of 3, she lost her oldest son, John, to a handgun-related unintentional shooting in 2009. Since then, she served as a gun safety advocate and has given numerous presentations and interviews. Ms. Ross.
Show me how to use everything too, because I'm not real suave on this stuff.
So let's see.
I even brought notes because I thought, oh gosh, what am I going to know?
This one right here? Center one? Okay.
Okay, show me how to do it.
I
Yeah.
don't think it's projecting onto the,
Nope.
here we go. Okay, so hit
Okay,
the center
go.
one to go forward. and
Okay, so how do we go back? Bottom one?
bottom one, there you go.
Okay, so center one forward, bottom one back, right? Okay, so we're going to start right here. All right, as you can see today, I'm going to talk to you about life, death, and gun safety. Again, my name is Lisa Ross, and first of all, I want to thank everybody for inviting me and having me here. We're all doing really great work, and I'm so proud of some of the research they've done. Some of this is all new stuff to me too, so for what I learned, it's really awesome. You'll see my challenges that I've had as I've gone forward in learning how to navigate this world of guns. So anyway, first of all, again, I'm the founder of a program called Lock Arms for Life. It's an educational program, and I've given this talk to audiences. I've given it at PTA meetings. I was giving it at church groups, and I've given it to Safe States Coalition, and I've given it to high school students. Our mission is pretty simple. We educate our community members and really just all our community members about safe gun storage and safe practices to save lives. Like many of you, what we're trying to do is just change the narrative about gun safety. Again, as this one goes on, I can see I've got little notes here too, but I'm going to use my own because I'm kind of used to it. Anyway, these are my 3 sons, Keaton, Lance, and John. John, my oldest, is on the right. He's the one that died. This picture was taken in 2009, about 2 months before he passed away. My youngest one that's in the photo right now is 27 years old, so that kind of tells you an age frame of how long ago this was, about 12 years. What I want to say now is that we were living in Austin. We lived in Austin at the time, but John, my 2 oldest ones, ended up deciding to stay behind in North Carolina. And John was going to community college there, and he was studying kind of some of literature and was working on his degree. And it still gets kind of difficult for me to even talk about it still today, to be honest with you. So anyway, my husband, it was his birthday, and my husband decided to go up to the North Carolinas and visit with my son. And also he had brought a friend with him that he was going to take on the trip who had never seen the Carolinas. So they go up to North Carolina, they check on our dealership that we had up there at the time, and he's doing the showing golfing and doing the things for his birthday that any husband would do. And they go and have dinner that night with my son. Afterwards, they go over to a family friend's home that he was staying at. And John was kind of texting back and forth that night, to people back and forth and talking to them. And my husband was like, kind of, what's going on? And he goes, oh, I'm going to go meet up with a group afterwards. We're going to go over to see this local venue, and we're going to see this hip-hop performer that's performing over there. So, and he was, like I said, and even back then, texting is not like it was today. You got these old-time flip phones, and that's kind of how you were texting back then. So I have a log, even that afterwards, after he passed away, I have all the information of all the text messages that were going throughout the night. So he goes and sees the hip-hop performer, kisses his dad goodbye. I talked to him about an hour before he left. Like any mom, even though he was like 23 at the time, I still said, please give me a text message when you get home. I just wanted to make sure that he was home safe and sound that night. He lived on kind of a windy hill. I don't know if y'all have ever been to the Carolinas, but it was September too. The air was beautiful and crisp that night. The leaves were starting to change. They were, the reds, the yellows, and the golds that you see along the Blue Ridge Parkway. So it was just, a beautiful evening. Anyway, he goes over to the venue that night. He is there. And then goes over to friends afterwards, like a lot of young adults do. They're still ready to keep going on. They go over to a friend's house afterwards. He goes over to the friends, and sitting on the coffee table is 2 firearms. One of the firearms is fully loaded with a bullet in the chamber. Someone hands the gun to my son. The reason why I know this is because we still never even read all of the statements from the kids, because it's still an ongoing investigation. Not an investigation that meaning that there is something that bad that happened. It was an accident. It wasn't meant to happen. But that if we could ever prove that there was something of negligence going on, then we could go back and reopen the case, and then we could go back. But according to the autopsy, my son is left-handed like I was, just like I'm holding this clicker in my hand. But for some reason, that firearm was in his right hand. He had his finger laced through the trigger. It was pointed towards him, and it discharged, and it killed him. Now, that gun shouldn't have been out. That gun should have been stored safely. They should have had the education and the knowledge to know that that's not what needs to be done. And so I decided afterwards that I wanted to start doing something, but I wasn't sure what I wanted to do. When I educate young adults, especially high school students, this is the picture I have in my slideshow. And I have this in the slideshow for one reason and one reason only, because this is how I visit my son now. This is what it really looks like when you lose a child, and this is where you go to visit them now. So there's no more of that, having those nice conversations, text messaging. This is what my life looks like when I visit him. And I heard recently, I don't know, I'm sure many of you guys heard the press conference that Matthew McConaughey gave, and where he talked about the fact that those families were, in Uvalde, just wanted to give meaning to their children's lives. And really that was it for me, is that so resonated with inside of me that I knew that I just wanted to give meaning to my son's life. And so that's when I started, what am I going to do that? And that's what I've been doing for the last 12 years. So at first I started writing a book, and I started with a real simple book. I brought it with me actually so y'all could see. But it was a chapbook, because like I said, my son was an artist, and he was a painter, and he did a lot of poetry. And so this was all his artwork and poetry and all that, and I started putting it together. But it never felt completely finished. So what I decided to do is I got with a writing coach, and I wanted to make it into a book. I pitched it to the University of Texas Tech University, and they decided to take on my project. And they ended up being my publisher, and I was published in 2020. And again, it's called At Close Range. So, and this is another one I put in my slide presentation, because I want people to know that we do own firearms. And I heard Sandra talking about the fact that you have to connect to your audiences and who you're talking with. And when I first started this, I wasn't sure if I was really connecting with my audiences, because I was originally when I did this, I started into advocacy. I guess really what kind of turned that corner was getting into Sandy Hook. When Sandy Hook happened, I knew I just couldn't sit on the sidelines any longer, and I knew I had to be involved, and that's really what catapulted me into being an advocate. But, and so I started with a program that was called Be Smart, which is Every Town for Gun Safety. And I started educating, but I wasn't being able to get into schools. I wasn't able to, and it was very structured on that I could not tailor the program to just talk to everybody. All I could do was I had to talk to parents of young children, and I had to follow kind of what their program was and the presentation and slideshows. And I wasn't getting around. So I decided to tailor the program, and I ended up putting this slide inside there. And all of a sudden, doors started opening up because, you know what? I was one of their community, and they knew that I was there I wasn't there to take their guns away. I was there to really share a message about what my tragedy, what happened, and safe storage on top of it. So at the time, like I said, I was kind of getting this, but every town was not happy with that they didn't want me to have slides with, a deer and a shotgun or a rifle inside of with my son pictured like this. So I was kind of getting pushback for them, and I was getting this pushback from the gun community because they didn't at first accept me. So I had to find ways to be where my credibility as part of one of them so that I could talk to them about safe storage. And the other thing was, the most important thing to me at the time was that I wanted to make sure that I was educating young adults. My son was a 23-year-old son. The people inside that room were between the ages of 18 and 23. And I wanted to make sure that those people, because were our future gun owners, that we're getting the education out there to them. And so that was very important to me as well. So I decided, you know what, if I'm getting all this pushback anyway, I might as well just develop my own program. So that's what I did. So I came up with my own, which is called Get Active for Firearm Safety. And again, I educate young adults, I'll educate community members, I educate just about anybody out there who is. And so I'm going to kind of go over some of the pillars of what this is. If I'm giving this to like a group of high school students, this is kind of how I would educate them. So the A are acronyms. I mean, sometimes I don't say that word right, so I sometimes say they're pillars because it's an easier word to use. But the pillars of what I advocate for. So the A is, for example, always securing guns in homes and vehicles. Pretty simple. We know that you just lock them up. Safest way to lock your firearm up is locked, unloaded, and separate from the ammunition. You need to use a cable gun lock. You need to use a lockbox. You need to use some kind of a safety device. Same thing with the vehicles. You don't just throw it inside the back of the trunk. You don't just put it in your console on the side of the car. You lock the gun up. And right now, I'm sure, even I'm from Austin, and I know I just heard our chief of police talk about theft is one of the major concerns that they have right now about firearms. Then you talk about cultivating responsible behavior. Cultivating responsible behavior is like knowing what your target is and beyond. Speaking of the National Shooting Sports Foundation, they have a list. Treat a gun as if it's always loaded. Never point a gun at anybody. Those are cultivating responsible behaviors. T is think about the risk of unsecured firearms, or think about the risk of suicide. We heard all the information about suicide, that it's on the rise as well. An unsecured gun, easy access, and firearms are the most lethal means of a suicide. So we want to make sure that we're locking those firearms up because of that. I is inquire about other guns in other people's homes. I mean, that's pretty self-explanatory. If you don't ask, you will not know about guns in other people's homes. So you want to ask simple questions. We tell people, if you own a firearm, not do you own a firearm. If you own a firearm, can you tell me how that is stored? We also tell if it's a babysitter and your kids are babysitting age and they're going over to people's homes to babysit, put it on the checklist. It's no different than asking about swimming pools in somebody's backyards. It's no different than asking about food allergies. You just want to ask if they have a firearm, how are they storing it? And then voice your concerns about gun safety. If we don't talk about it, we're not going to get the message out there and nobody's going to know. And finally, you want to educate your peers on the pillars of what I just advocated for. So now what I'm going to talk about a little bit about is that just like everybody else on this, we run into challenges, and the message is not simple, and we know that. So we know that we have to come up with sometimes some kind of creative ways. But I'm going to tell you a little bit about one of the challenges that you guys might maybe know or maybe don't have any idea about. But about right before COVID, a year or so before COVID, I was approached because I was working with organization Texas Gun Sense, and I was working with Safe Kids Austin. Actually, I'm board members, and so the medical community was starting to reach out to me more and more and asking me more and more questions as well. And so they came across this thing where there was, let me look here because I need to make sure I got my notes right on this one. But I received an email from a group from GTAC, which is the Injury Prevention and Public Education Committee, and they're a section of the Texas Department of Health and Human Services. And so I got this email from them that they were getting pushback, and basically what they wanted to do was put in a simple policy statement about safe storage into their EMS, first responders, and things like that. Simple little statement. And they were being told that they weren't allowed to do it. They were getting this pushback. And it was from a pro-gun group called the Texas Freedom Caucus. And they did not want healthcare to be asking questions about firearms. And so, and then again, simple questions. If there's a gun here, can you tell me how it's secured? So the Freedom Caucus tried to squash the ideas and the questions on gun safety. They were worried about becoming gun prevention. So in this kind, of course, we all know this is lobbying. This is what they were doing. And again, these were simple questions, non-political questions that an EMS responder might need to know, especially if he's arriving at a home of a suicide attempt. You might want to know in that instance if there's a firearm present. So we worked with the Texas government, all the organizations did, and we went ahead and wrote up letters of support, just like you would do on a lot of other policies that you're trying to make sure that they get supported. And we had support from people like the American Academy of Pediatrics, we had the Emergency Nurses Association, and we had the American Trauma Society. All of the groups approved it, all wrote letters of support. But in the face of all of that common sense, we still failed. It was not passed. The government, Texas government, all the way up to the governor's office blocked our efforts. And it was a setback. And a lot of these things are going to be setbacks. I mean, this is what I deal with every single solitary day. So I know I had to come up with more creative ways of getting my messaging out of there. Listen, I'm motivated, and because this is personal to me. I have a personal stake in this, and so I'm extremely motivated on the work that I do. It's kind of like lose a son, gain a mission. And so we've given away thousands of gun locks. I mean, that's one of the things my organization has done. But we need more help, and we really need help from people like you, especially like from you. You're the influencers, you're the advocates, you're the voices that need to be heard. And so we want you to engage your families, your patients, your public, and be proactive about talking about the Get Active and Lock Arms for Life. I was disappointed about the failure that we had on getting that simple policy in there, but I want to tell you that since then, these are my allies. I've received a grant from the Austin Public Health Department of Office of Violence Prevention. That's how I can give away thousands of gun locks, because they helped me, funded me. I work with Department of Public Safety. I work with the District Attorney's Office, and I work with Austin Police Department. And we put together a campaign. You're right about the water. You put together a campaign. We put together, it was called Safe Gun Storage Saves Lives campaign. And all of these entities in Texas Gun Sense were included in that. We did everything in English, and we did it in Spanish. Here's an example of a billboard that we put up in Austin. As you can see, we did 5 of these in very high traffic areas. You can see the HEB in the background, so you know that everybody going to the grocery store is seeing that billboard. This is also a very high traffic thoroughfare area where we put this one as well. On this, we did, I think about over 5 million impressions is what the total number did with the 5 billboards in Austin, and that was over about a 2-month period of time. Here's another image. We did buses as well, and we put them on the exterior buses. And I got a couple more of these. As you can see, the guy, let's hope he's reading that safe storage. Let's hope everybody that's walking on that bus is looking at this. Here's more people getting on the bus. We did 3 buses, fronts and tail ends, and then we also did these place cards that were inside. And we did 150 place cards. So it was 150 buses that had that safe storage message on the inside of their buses. Of that, we probably got 1.7 million is what they figured the impressions to be on that. So that's how much of an impact that we started to make on our community in talking about safe gun storage. What we also did is we created a simple website. This is the website we did. As you can see, it says right on the bottom, click here to get your free gun lock. So people can just go straight to that website. They get a free gun lock if they want. Again, like I said, we've given away thousands of them. Below this page too, we have, I gave each entity a space where they could write a simple blurb, and then they could link to their sites as well to talk about what kind of initiatives they wanted to do. Like the DPS, their Keep 'em Safe Texas program, they could go ahead and do that. So basically, I'm getting to the end of this too. It was crucial to have those partnerships. It's crucial to start developing that so that we can start moving forward and start educating our community. My message, again, is pretty simple. It can be very controversial. We all know this. It's not something new. But we also know together that we can start making changes. Policy, we can start making changes. Just good common sense. And so that's about it. That's all I really want to talk about. And I just want to tell you thank you for your time and having me here. I really appreciated it.
Thank you, Ms. Ross. Is this on? Can you hear me okay? For that, compelling story and amazing advocacy. We have time. We just have a few minutes for some questions for our panel. And I wonder if people have got the cards to, okay, thank you. Oh, quite a few. Okay, thank you. We have about 5 minutes. Here's a question for Dr. McKay. It's, if dangerous is not the most effective term to use, what is recommended?
So I think when we think about dangerous, and you want to use danger as like a motivating factor to try to get people to lock things up, but instead, some of the things that we want to think about is their firearm is like a tool. So I think of the analogy as like a construction worker who uses their tools, right? And so, they wouldn't leave their tool or like their hammer laying on the table. You don't say, oh, your hammer's dangerous, don't lock it up, but your hammer is a tool that you use in your job, and it's valuable to you, and you know that you don't want it to get lost or stolen, and you don't want someone who shouldn't use it to have access to it. So I think utilizing it and reframing your language to think to look at it as this is what you use in your daily life, right? And this is a tool, this is what you use, but it could cause harm to other people who aren't trained in how to handle it. And so I think kind of maybe backing off a little bit on that like danger, danger, danger word that we tend to throw out because we want to intimidate people, but just taking that language to, yes, it is something that you use it as your tool, and you need to protect your tool from those that aren't trained in it and don't necessarily know how to handle it and utilize it, and think about maybe protecting that tool instead of like utilizing that like danger mechanism.
Thank you, Sandy. Next question, and I may not get to all of these. It's great that there's so much interest, but next question is for Dr. Hafiz. For the Texas Storage Map project, what level of training and support is being provided to the retailers who are participating, and what is the follow-up to track the outcomes for the project?
Probably a better question for you, Dr. McKay. Dr. McKay is running the show on that one, so I'll defer to you.
So right now, we're really just kind of in our formative stages, kind of getting that information with those retailers to learn from them what they're currently doing. And part of our grant work is really to learn what the lay of the land is so that we can develop this training platform for them. So, but we really want it to be a grassroots effort so that we can learn from them what they want and also get their information on what the training needs to be from them, because we know they're the experts in safety and training. So we really want this to be an informed, collaborative approach from them.
Thank you. Question for Ms. Ross. You're trying to reach out to a young adult population, and you have a website and lots of traditional media. Are you using social media to get to that group?
Oh, yeah,
Facebook,
absolutely.
Twitter?
Yes, we are Instagram, Twitter, Facebook. We have all of the platforms out there. I just recently actually hired, because I was doing it myself for quite some time, and I just recently hired a woman that actually takes care of all the social media. In fact, she tweeted about this today, that we're at this conference. So, so yes, we definitely make sure that we get the message out there as much as we can about safe gun storage.
Right. I've tried to tweet about this conference and I failed, so we all have a lot to learn.
We made it. It was in there. I saw it.
Okay,
Yeah, we're getting lots of good responses.
And then maybe a final question, and I'll let you all decide who should answer this. It's difficult. What metrics are used to assess the effectiveness of gun violence interventions and how safe storage interventions work and how effective they are? How can we know?
What metrics?
Yeah, it's hard. Yeah.
It's difficult, because, you know, I can tell you too, I know it's a difficult a question to answer, because I even have this with my grantor, because, you know, that's one of the things that when you apply for a grant, they want to make sure that you're not only fulfilling the grant, but that you have a point of measurement. The impressions is one of them, is for me, is to show the impressions, but you know, I do also events where I'm out in the community, and it might be some kind of a safety, like I just did one with Dell Children's Hospital, and it was a safety event, and I don't know how, it was in Kyle, Texas. I can't tell you how many families I talked to, but how do you count the person that you talk to one person and you give them the message, and then they might talk to 3 or 4 other people? And so to be able to measure that is very difficult to do. I guess, you know, I can tell you, again, at that event, it wasn't huge, but we handed out over 75 gun locks at that event. So sometimes for me could be measuring how many gun locks I can hand out at an event.
I can make one 15-second comment.
Sure, yeah, please.
So I'll speak again to Dr. Levine's comment, which is, you know, when the mayor was talking about, you know, how we're only 1% above or 1% below where we were last year, and, you know, at the beginning of the year we were much higher. I think that's commendable, but also everything needs to be taken in context. We're, like Dr. Levine mentioned, we're currently in an uptick phase. We don't know how long this is going to go. And just like everyone tries to predict the economy and they're always wrong, I think we're going to end up in the same situation with this. And sometimes we have to give ourselves a little bit, from a statistical standpoint, a little bit of forgiveness and a little bit of context whenever we try to evaluate whether an intervention is working from a top-down viewpoint, when you're talking about a whole city of Houston, which is a gigantic place, or a state of Texas, or a city of Austin. I think a small measure of humility is probably a good idea when we go forward over the next few years.
And probably a lot of time and continued careful study and outreach. I think that this is complicated, and your studies and your outreach demonstrate that working together we can learn a lot.
Yeah.
So with that, I think we're out of time. I want to thank this wonderful panel to kick us off this morning again for your work, and we are going to a coffee break now. I think we're back at 10.
I know you. Yeah, you're one of the medical students. I was like, I recognize you. I'm a resident now.
Oh,
Big girl.
congratulations. At UT or?
Texas Children's. I'm a rising third year.
Oh,
I know.
you were a medical school a long time ago. Thank you, Dr. Aikens.
Yeah, just like, I was like, I recognize your face.
Yeah.
Point at the screen. I know we were all kind of like,
I'm in a jiu-jitsu gym, and I actually have there's a Texas Children's resident in that gym. I can't remember her name. No, starts with an M. It's a girl. I think she's going for Kit Hen. I know that. She's okay. It starts with Karina.
Is she like brown hair? Is she UT as well?
She's Eastern European descent. She's mentioned that once.
Yes. Okay, I
I think
know
a
her.
refugee when she was a
Yes.
little kid.
Yeah, absolutely. That's the analogy. So, Rena,
That sounds right. Yeah. She's pretty good friends. She should. Yeah, she can do that.
What's your you at?
Midtown.
Yeah, she's in my program too.
Yeah. I heard y'all probably so large. Everyone doesn't always know. Is that true?
I know everybody, but I don't.
It shows like
I know everybody. But
Fair enough.
there are some people who like.
Do you know Ricardo Comune? Or Ricardo, yes, Ricardo Comune. Director of Fusion. Oh man, I guess he doesn't, that's so sad. He is one of the coolest, best, smartest pediatric hospital medicine doctors in the world. Yeah, he is one of my personal favorites. So he was just a
Yeah, I'm a friend too. So I'm a sign.
Have you give you our website, but be connected with you.
I didn't know that. I have no idea what goes on there. Like, they have a,
Scary down there, isn't it?
I'm sure it's fine, but they have a great director. I actually, one of my favorite people in our institution, I have a lot of people I like, but Robert Hawkins runs Penn for our institution. Very smart, very nice guy, very sweet. You should. I don't know how affiliated he is with the Penn program, but I think he's a director of Penn in general. But he is such a good he's done so much stuff in my career and a lot of it. Lena, nice to meet you. And hopefully I see you.
Yeah.
see if I can do it. So it's this one?
I believe this is forward and this is back.
This is forward and this is back. Okay.
Yeah, that's counterintuitive. I see the confusion. Yeah, I heard center was forward and bottom was back, but just check it quickly when you
I know, but I like look like my eyes are all fresh. I don't want to. I want to see it. She's just trying to look cute.
I understand. Take your time. Smile.
Rola, what about Rola? Come join us. We don't know where to look.
Honestly, I've got you guys to get
It's a lot of. I love it. I almost fell off the back of the stage.
Hello? Can you, good morning, everyone. We'll start in about a minute, please, so if you can head back into the room, that would be great. All right, I think we'll get started. Good morning. My name is Lillian Dindo, and I am an associate professor from the Department of Medicine at Baylor College of Medicine. This has been a really amazing morning, so thank you to the Baker Institute, Dr. El-Serag, for organizing. I am going to be introducing two speakers today, starting with Dr. Gala True, who will be talking about veteran suicide and community-based interventions. Dr. True is an associate professor in the section of community and population medicine at Louisiana State University School of Medicine and an investigator at the South Central Mental Illness Research, Education, and Clinical Center. Dr. True's research interests have been on improving access to mental health care, suicide prevention, and bettering the health of individuals and communities through patient-centered and community-engaged approaches. Today, she'll specifically give an overview of her work bringing together a coalition of veterans, military families, firearm retailers, and other community stakeholders to change the culture around lethal means safety messaging and promoting community-based interventions to prevent firearm suicide. So, Dr. Gala True.
Thank you. It's wonderful to be here, and I really appreciate being invited and being included. There's so much exciting synergy between all the conversations that happened earlier this morning and the work that we're doing in Louisiana. And I think in part, it's because so many of us are coming together to work in this area at this time. It's a very exciting and scary and intense time to be doing this work. We are right across we're your neighbors in Louisiana, and we share many characteristics with Texas. And in fact, when I go to gun shows, many of the vendors are from Texas. And we also kind of have a little bit of a quadrangle, I think, with Texas, Mississippi, Louisiana, and Arkansas. in terms of our rates of firearm suicide and homicide, our rates of firearm ownership. We have large swaths of rural areas where there are particular issues around firearm suicide. And so that's, I think there's a lot of synergy with what I'm going to talk about today. So the focus for our project has been on veterans and service members and military families and suicide prevention. But everything I'm going to talk about today really crosses the line and can help civilians, non-veterans, and we always emphasize that in all the work that we do. So whatever I say, can pertain in a lot of ways to civilian communities. So I'm going to talk today about the Vision Coalition. It's the Veteran Informed Safety Intervention and Outreach Network, but I want to acknowledge that I'm part of a larger team, and in particular, I want to talk about how the members of our team, many are veterans and have served in the military, and are ambassadors for this program, but also really inform everything that we do with this work. So all of us have personal experience with firearm suicide or suicidal ideation. All of us have experience with losing someone to suicide or someone who's had suicidal thoughts. And that is really driving this work, is our personal experience and commitment to the work as well. So just to give a very brief background, we had an initial 18 months of funding from the VA. And really the idea behind that was the VA said, listen, here's some funding, do something that's high risk, high reward. So you don't really know if it's going to work, but you're going to give it a try. And then if you have some success, then you may be able to get some additional funding to keep going. And so what we were doing with that work was to build a coalition of veterans, service members, family members, firearm retailers, firearm owners, and all other stakeholders in our community in Louisiana who had a stake in preventing firearm suicide. But we knew that we needed to go about it first by listening and learning, and I think the other speakers this morning have spoken to that as well, the importance of language, the importance of stakeholder buy-in, and the importance of building trust and rapport in order to be able to have some success in whatever we decided to do next. We used a method called deliberative discussion forums. I'm not going to go into great detail about what that is, but essentially it's an approach in public health. It's a method that you use when you think that the public health issue that you're trying to address encompasses a wide range of views, values, beliefs, and you want to try to work to get people on the same page before you try to implement an intervention. So we spent 18 months or so going out and talking to everyone in the community who would listen to us. There was a lot of trust building. There was a lot of explaining. We're not here to try to talk about taking firearms away. We're here to talk about the fact that firearms are involved in our community in 80% of veteran and service member suicides. So it's not like we're paying attention only to firearms. I had that asked of me a lot. Why aren't you looking at other methods of suicide? And we would explain and get on common ground. Listen, if we want to make an impact, we need to focus on firearms and the role of firearms in suicide. We had these deliberative discussion forums. They're kind of like town halls where you sort of say like, okay, what's some of the common knowledge that we can all share? And so there was a lot of understanding what are some of the beliefs about firearms that we needed to address, and the role of firearms in suicide that we needed to address before we could get on the same page. And we all called them kind of like, myth busting, like what are some of the things that people believe that we need to make sure we address before we start to talk about the role of firearms in suicide. I'm not going to go into all of those, but you're familiar with many of them. It was things like that we're not there to try to take away people's firearms. We're not against the Second Amendment, or that's not the goal of the work. And also to really educate people about the concept of means substitution. So research showing that if someone has a preferred means of trying to kill themselves, that they will not, if they don't have access to that means, they're not going to default to another means. So if their preferred method is a firearm and they can't get access to it at that time, they're not going to suddenly decide to switch to another method. Another thing that we really needed to sort of bust myth about and talk about was the idea that if someone wants to kill themselves, they're just going to be successful. They're going to keep trying. If you can prevent them once, they're just going to keep trying. So we needed to get some research out there to the members of our coalition in our deliberative discussion forums that says, look, actually the research shows that when someone survives a suicide attempt, 90% of people after that do not go on to die by suicide. So we did a lot of education around that, but in a way that was very, not sort of eggheady or like academic, but really was speaking to people and saying, using visual methods, using ways of talking about things, and really getting people on board into this coalition. We had a private donor who helped us fund a website for the project. I'm going to share the website at the end. And at this website, we really saw it as a hub for gathering together all the information that's out there. There's so much incredible information out there about preventing firearm suicides from the National Sports Shooting Foundation and other organizations. And we're still building that hub, so if you have resources you think we should add there, please let us know. But everything on that hub is downloadable. A lot of things are very like one-pagers that are very visually appealing, very graphic, appropriate language, so that people can download any materials they need. We keep adding to it, so the more we've been doing this work, the more we encounter people who have are survivors of someone who has killed themselves with a firearm, and so we've added post-vention resources to the website, because if you're doing this work, you have to be able to say to people who have experienced a loss like that and maybe haven't had a chance to kind of deal with it, heal from it, they don't know about post-vention resources. You have to be able to say to them, we can continue this work together, but you need some post-vention resources maybe to kind of help you get to a place where you're able to process some of the loss that you've experienced. So we keep adding to that hub. The reason for the private donor was that we were told, don't make this look too much like the VA. Don't have VA branding on it, but really make sure that it looks visually appealing and like something that people can join. And then I'll talk a little bit more about some of the other funding we've received over time. So I want to speak about our veteran peer champions. We've had 2 cohorts of veterans who joined the project from the very beginning. They are veterans with lived experience of suicide, suicidal ideation, loss of others in their community from firearm suicide. And they are really ambassadors for the program. They inform everything we do. I come from a participatory action research background. So my belief is that we can't do this work without members of the community who are impacted by the issue that we're trying to address being involved in a very deep and sustained and rich way in every single aspect of what we do. So this is our second cohort of veterans. They are paid a small amount as consultants to compensate them for their time and effort. And actually over time, our first cohort of veteran peer champions have moved into being ambassadors for the program. One has become the project manager for the program. And so this is also a way for people who are really concerned about this issue to move into advocacy positions that they may not have been in before, and to become deeply involved in solving the issues that affect their communities. We do a lot of community outreach and engagement. So very similar to a lot of what's been talked about by earlier speakers, we focus on veteran service organizations and active duty and reserve military units, but we also go to firearm groups and community organizations. And one of the things that we've learned both from the deliberative discussion forums, but also just from experience, is how important it is to tailor our message to different groups that we're speaking to. So we have a little bit of a standardized presentation that we use, but then we tailor what we're saying to whatever group we're talking to. So to give a concrete example of that, I work with a lot of firearm owning kind of Second Amendment rights groups. One in particular is called 2A Coffee, and it is an African-American Black firearms Second Amendment rights group. They are very invested in firearm safety, firearm ownership. They advocate for the Second Amendment, and they lobby in the state legislature. And when we have been working with them, one of the things that we've heard from them is that from their perspective, they have not had the right to bear arms since the Second Amendment as other, white Americans have had the right to bear arms. From their perspective, they've only had the right to bear arms for 50 to 60 years or so. So their perspective is really very protective of we're sort of trying to catch up in terms of our firearm rights, and we don't want you taking them away. So when we work with that community, we're very focused on how do we be respectful of the fact that they feel that, that they haven't had that right for as long as others, And so we really want to be careful not to infringe on that. At the same time, that group is very cognizant of the fact that, that firearm homicides disproportionately affect their community. And they brought to us the idea that we needed to have some materials that we could give out to prevent theft of firearms from vehicles. So that was mentioned by Lisa. Because the firearms that are stolen in New Orleans and Baton Rouge and urban communities are then used in homicides, in disproportionately used in homicides in African American communities. So it's just tailoring the message and understanding what are the concerns of a particular community that you're working with, and then how do you make sure to meet them where they're at and address those concerns and listen if they bring up new concerns or say you're not addressing this one properly. Another example would be meeting people where they're at in terms of their preferred ways of storing their firearms. So a lot of research has shown that in a home, people may have many firearms secured in the ways that we've talked about, unloaded, locked, separate from ammunition, but they will keep one firearm loaded and more accessible for home defense and self-defense. And so how do you address that? How can you talk about kind of rings of security? Are there ways that they could feel comfortable locking up that one firearm, maybe in a quick release biometric gun case? There are some holsters out there now that can go on your bedside and have biometric fingerprints so you can quick release the firearm if you feel you need it. Maybe people would be willing to use other ways of defending their homes, such as using, the ring system from Amazon or something like that. So we kind of go through talking about lethal means safety counseling with people, depending on their reasons for owning a firearm and their comfort level with, locking up different firearms in different ways. So our objectives with a lot of those presentations are to recruit new members to our coalition, to identify future partners, to spread awareness and best practices, and like I was saying, to meet people where they're at and to disseminate resources. We do a lot of gun show outreach. So I started doing this on my own before COVID hit, and over time we have developed an incredible group of volunteers. We have training for our volunteers before they go and volunteer at the gun show. We have a program where any new volunteer gets paired with a past volunteer to help them kind of learn the ropes on how to table at a gun show. We use the gun show to identify partners, so we go around to the other vendors at the gun show, build trust and rapport with them, and ask them to either become partners in some way, to display our materials on their table, to send people towards us, and then we do the same for them. So if they're a firearm safety or concealed carry instructor, and we get somebody at our table who says, "This is my first firearm, I just bought it," we'll kind of engage them in conversation. Have you taken any firearm safety training classes? Oh, no, you haven't? Well, would you like to go to this group of women firearm owner instructors, if maybe you prefer a woman to be your instructor? Or you could go to the 2A group if you prefer to be part of a Black community group and get some instruction from them. So we do that at the gun show. We're growing our volunteer base. And as I said, we have some training and orientation. We do things like raffle off biometric gun cases at the gun show. And we have a pilot program we're going to be doing at the gun show where we're going to be giving out either a cable lock or a biometric sort of gun case and then following up with people to see if their practices and how they store their firearms changes at all, and whether the biometric gun safe, is used more than the cable lock, because there's some evidence to show that cable locks are not always used, especially on that one firearm I mentioned that people might want to keep handy. We have a project that I'd love to have time to talk about more, but I'll just try to talk about it briefly. So we were very aware of the state storage maps, like the Colorado one, and those are really growing, and there are many states now that have them. And we actually decided to try to replicate that. But as we were calling the retailers, we were hearing a lot about their concerns and potential barriers to them providing storage. They said things like, if somebody called me and I didn't know them, I wouldn't store their firearms because I wouldn't know what they had done with it before they came to me. We don't have any training in how to do this. We don't have any training in mental health. We don't have any training in how to talk to this. Our staff doesn't have any training. We heard a lot of concern about civil liability. If someone stores their firearms with a retailer and then they go to get it back, The retailer doesn't know how to tell if the person is doing okay, has recovered from their mental health crisis or whatever might be going on. If they return the firearm to the person and then something happens subsequent to that with someone being harmed, the retailers were saying to us, we don't want to lose our business, so we're concerned about civil liability. So we were hearing all of these things and we said, let's see if we can try this a little bit differently than the gun storage maps. I should go back and say we'd also done a little bit of looking at some of the gun storage maps, and some of the links to the retailers were dead. They didn't go anywhere anymore. And some of the stores had closed due to COVID and things like that as we were setting this up. So we thought, well, let's just see if we can do this a little bit differently so that we can feel like we're growing it slowly in a partnership kind of way. So we worked with a number of firearm retailers to pilot a program. We developed training for the retailers and their staff. We delivered the training, and we looked at pre and post measures of knowledge and attitudes and behaviors of the retailers and their staff. And we found that going through the training increased the staff confidence that they could talk about safe firearm storage with a customer. It increased their belief that it would help prevent a suicide or other unauthorized access to firearms. And they found that it was very acceptable training, and actually asked us to come back and do it again in 6 months and give them some updates. So we have been piloting that program with retailers. We have a community of practice with the retailers, so every month we get together with them virtually and we talk about what challenges are they experiencing, how can they problem solve those challenges together, and what successes are they experiencing. And through that program, we've tracked how many materials they've given out. I could go on and on about the program, but we developed materials with them, including a graphic medicine booklet that explains why someone might want to store their firearms temporarily, and a brochure and messaging in their store and things like that. And so they've handed out thousands and thousands of, handouts in their store. They've had dozens and dozens of conversations with their customers about the program. They go out and give talks about it in their community to veteran service organizations and other groups. And they have stored 8 firearms for people who were having a suicidal crisis. That program is ongoing, and we're learning that we need to provide a lot of support for these retailers in terms of mental health resources in the community for them to steer people towards. Because by having these conversations with their customers are then confiding in them, I'm having an issue with intimate partner violence, or I have a teenager in the house who's having a mental health crisis, or I myself am having a mental health crisis. And these retailers need to know where to steer people towards in the community to get that help, because that is not their role and they cannot do it. And in order to support them staying part of this coalition and growing this coalition, we need to support them. I'll very quickly talk about another project we're doing. We developed a lethal means safety education module. It's a video featuring 2 veterans talking about firearm safe storage and raising awareness about it, different options for how to store firearms more safely, both inside the home and temporarily outside the home. And that project was developed with input from firearm instructors and firearm owners and veterans. And it's available on our website. And we are piloting those materials in concealed carry classes in Louisiana and gathering data from the firearm instructors and students on acceptability, feasibility, and changes in knowledge, attitudes, and behaviors. We came very close to having permitless carry passed in our state in the past legislative session. Fortunately, it was shelved, but it was the second time it was going through, and I imagine it will probably pass at some point. I certainly hope not, but I imagine it will. And so then we're going to have to figure out how are we going to get this material out into the community when people are not required to take concealed carry classes. We also worked, as part of our coalition, we worked to pass legislation in our state. It's the first of its kind. We listened to the firearm retailers, and their main concern was about losing their business if they were sued after storing someone's firearms. So we passed legislation in our state that provides immunity from civil liability for firearm retailers who temporarily store someone's firearms for them and then return them if something happens subsequent to returning the firearms, as long as the firearm retailer followed all federal and state laws when they returned the firearm. That was us trying to listen to our partners and what they were most concerned about, and understanding that they're putting their businesses on the line when they're helping us with this effort, and so we need to listen to that. So anyway, that legislation has passed. We're very excited about it, and a few states have contacted us to find out more about how we did that and get some input. So looking ahead, we're developing an implementation toolkit for the Armory project, and spreading that across our state, but also hoping it can, in addition to the state maps that are out there, this could be another way for people to think about how to build temporary firearm storage options. We continue to do the gun show outreach and building a toolkit for that so that it can expand. As I mentioned, we're piloting the lethal means safety training, and we hope to make it available on our state police website. And now we've started to engage military and family caregivers in identifying interventions actually to address caregiver risk of suicide, because caregivers who have firearms in the home and are experiencing, burden and stress are also at risk of suicide, and that's not something that many people are talking about. So I'd love for you to visit our website. You can join the coalition by clicking on a button on the website that says Join the Coalition. We only send out 1 email a month to keep you updated on our activities. We don't send out any more than that. And we'd love for you to explore the website, give us any feedback on anything, anything you think we should add there, anything you like, whatever. And I will be here if you have questions for me. Thank you.
Thank you. That was wonderful. Next up is Dr. Laurel Williams. Dr. Williams is a professor of child and adolescent psychiatry in the Menninger Department of Psychiatry and Behavioral Sciences at Baylor College of Medicine. She has specific expertise in working with adolescents who have suicidal and or self-injurious thoughts and behaviors. She's also the medical director for the Texas Child Mental Health Care Consortium. Today's presentation will review the development and early implementation of the Texas Child Health Access through Telemedicine program. She's going to tell us a little bit how TCHAT came into being, its initial implementation, and preliminary data from this past academic year. Dr. Williams.
Hello, everybody. Can you hear me reasonably well? In the back. Good. Hopefully. So, Okay. So as a psychiatrist, I often laugh at this when I have plenty of conflicts, but unfortunately, because I'm a psychiatrist, none of them are financial. So we don't get paid very much, so, just in case. But the reason why I'm here, because I was listening to all these wonderful presentations this morning, and I was like, I'm really left of center. I came into the world of child mental health. I actually like to say I do family psychiatry, not child psychiatry, because really how you help impact a child's life is you help their family. Is that we're really actually about prevention. The whole idea why people decide to go into child mental health is that they work with adults with mental health disorders, and frequently what you hear from them is that my problems started in childhood. So we're really in this sort of space of what can we do to prevent something from happening. The other thing I need to disclose that's not financial is that actually psychiatrists are really bad at figuring out if somebody's going to go and do something violent. So we're really not good at predicting as a profession that sort of is somebody today really going to go do something or not going to do something. So it is a challenge for us, but it's one that we take on every day because we feel passion for trying to work in this prevention space and learn from a lot of other people, such as the people I'm hearing from today, about how we can do better at this idea of prevention. This slide hopefully points to this idea that we are in a moment of crisis in our country, across the nation. This is not just a Texas problem, this is a nationwide problem that we have more and more youth across the country who are in crisis related to mental health. The numbers just keep rising. And this is looking at emergency room visits. And one of the things that happened when the COVID occurred and things shut down is what emergency rooms will tell you across the country is that actually the emergency room visits for mental health crises increased. So as you were hearing from a colleague earlier, there is definitely many youth coming into the emergency room because they were not having access to normal care. And even with the normal care, we are really underfunded across the country, and specifically in Texas, we're very underfunded. So there's often not places to send people to when it comes to what to do, and that can lead to an overall state of helplessness that makes it kind of feel like there's no way to solve this problem. But in child mental health, we try to stay positive, and we want to figure out what we can do to kind of maybe be of more help. And as again, you can see here, the rates of suicide attempt are obviously rising. We're seeing rising across different racial and ethnic demographics. There is still information that the young people who die by suicide still tend to be male predominantly versus women, but there's actually rising populations within some of the minority groups that before seemed to have some protection, and for reasons that we don't exactly know clearly yet, those rates even within minority populations are also steadily on the rise when it comes to young people. During the COVID pandemic, you're correct when you say that you think that more mental health problems are occurring and nobody can tell you otherwise. I'll tell you you're correct, so you feel good about that. But yes, we're seeing more young people who are drinking, using more substances, which to me alcohol is a substance, but nonetheless, more people who are reporting that they are feeling depressed, and more people, young people, considering that they might have suicidal thoughts or wish to die. When they talk about what we can help, how we can help young people who are in crisis, talking about this idea, I've heard this theme a couple different times today, this morning. My background is actually in attachment, and one of the reasons why I work in this space is this idea that I learn from somebody who I trust. That's how human beings work. And so if I don't trust you, I'm not going to learn from you. So who do people trust is a really important piece of this puzzle that everybody's kind of said over and over again. I trust another veteran. I trust another firearm owner. I trust somebody who kind of has a similar life experience to me. Those are the people that are going to make me convince myself to maybe try a new behavior, try something different. This is one of the reasons why we need in our own field to have more diversity amongst the providers, because we understand that by having that diversity, we actually can help more people more effectively. But young people, no surprise, are more likely to trust people that they know, and that they're more likely to tell those people than people that they don't know very well. So although we have to have multiple layers of defense, I think was sort of how you talked about it, the same thing with us. There's multiple circles to those kind of how we can help young people. And so you can all consider yourself a part of the circle because you are part of our community. And some of you may have maybe less of an ability to make somebody really change their mind, but as you get closer to that circle of how you feel attached, you're going to have even greater impact. So this is why we really talk about building up communities to be stronger, and it's not really about one person, one choice. It's really about the whole community. So the Texas Child Mental Health Care Consortium, say that 5 times fast, was developed out of 2 crises in our state. The one was related to the hurricanes and the sort of devastation that occurred for families with the hurricanes. The second was, unfortunately, the shooting that occurred in Santa Fe. So this really galvanized the Texas legislature. There had been lots of really great people organizing before that time to try to talk with the Senate and legislatures around sort of things that we can do on a statewide level. And so this is how the Texas Child Mental Health Care Consortium kind of came into being, was based on these 2 crises. And our vision statement is a bold one, I admit, but that all children in Texas will have the best mental health outcomes possible. And we do this by advancing healthcare quality and access, quality and access. You can have access to something that's not high quality, and we know where that leads, so we want to pair it with both evidence-informed, evidence-based, family-centered approaches. If you kind of think about like you're just high school and you had a rival high school wherever you're from, and the idea that those 2 high schools would get together and work, just take that to the higher level where money's involved with institutions with fancy names, and getting them to work together can sometimes be a little bit challenging. But we've managed in this collaborative to really work across the 12 departments of psychiatry and health-related institutions in the state of Texas. No other state is doing this. This is actually very phenomenal. I'm very proud and excited for our state that we've made this sort of jump to collaboration. And the work had been laid down before the consortium was created, with the department chairs of psychiatry for several months before this consortium was created. We're meeting regularly with no financial incentives to just learn how can we work better together. We keep hearing that same theme as well across all the conversations today, is that we're going to solve these problems by working together, finding common ground versus finding ways that we're different or we don't agree with each other. So this was established in Senate Bill 11 in the 86th regular session. The idea was that we are going to address urgent mental health challenges, improve the mental health care system in the state related to children's and adolescents' care, and enhance the state's ability to address mental health care needs. So there's actually several programs that are part of the consortium. My medical directorship role actually is involved. Two of them is the Child Psychiatry Access Network and also the Texas Child Health Access through telemedicine. Again, we all say TCHAT because to say it otherwise, you never get through it. But we also do have a workforce expansion piece. We are also increasing the number of child mental health providers in the state of Texas, and we're also doing some mental health research to maybe inform best practices into the future. So the Texas Child Health TCHAT, sorry, even myself, I'm going to say it. This is actually direct care. We are directly coordinating care with parental, legal guardian permission where kids actually are every day, hopefully, at school. We want to make sure that we can help the children where they're at versus trying to make them go far away. Now, I work at a particular organization here in Houston. I was routinely seeing families driving 2 hours one way to see me for an appointment. That's very disruptive in a person's life. You add on top of that the other sort of ACEs and challenges that a family may have, you can start to see that even if there might be accessibility, which actually there's really not, then just the hurdles to get to an appointment become very difficult for a family. So this is providing access to where kids are sitting. We also provide education to the schools themselves based on what the schools say they want. So a local approach. We do not top down say, hey, we're going to go teach you about this thing that you don't really care about. We ask schools, what is it that you want to learn? What is it that you feel like you have a hole in, your education, your training, and how can our health-related institutions help you with that? And so we do a partnership, and that informs what kind of training that we provide at the local sort of school district level. And then we also have a statewide data management system that, again, is starting to become other states are now becoming jelly of us. Sorry, I speak adolescents sometime. So they're kind of calling us and figuring out, what are you doing? How are you using the system? Hey, we might want to have a system like that as well. It's in its very early stages, but I do think that as time moves forward, we're going to have a lot of very important information to share about how the programs are working and what kind of things we can do to inform to make them better. To date, we have over 336 districts across the state of Texas with over 3,000 school campuses with about 2 million covered lives. So that obviously doesn't mean we've seen 2 million kids, but we have the ability within those school districts to make a referral to TCHAT if a parent or legal guardian gives us permission to see the child. You can see here, we actually got the money in August of 2019. We started having our first service of child care, mental health care, in May of 2020, which is really unheard of. I don't actually even know how we did it. It's kind of like childbirth. I don't really remember the pain that it took to get to that point, to actually getting funding, making the plan, making the budget, getting it to all the HRIs, getting stood up. It's definitely a lot of ongoing phenomenal work. But we have at this point, with the funding that we have currently, covered about 40% of schools across the state of Texas. And there's conversations that are going on because of the tragedy in Uvalde, whether or not we should actually consider about expanding further than that. So we'll see where that goes. We really want to pay attention to equity and making sure that this service is truly available to Texans across the demographics. And we're pleased to say that right now, when we look at our information of the sort of covered lives, that we are very much in line with across the state, sort of the racial and ethnic makeup of the young people and their families. Which is not surprising. We have served over 6,000 students to date since we've started, and we do tend to see more young women versus young men. This is an ongoing problem about how to help us sort of understand that sometimes if a boy is acting out, being impulsive, aggressive, that this is not a behavioral problem that needs punishment, that it might actually be a mental health issue that needs some assistance. So we're still going to be working on how we can kind of make those rates get better. It's actually more common to have more young men before the age of 12 have mental health issues. It's when we hit puberty that young women start to outpace young men. I think that actually has to do with stigma and sort of how we think about the differences in genders, but that is sort of the data that we have. And we actually see probably a nice sort of accidental thirds. About a third of the kids are in elementary, a third of the kids are in middle school, and a third of the kids are in high school. So again, you're talking about prevention. If I could see a family for the first time when somebody's 9 or 10, help them understand what's going on with their child, give them some resources, give them an intervention, maybe I'm going to prevent something down the road that we're not going to have for 3 more years. So this is the sort of golden ticket that child mental health has, is can we do something now when the child's this age before the problem has become sort of severe, chronic, and difficult to manage, and they've also added new problems on top of the initial problem. Can we actually get in there before that sort of cascade has occurred? But nonetheless, we're there also whether or not the young person is in, like I said, elementary all the way up into high school. When you see the reasons for why we're being asked to see a young person, these are the reasons for referral. You can see here that the most common reasons that they refer a young person to us for TCHAT is either anxiety or depression, followed by anger. And again, a lot of young people who've been traumatized, and that we have certainly lots of information about ACEs, the sort of adverse childhood life experiences, they're not always going to act sad or depressed. They're going to act angry. And sometimes if we treat somebody with anger with sort of a punitive approach, we actually can sort of simmer and fuel that anger and kind of make it actually turn worse, turn inward. But we also do have a significant amount of young people that have concerns for suicidal risk, as you see in the middle of the chart at 17%, as well as self-injurious thoughts or behaviors at 14%. So again, the sort of issues for why we get a referral run the gamut, which makes sense to us because we're really here for all takers. The only children that we will not see in TCHAT are young people that are in the immediacy of a crisis, because unfortunately we are telehealth, and if somebody's really in a crisis, they may need to be in a safe space for that crisis to be evaluated. Or if they're sort of acting abnormally and you think they might have already ingested something, TCHAT's not for that sort of very immediacy of the crisis. We're also not for very young children that really can't collaborate on a telehealth visit. So sometimes we might see somebody initially and go, you know what, this is not going to work, telehealth, and help them get connected to a different resource. And then finally, the biggest one, we will not see young people without parental permission. This was very important in the state legislature. They actually talked to me about it kind of excessively. But as a healthcare provider, I do not see children unless their parent or legal guardian has approved of it. So we have occasions where we can't track down the legal guardian, and we have to tell the school, I'm sorry, we cannot see that young person, because we need to have that parental involvement from the very get-go for a number of reasons. Here you can just see the number of encounters. We're steadily growing month to month, and I expect this numbers to continue to rise as we continue to have programs stand up. One of the things I do want to say about when the program stood up, not all of the health-related institutions stood up at the same time, and not all the school districts started at the same time, because it's a process, it's a conversation. We have a memorandum of operation, an understanding that we develop with the schools, and that can sometimes take months. It includes the school boards and other things to make sure everybody's really aware of what we're doing. We're not trying to go in under the cover of night and see kids without anybody's permission. So that process itself can take some time. But as we continue to onboard more schools and more schools start to use the service and the families start to say that, well, they are saying already that the service is helpful, I think we're going to continue to see growth in our service. So again, to date, we've had over 20,000 encounters with the young people that we've seen. When people often ask, well, what are you doing? So a lot of people, again, there's sometimes a lack of trust that we're trying to help build by providing information. The vast majority of care that's provided in TCHAT is actually a therapy intervention. Most of the evidence-informed, evidence-based treatments for children and adolescents related to mental health is actually a therapy of different kinds, not go see me, a psychiatrist. I'm really the sort of top tier, sort of not top tier like I'm the best, but you don't need as many of me as you need of other types of really well-qualified individuals who can provide a psychosocial intervention. So the vast majority of young people that are being seen in T-Chat services are actually getting a psychosocial therapy intervention and or assistance. We're trying to help them find resources beyond just the mental health issue. When we discover that there's other things going on, then our job is to try to help figure that out. And we do allow for our team to see the young person for a short amount of time, but we can continue to see them if there's really not a place to catch them. So we're not going to just see somebody and then say, oh, sorry, we're done, good luck in the world. If we really can't find a good resource after the fact of our service, we will continue to see that young person. We're going to track that data over time to see where we have additional deserts of mental health care, but we will continue to see the young person. But if we can help them get connected to the next resource, that's what we do, and we do that for 50% of the time to date, that we are sending them to different resources. And as you can see here, we have a pretty extensive list of information we're keeping as far as what kind of resource do they go to next. So one of the things that we're going to try to do as we move forward, as I'm almost done, is we're going to try to actually increase our reach in getting more ISDs and more schools to participate. We are working very specifically on some specific interventions related to trauma, obviously because of COVID, substance misuse, as well as suicide and anxiety. So our services are typically face-to-face, telehealth, but we may have some targeted face-to-face interventions, as well as we really want to make sure that we're increasing our ability to do bilingual services, particularly around grief, again, because of COVID. So there'll be more to come from us in the next bit of time, and we'll be happy to talk to more people who want to learn more about our services. And thank you once again for allowing me to participate in this really cool conference today.
Questions here. I think I'll start with one of my own for Dr. True. I'm curious, what do you think is a way to measure success for suicide prevention initiatives like the one you described? How do you know if it's working?
We actually have a conference in mid-July where a major part of what we're going to be talking about is how to measure impact, because right now we're mostly using process measures and looking at different changes in knowledge, attitudes that are exposed to educational messaging. I mean, I think, it's going to be really tricky to measure success by sort of big things like decrease in suicide rates. I think I really appreciated your presentation and kind of how big the picture is and how much can we really move the needle when the picture is that big. Honestly, we're still working on that. I think that I'm a qualitative researcher, and what I've heard is that we really are kind of changing the conversation, and I think we use the metaphor of we want people to think of this as putting on a seatbelt, that you don't put on a seatbelt when you're already in an accident or after the accident. You put on the seatbelt before, and we did change that in our country. So I'm sorry I don't have a better answer for how to measure success, but I think it's going to be multifaceted and probably looking a lot at first at process measures.
Thank you. Dr. Williams, are insurance companies supportive of continued telehealth opportunities for students and youth?
Well, one of the things that's actually interesting about T-Chat is I didn't talk about the funding. We are funded through the state. We're not actually funded through medical funding. So all services that we do for the child are free. So we actually do not bill their insurance for the care that they have. We did have some pilot programs prior to T-Chat where they did have grant funding initially, and then once the grant funding was done, they started to kind of bill insurers, and they saw a huge drop-off of families participating. So we do need to think through what to do from a financial perspective related to insurance, particularly if we want to grow to be larger than we currently are, because it is a billable service. But we also at the same time recognize that one of our goals is access, and that sometimes even with insurance, people, for whatever reasons, were not choosing to take the telehealth services. So we're kind of a little bit outside of that conversation right now, and we're happy to be in that space.
Another question for you, Dr. Williams. T-Chat question. How do you coordinate with schools and school districts that are removing social workers and counselors from schools to save money?
Well, one of the things that TCHAT does require is it does require a school to have somebody on site who could, we pay for the equipment, so the equipment comes in the school doesn't have to pay for the equipment, but we do need somebody to escort the young person from their class into the confidential space. So if they don't have team members, it could be a nurse, it could be a social worker, there could be a number of different people we might designate as the person who's going to help us with that piece. And we may need to do some training with that person so they know what to do in case the young person discovers they are in the middle of a crisis. But by and large, we find that schools typically are wanting to partner with us. We occasionally have schools say no thank you, and we say that's fine. One of the things I'm actually really clear about is I don't want to have a state mandate where I have to say all the schools have to use us, because I think that is just not the best way to go. So if a school has other ways that they want to address mental health in their community, we need to respect that. But we actually find more schools are wanting to do it, and we've helped them figure out ways to use the staff that they have. Sometimes we might use a central location, so maybe they don't have it on campus, but they have it at the school business office or something. And so yes, the families have to travel a little bit, but they don't have to travel 2 hours like they used to come see me in my office. So it still is potentially a win for the family at that point.
Dr. True? Legislation does not apply to domestic violence. Why is that?
Oh, I may have not been clear because I was running out of time, but in terms of our legislation, one of the concerns that was brought up at the initial hearings for the legislation was that domestic violence or intimate partner violence advocates didn't want it to conflict with existing legislation that was protecting people who are experiencing intimate partner violence from having firearms should be removed from their partner. So it was just basically looking at the wording of the legislation to make sure that it wasn't conflicting with existing legislation that was important in protecting people who are experiencing intimate partner violence. I hope that's clear. It wasn't that someone could be going to store a firearm for lots of different reasons. The retailer doesn't even have to ask them, why are you storing this firearm? So there could be a lot of different reasons, but basically the legislation was just to say the retailer doesn't have to ask, and they can return the firearm. We do have people who have come in and said, this has opened up a lot of different conversations with the retailers. So on our community practice calls, they'll say, I just had someone come in, she wanted to purchase a firearm because she's afraid of, her husband or her boyfriend. And I had to talk to her about, this may not be the best way to protect yourself. I'd like to sell you a firearm, that's what I do for a living, but I also think you need to get access to some other resources in the community, and so we've given them resources to give to people. So it's just kind of also giving these retailers a way to talk about all the different things that happen in their shop, all the different situations that come in front of them, and how can they deal with them in more sensitive and thoughtful manners, as they do, but with some support.
I'm going to follow up because there's another question that I think is somewhat related. If a temporary firearm storage is utilized, is this discoverable? And could this be punitive? For example, if a divorced spouse is using this in court?
Right. I mean, that's a great question that I don't have an answer to, so we'll have to look into that and add it to our kind of toolkit. I will say that a lot of the reason we have the community of practice is because these questions come up constantly. And we actually have met with our ATF field office to talk through the program with them. They are partnering with us and answering some of our questions. And what we often try to convey to the firearm retailers is that just having, I don't know if they can be compelled to give out information like this, but they really have to treat the temporary hold in many ways the same way that they would any time that they take possession of a firearm. So once they log the firearm into their, it's called a disposition and acquisition book, I think. But once they log the firearm into their book, it's actually in the firearm retailer's possession. They're holding it for the owner, and they can give it back to the owner. But once they've logged it into that book, they have to do a background check before they can return the firearm to the owner. And if the owner doesn't pass the background check, the firearm retailer cannot return the firearm to them. So I know that doesn't answer that question exactly. I have to look into the answer. But what I'm saying is it's very there's a lot of conversation that has to go on with these firearm retailers and understanding what is going on within their shop when they take possession of someone's firearm and then return it.
I'm getting a notification that I have to stop. There are 2 more questions that I'll pass on to the respective speakers, and maybe you can find them in the over lunch or over break. So thank you so much, both of you, for this wonderful.
Thank you. Okay.
All right, well, the speakers are coming up. I'll introduce myself. I'm Lillian Cow. I'm the Chief of Acute Care Surgery at McGovern Medical School, and I'm a trauma surgeon at the Red Duke Trauma Institute. So our next session is on school-based violence, and our first speaker is Dr. Jeff Temple. He is the John Seeley Distinguished Chair in Community Health at UTMB, as well as a licensed psychologist and the founding director of the Center for Violence Prevention. His research focuses on the prevention of interpersonal, community, and structural violence, and he has been funded through multiple organizations such as National Institute of Justice, NIH, and CDC. He also co-chaired the Texas Task Force on Domestic Violence and has served on the board of directors of the Texas Psychological Association. So let's welcome him.
Thank you all very much, and thank you for putting this together, Rice and Baker and everyone else involved. I also, since I put that together, have assumed the new role of, it's on there, the Vice Dean of Research and Scholarship for the School of Nursing. So basically what that means is that I don't sleep anymore. But I have surrounded myself with really impressive people, the back room over there. If you all could raise your hand. Thank you all very much. They're the reason I have any success whatsoever. Also with Dr. Gio right here. So I'm going to talk a little bit about the intersection of dating violence and firearm violence, but also talk about how schools can serve as a place for prevention and intervention, and really what we need to do this is policy. So Dr. Gio Wright's going to follow me and talk a little bit about how to talk to policymakers, how to work with them in getting our ideas actually implemented. So that only, when we write something that not only one other scientist reads it at another obscure university and nothing ever happens with it. So I did promise Liz Torres, who's my associate director back there, that I would say at least once that the reason I wasn't here this morning because I was on NPR talking about the intersection between gun violence and mental health. I think the over-under of how many times I was on the national NPR this morning was about 2, so I'm right there. So first, before going through that, we established the Center for Violence Prevention at UTMB in December 2019, 3 months before the world shut down. And so now when I get to do these types of presentations, I take every opportunity to talk about who we are and what we do. So basically we are, hopefully for the nation, but certainly in Texas, going to be a resource and a clearinghouse for violence prevention. And so when we talk about violence, it's not just dating or domestic violence, but structural violence and racism and discrimination and affordable housing and child care and basically anything and everything that can be looked at as violence. And I think Dr. Gio Wright will say something a little bit about that. We have a few core faculty members, one of them over here who's Dr. Gio Wright, who is now the Vice Chair of Family Medicine, Research in Family Medicine at UTMB, and then Dr. Leela Wood and Dr. Baumler, and we're growing, including there's a couple people in the audience, Dr. DeMello, Bendy, there you are. So we're growing, and we want to be there, a resource for the nation in terms of violence prevention, so please contact us. All right, so more to the meat of the talk. This is me. You can see me in the corner over there. I'm wearing the exact same suit I'm wearing today. And this was the governor's roundtable after the shooting at Santa Fe High School a few years ago, which incidentally, and Shannon will talk about this, the day before the shooting, Shannon and I were both testifying to Texas House of Representatives about school safety and preventing violence. So it was a terrible coincidental timing. So in this, and with the roundtable, and one of the things that I mention often, and I'll get to this a little bit more in a few minutes, but when we are at these types of roundtables, I emphasize that, you know what, it is a multifaceted problem. When I say it, I mean gun violence. And we're not going to resolve it by increasing police, no offense to y'all in the back, or hardening schools, or taking care of mental health illness. So we want these new legislative priorities in the national conversation are increased services for mental health, increased resources for mental illness. As a psychologist, that's fantastic. Please give us all the resources we need. We need them. We're in a mental health crisis made worse by the pandemic. We need all these resources. We need this money, but it's not going to do anything to curb mass shootings or really everyday gun violence. It's just not. It'll help with suicides, but it's not going to do anything with mass shootings. So that's the emphasis that I put at these roundtables, and I wasn't invited back. And when thank you. And every time I get a chance to talk is it has to be prevention. It has to be prevention. It has to be robust generational investments in prevention. So it has to be the same way we tackled as a public health problem COVID, HIV, cancer. We have to do that with gun violence. We just have to. And if you look at some of the studies that have been out there, and I don't know if someone has addressed this already because I was on the national NPR thing talking about gun violence. So if you look at the gun violence as a public health problem in terms of deaths over the past several years, it ranks up there with things like cancer and heart disease. It's now one of the leading causes of death for youth and young adults, the leading cause of death for Black youth and young adults. If you would look at that and the expected amount of publications that we would see with gun violence, it's about 2% of what would be expected given the public health crisis. From funding, it's, 3% of what we would expect in terms of funding for this public health crisis. So we need just tons of money and resources and our full national attention on this crisis. It's not going to get better until we do something like that. And even then, it's going to take generations to get better. And there are stuff that we could do in the meantime, and that's what I'm going to talk about here today. So dating violence is sort of how I got into the field of gun violence at all. So we started, I'm going to just jump to this slide right here. It's really hard to read. I apologize, but just I'm going to verbalize it. We started a study in 2010 where we looked at about 1,000 youth in the Houston area, and we've been following them now for the past 12 years and are still following them for the next few years. So when they're 15, just starting to get into relationships, sophomores in high school, now they're 26 years old, a lot of them have kids themselves, are married, and we'll be following them until they're 30, and then hopefully longer if we continue to get money to do that. And we're also including current partners. And so we're looking at this to look at really the risk and protective factors of multiple forms of violence. Initially, I was focused on dating violence. So this is things like physical, which is what you know of, hitting, pushing, pinching, choking, biting. Psychological, which is calling someone stupid and ugly and worthless and fat, and all the while alienating them from their friends and family, which we know through decades of research that sort of psychological abuse is more damaging than physical violence. That, the whole adage, sticks and stones may break my bones, but words will never hurt me, is really stupid and needs to be turned on its head. It's really the reverse. Things like sexual violence as well, and we see the reason I want to focus on dating violence and prevent dating violence is we see this as a first step into future domestic violence and future other forms of violence. And we could even go back a little bit further, and we see things like sibling violence and bullying and homophobic name-calling and harassing as all those as predictors of dating violence. So you'll see when I talk about this, we need prevention to start early, be developmentally appropriate, and continuous. So the other thing that we did with this is after Sandy Hook, which was 2013, that resulted, I think, in the death of 27 people, President Obama loosened the restrictions on the ability to research guns. Now, there's a little bit of a misconception that we weren't able to study guns. That's not true. It just wasn't supported financially, and it's pretty hard to do anything if it's not supported financially. So we had a grant through the National Institute of Justice at that time to continue our longitudinal study. And so the day after he loosened the restrictions, we went to IRB and added questions on guns. So gun carrying, gun access, gun use, threaten someone with a gun, being threatened with a gun, how they bought their gun, what type of gun, why they carry a gun, all that sort of stuff. And what we found was pretty interesting, and we also looked at its relationship to mental health symptoms. So I'm changing the course of this talk a little bit. So I was going to talk more about dating violence and the incidence of that, and I will still to a certain extent, but I'm going to kind of blow through these slides a little bit. Basically, the important part of this slide is that by the time that people are in our study, which we think is pretty representative of the nation, is that a little less than half of people by the time they're about 25 are going to be in a violent relationship, some sort of physically violent relationship. And this wasn't driven by just one item. This is across all of the items, and I'm old so I can't see anymore. But if you look at threw something at him, so over the 8 years, 34% had been victimized by that. Punched, 34%. Pulled hair, 29%. And pushed, shoved, or shook, 39%. So this is boys and girls, that violence, this is just to say that violence is a hugely prevalent problem that has really negative consequences. I'm not going to necessarily get into the negative consequences except to show it's linked to firearm violence. And we also know what predicts dating violence. With dating violence, physical dating violence is domestic violence exposure, child maltreatment, and deficits in conflict resolution. So this is something that we put together, a paper where we did an algorithm to look at what is most predictive, so look at the strength of relationships, and that's what we found. Consequences are many. We don't necessarily need to go through all of this. The one thing I will say, and this goes to my theme of prevention, is that it is fiscally responsible. So even if you don't care about kids, even if you don't care about mental health or anything else, it is the fiscally responsible thing to do to devote money to prevention. Because we know that kids who are stressed, who are in violent relationships, they're going to do poor academically. And if they're going to do poor academically, they're not going to have a good career focus, and then they're going to be lousy taxpayers. So we can say even to some of our less kind-hearted friends that it is, that's the way, you get what I'm saying. I'm going to shut up. All right, so the other really important thing about consequences of dating violence is, again, preventing future domestic violence. Domestic violence costs us, again, going back to this fiscal argument, billions and billions of dollars. So if we could prevent domestic violence, then we can save taxpayers a heck of a lot of money. And to do that, we need to prevent dating violence. We need to focus on teens. We need to focus on elementary school students, middle school students, high school students. The other thing is we know that it is a huge predictor of firearm violence. So if you look at all the mass shootings, so this isn't even counting everyday gun violence. When I say everyday gun violence, I mean gang violence, interpersonal conflict. If you look at that, if you look at those types of mass shootings, or if you look, sorry, not mass shootings, if you just look at homicide, killing of a partner, killing of a parent, it is overwhelming that that is what gun violence is responsible for. So getting totally away from mass shootings, school shootings, it is a huge problem. Domestic violence, dating violence. Now, going strictly to mass shootings, we know that, and you can see this study by Geller et al. It's a little bit small, I apologize for that, but over half of the mass shootings from, I think it was 2014 to 2019, well over half involved some sort of domestic violence where it was an actually domestic violent incident. It was spurred by domestic violence. You can look at Uvalde. He shot his grandmother in the face before going to the school. We see this over and over and over again with mass shootings, that there's a history of domestic violence, there's a history of misogyny. So we know that there's a relationship here. So what does that all mean? Well, it means that we need to do a better job of talking to our kids and universal prevention approaches to healthy relationship skills. So I'll say that over and over and over again, is that we need healthy relationship skills. We need to teach kids to be in a relationship. So going to school, I'm gonna be done in 5 minutes. And so going to school is important. Schools are overwhelmingly safe. They are the safest, for a lot of kids, the only safe place for them. So I really, obviously school shootings are scary. I have a kid that's a senior in high school, one that graduated last year from high school. I still get nervous when I see these things. There was a scare at our high school a few years ago when I was on the school board and my kids were there, and it was frightening. It was parents pulling up. I get it. It's scary. It's terrible. But schools are not the boogeyman. Schools are safe. They're overwhelmingly safe. Again, for some kids, it is their only safe place, so we don't want to take that away from them. Solution. Now, I know there's police in the audience. I love y'all's work. I serve as the community liaison to our police force in Galveston, so we're working with them closely. We absolutely depend on police for their work, so this is not throwing them under the bus, I promise, especially since they're here to protect us right now, so thank you. But it really isn't. So we need, and something that Dr. Gee and I have talked about is the Children's Defense Fund said that for every dollar you invest in hardening a school, so that is in police force, in barricades, whatever, we should match that with $1 in behavioral health. So, and I think that's a brilliant approach, and everyone kind of gets what they want. So another thing, mental health, mental illness is not the cause. So that is going to be another theme that I say a lot. So I'm a psychologist. Again, give me all the resources, give me all the money. If I hired 10 psychologists today, they would all be full in 3 weeks. We need more psychologists. We are in a mental health crisis in this country, in this world, that's made worse by the pandemic. The last wave of COVID is going to be mental health. It's terrible. So I'm not saying that we don't need resources. We do, but it's not. When you look at mental illness, only about 4% of all violent incidents are caused by someone who is mentally ill. There is no diagnosable mental condition that explains mass shootings. There just isn't. Nothing. And if you look at it, thank you. If you look at it, they're more likely to be victims than perpetrators. And it is a politically expedient boogeyman to blame mental illness, right? It is, you know what? I am not mentally ill, so therefore I can't do this. Nothing bad can happen to me like this. Mental illness is scary, and it's crazy, and why would anyone do this if they weren't crazy? Well, how do you know they're crazy? Well, because they did this. Well, that's not good enough. I mean, if you look at it, it is not. Like, most mass shooters don't even have a diagnosis of mental illness. But even if they did, it's not the cause, right? 20% of us have a mental illness. We're not doing this. So what is the cause? Sorry. It is access to guns. And I know I'm in Texas, and I know that people sometimes don't like hearing that, but that's what it is. We have violent video games in our peer countries. We have mental health problems in our peer countries. We have COVID in our peer countries. We have bad parents in our other countries. We have everything you can think. What do we have that they don't is access to guns. Now, I also live in reality, right? We're not getting rid of the guns. Despite what Beto O'Rourke says, they're not coming away and taking away your ARs. Now, that doesn't mean that we can't make some common sense changes, like age changes from 18 to 21. You have to be 25 to rent a car. Seems like a common sense thing to me. And there are other really sensible things that we could do. Safe storage laws, red flag laws. Red flag laws have the really awesome potential to not only reduce gun homicides, but gun suicides as well. And that's after due process, and it's only temporary where we take the gun away. So there are really reasonable solutions to this problem. Now, again, knowing that we live in reality, knowing that the guns are here. Even if we make generational investments, they're still here. So I really want to go back to what I said at the beginning, that it's going to require universal prevention programs to target kids from when they're in elementary school to when they're post-high school. And this has to be not just the school assembly. It can't just be a one red ribbon week. It can't be a guest speaker. Those aren't going to do anything at all. They just won't be effective. What we need is real socio-emotional learning programs, healthy relationship programs that start in kindergarten and go every single year throughout the years. And that's doable, and it will work. And we know it works. We've shown that it works. I was going to show you this quote real quick. Where is it? Man, I messed up there. Oh, because it's going forward. Anyway, I'm out of time anyway. We know it works. We've done school-based prevention programs that work in preventing violence. We can't identify school shooters. We don't know what they look like except the fact that they're male and typically white. Other than that, we don't know who's going to be a school shooter. Some of them came from well-intact families. Some of them came from poorly intact families. Some of them got A's in school. Some of them got C's. Some of them got F's. Some of them dropped out. Some of them were just there in school riding along. Some of them were stars. We aren't going to be able to identify school shooters. And even people that say like, oh, well, these kids talk and the kids know who's the shooter and all that. Sure. That's at every high school. There's about 100 of those kids. So we can't take all of them away from school. So we have to do, instead of trying to identify and target a school shooter, let's do universal programs that are socio-emotional focused, that teach healthy relationship skills. Best case scenario, we prevent a school shooting. Worst case scenario, a kid that was not going to be violent learns how to be healthier and happier. Thank you all. Okay, you got it. All right, I'm done.
All right, thank you so much. Our next speaker is Dr. Shannon Guillot-Wright, who, as already mentioned, is the Vice Chair of Research and Health Policy in the Department of Family Medicine at UTMB. She also serves as Director of Health Policy Research in UTMB's Center for Violence Prevention. She researches structural violence with a particular emphasis on the use of research evidence to foster equitable policies. She conducts photoethnographic fieldwork, and she's actually a selected artist for the National Academy of Medicine's Visual Health Equity Gallery. So we are pleased to welcome Dr. Guillot-Wright. Thank you. How does this work here? I'm not sure if I was supposed to pull up the presentation. Good question. I think someone else. As we hold for technical difficulties. Okay, I'll ask a question while we're holding for technical difficulties. Good idea. Dr. Temple, so you talked about addressing kids, but so I'm a surgeon, and a couple years ago, one of my colleagues down the street was shot by her husband, and she was, a strong individual, a surgeon, smart. So I guess the question is, what can we do for adults? It'd be great to prevent it down the line, but what do we do even as friends, colleagues, providers, et cetera? Oh, it's fine.
And I hope. Try to do this. Oh, there we go. I hope I'm answering his question. So I say when people ask about that, the main thing is to be a resource for that person. So, and what does that mean? Well, that means that you might think that this person is in a violent relationship or know it, but it is a matter of sticking to it and being a resource for that person, even if they don't want to talk to you about it. They, despite the violence, they originally fell in love with this person. They have investments with each other in this relationship. People don't often want to be told what to do. And so I think just being there as a friend, saying that you are a resource, you are someone that they can turn to, and knowing that they might not that night, but maybe next time that they do come to you. And the same for physicians and clinicians out there. We talk about asking about domestic violence, and not just asking in a way that says, you're safe at home, right? Or everything's cool at home, because that doesn't get at it. We need to ask directly about, are you in a physically violent relationship at home? Or has your husband ever hit you? Or has your wife ever hit you? We need to be direct about that and ask. Going back to my worst case scenario is that maybe they are a tiny bit insulted, who cares? Best case scenario is they tell you and you get them resources they need. Or maybe even a most likely case is now they know that you're someone, a healthcare professional, that now they know that this is a healthcare issue, and so maybe they see you as a resource and come to you in the future, or they have a friend, because every one of us has a friend who's in a violent relationship. Now they know that you're someone that they can resource and access those types of services. Did I not talk long enough? We could do all my questions, so what else we got?
I know. Do we have any from the audience that I can ask in the
We could play
meantime?
clips from NPR. Go ahead. So adolescents that work and exposed to violence on the job. I have not personally looked at this. I will say that adolescents are exposed to violence, whether they work or don't work, through movies, TV, media, their friends, YouTube, everything in between. I will say that there's probably some jobs that maybe are more likely than others to expose them. But yeah, our kids are being exposed to violence on a pretty much an everyday basis. And then if you look at the really scary stuff, like on 4chan and 8chan, and some of the dark web places, and what the Uvalde shooting was involved in, I think the Buffalo shooting was involved in, you're seeing a lot of that exposure. And is it the exposure that causes them to be violent? Probably not. Maybe a little bit. It's probably more likely whatever is underlying the fact that they want to look at that stuff and be exposed to it, that is the same thing that's relating to this. Thank you for the question, and it looks like I could shut up.
Good job, Jeff.
Thank you.
Okay, thank you all for being patient as we got that going. So I am Shannon Guillot-Wright, as you heard, and I have been working with Dr. Jeff Temple for quite some time now, and as he said, we had gone to testify in Texas about healthy relationship programs in schools. I also was the founder of the Adverse Childhood and Community Experiences Collaborative for Galveston County. And through both of these experiences, at the time I was still a graduate student, and I was really coming to the realization that a lot of times we would talk about policy, or we would go testify, or we would create a policy brief, but we didn't actually know what was the empirical evidence behind that? How do we actually take those stories? How do we actually take the research and the evidence and actually start to shift policy, right? Even if it takes a decade, what's the empirical research on that? And what I found was that there wasn't a lot of research on it. So today, that's what we're going to talk about, the use of research evidence. It's called URE, kind of where it's been and where it's going. I'm going to discuss the Research to Policy Collaborative, so its background and its purpose, and then using mixed method studies to really try to understand evidence use for policymakers. So as part of that journey that I was on, what I really was trying to understand was how do we start to move these ideas forward? And so I ended up taking a postdoc at Penn State, but it was located in Washington, D.C. And I did research with policymakers and with other researchers. So I'm going to kind of go into that and then how we can start to use that in our own ways here. So with URE, there are basically 3 generations of thinking on research use. So one is linear, right? So that is, what can we publish? What can we disseminate? How can we, take a policy brief and put it in the hands of a staffer? Linear is not, none of these are bad, right? But these are the generations. So this was sort of first generation thinking. Second was relational. So we realized, okay, just getting a policy brief in the hands of a staffer isn't enough. We need to build relationships. Do we understand their priorities of policymakers, of the practitioners, and communities? So it's this multi-level process. Where we are right now and where the research is systemic. So what needs to be in place to support more research use in organizations? So that's sort of where we've moved. So using science to really improve or create health policies in this multi-level process. And it really requires a good understanding of relationship building, of behaviors, problems, actors, and all the different results that we have. So empirical research on the use of research evidence. So what has been studied was like, what does good evidence use look like? What needed to be studied? How can better quality use be supported, and what interventions are most effective to deliver this outcome? What types of interventions have been evaluated? So again, there's linear that had been evaluated, relational a little bit, not much, and the systems change, not much at all in that space. And then what mechanisms do different interventions employ to generate changes in evidence use outcomes? And then how do we start to actually measure these changes? So that brings us to the Research to Policy Collaborative. So the RPC is a network that was created out of Penn State, and they now work with different universities and researchers across the US. And their goal was really to train researchers, coordinate Hill Day meetings, and foster relationships between the researchers and the staffers. And they were able to secure a William T. Grant Foundation award to study this process through mixed methods. So we had a quantitative survey element to it, and then I led the ethnographic research as part of that. And really kind of overall, participants really enjoyed being part of the RPC, and policymakers really talked about having access to evidence and appreciative of the Hill Day meetings. And then researchers really reported that it helped them learn how policymakers meet with constituents. So what we learned was that policymakers want research, but they want it in bite-sized, or what was called sometimes half-baked forms. And I'm going to go back quickly, and I realize that some people might not know what ethnography is. So in case you're not a qualitative researcher, ethnography is when you really spend quality time with participants. So you do semi-structured interviews or focus groups, similar to what you hear with qualitative research. But there's also an element to participant observation. So I would go have coffee with the staffers. I would go to their meetings. I would go to briefings. And so I got to understand their lives day to day a little bit better. So when I was asking them questions in the semi-structured interviews, I also had context of what that meant for them. And so I lived in Washington, D.C. for that year that I conducted the research. And so what we learned was that policymakers wanted research, right? So this was across the board, Democrat, Republican, Independent. People were really hungry for research and research evidence. And there were some frustrations when it came to how they could access that evidence. So some people talked about the fact that oftentimes our research is funded by the government, but then there were paywalls to actually access the research. For some people who had built relationships, they would email someone like Jeff and say, hey man, like I'm trying to get this article, can you send it to me? So those relationships became important, not only for the legislation, that maybe this researcher is working on, but legislation that might even be outside of their scope. We also learned that women and Black, Indigenous people of color researchers experienced more trepidation about the policy space. So I not only met with policymakers and did interviews with policymakers, staffers, but I was also meeting with the researchers who were engaging in this network and trying to build relationships. So what would happen is that we would have these trainings, or RPC would have these trainings, and generally speaking, the men wouldn't show up to the trainings, especially the white men wouldn't show up. Sorry, Jeff. They wouldn't show up to the trainings. They would say, I already know what to do. I'm fine. I'm comfortable in this space. And to be fair, when they went into the meetings, they were typically fine, knew what to do, and were comfortable in the space. Women and people of color oftentimes probably knew what to do, but they just didn't feel as comfortable going into that space without having a lot of direction, without the trainings. So it was interesting that the trainings, it was a result that I don't think anyone expected at the beginning. The trainings ended up actually kind of becoming a level playing field for diversity and men and women to engage with policymakers. And so although the trainings, some of the information, the people who attended the trainings, they already knew the information. But then they would ask, okay, what's it going to be like when we go into the meeting space? What's it going to be like when someone asks a question and I don't know how to answer it? And so it's sort of, giving them kind of power and support in that moment and saying there's going to be people to support you. You're going to be totally fine in that space. So that was kind of a pretty cool result that came out of it. And importantly, because we need diverse voices speaking to policymakers. And so if only one sector of our society feels comfortable being in that space, we need to make sure that we're doing something to level the playing field and so that it's a more equitable experience for people to be in those spaces. And then also, policymakers were more likely to listen or reach out to someone that they had a relationship with over a cold call or email. I think that's something that most of us could probably experience ourselves as well. When you have relationships with people, it really starts to change that dynamic. And so, whether it's having a healthy relationship in your school setting, or also learning how to have, healthy and productive relationships with staffers, and even staffers who you might not agree with, you might not see eye to eye, but they were still, wanting a lot of this evidence. And, for those who haven't engaged in the policy space as much, oftentimes staffers are younger. Some of them are interns who are barely, being paid to, rent a, apartment in DC. There are some more senior staffers, but even they are typically pretty young, pretty fresh, and there's a lot of turnover within that space as well. And so really being able to, and they also are pretty open to ideas. I mean, it's their job usually to be sort of the face of the office and to be pretty welcoming and to listen to different ideas. And so whenever you could engage, and again, going back to the previous slide of actually presenting evidence in a way, in a format that was helpful for them, not helpful for you. One guy talked about, he had his PhD and he was the chief of staff for one of the senators. And he talked about how someone sent him his dissertation. And he was kind of looking at this like, no one's even read my dissertation. Like, I barely read my dissertation. I'm not going to read your dissertation. But that person on the other line was probably like, man, I engaged with policy. Like, I feel good today. You know, I sent the staffer my dissertation. It got deleted. So it was, you know, what are the ways that you can engage that's helpful for the policymakers? And that was really important. And then also, academic systems are not set up to encourage policy collaboration. So this goes back to the systemic change as well that we see. And so there's systemic change that needs to happen on the policy side when it comes to how interns are paid. And, you know, because of that turnover and being able to support people who want to engage in policy but can't, you know, go live basically for free in DC. But on the other side, for academic systems, you know, we really need to start thinking about how we're encouraging this policy collaboration. You know, we do this research, we publish in, you know, high impact journals, and then oftentimes that's it, right? Like, our friends will read it, like maybe my dad will read it if he's feeling nice that day. My mom definitely isn't gonna read it. And so how do we start to really think about the system level changes that we can support people? Because this goes back to the other slide as well, that many junior researchers had a harder time collaborating with RPC and being part of the network because they didn't have as much discretionary funding. You know, they still, you know, they didn't have as much time to take off. They may have had higher, you know, teaching loads or, you know, all these different factors. And so how are we making sure that we are including everyone in this process? And, you know, I would also say that changing policy is not just meeting with the staffers as well, although this study didn't go into that, but it's also the narratives that we're telling and that the media is picking up. So although Dr. Temple was making lots of jokes about being on NPR, that's actually incredibly important, because if we can get on NPR, I think he's even been on Fox News maybe, if you can get on these stations that, you know, different people are listening to and start to, you know, craft a message in a way that they can hear. You know, the mother earlier, you know, who was talking about how she lost her son and how she had to craft her message to really reach people who may have different views than her. I think it's really important when we are wanting to talk about changing policy. We also need to think of ourselves as the democracy that is, you know, voting in those policy makers who will listen. Oh, and I already went through that one. Policy systems are not set up to encourage research collaboration. So, you know, for instance, sometimes reports, briefs, policy briefs, they would need them within 48 hours. And so, you know, you'd have to have a team who's, you know, really set up to be able to make that happen. You know, we do have that, the Center for Violence Prevention. We have a team that's able to turn around briefs really quickly. And because of that, we've gotten to build some really great relationships with policymakers. But not everyone, you know, has that as well. So we need to think about systems change on both sides. So recommendations, you know, keep your message simple. You know, whenever I've testified before, we've seen somebody, you know, literally like print out their PowerPoint slide and then like read the PowerPoint slide. That's not going to cut it, to be very frank. You want to keep it simple and keep your message engaging. You know, have your expectations, right? So whenever we met with staffers, sometimes it would be a 15-minute meeting in a hallway. And there were some people who were like, you know, I'm the vice chair of this, and I flew to DC, and I'm having a 15-minute in a hallway. Like, I get it, like it can feel weird, but that 15-minute meeting in a hallway can actually be really beneficial and can start building the foundation for these relationships. And so really knowing your expectations, having an awareness of what the space is like, so that you aren't taken off guard and that you can still create this process. Really, again, long-term goals and building relationships. Policy is funny in that they want something within 48 hours, but then it might take 10 years, 20 years to get something really meaningful pushed through. So having those long-term goals and keeping with it. And then just being a trusted resource and being able to create policy briefs, share contacts. Don't be afraid to engage other people in the process, because no one can do it alone. So if someone's interested in a certain topic, hey, a colleague of mine at Baylor studies this specifically, and making sure that we're connecting people. And then again, giving testimony. You can even give background and strategy. So maybe you are super shy and you don't want to have to testify. You can still meet with people and be able to give that research and evidence background, because again, people are really hungry for that. And then here, this is an article that we just recently published, Improving the Influence of Evidence in Policy Creation. And it kind of goes into more detail about what I talked about, of studying that research to policy collaboration. So thank you so much. Thank you to William T. Grant Foundation, and sorry, quickly to Max Crowley and Taylor Scott and Catherine Oliver. Max and Taylor were the co-founders of the Research to Policy Collaborative, and opened themselves up for critique, for evaluation, because they wanted their program to be better. And because of that, they're one of the only research to policy groups who has actually been empirically studied. So we're really grateful that they love science so much that they believe in seeing the good, the bad, and the ugly. And then Catherine for ethnographic support. Thanks.
Do we have time for questions? Okay, great. I'm going to start it off while I read these, but Dr. Guillot-Wright, so one of the key things that I've taken away from this conference thus far is that in order to be successful, you really have to understand the viewpoint of your stakeholders. So you mentioned kind of knowing where the staffers and policymakers are coming from. Dr. Temple kept emphasizing it's fiscally responsible to engage in these prevention programs, but what is it, as someone who has met with staffers before, what is it that sells them the most?
That's a great question. So I think being authentic sells people, really. So you don't have to change your view. So when we say, kind of walk in nonpartisan, that doesn't mean that you have to put yourself outside. Just really being willing to engage long-term in the process. So, if a different staffer ends up having to come in, sending an email and saying, thank you so much, I know things happen, would love to catch up by phone. So I think really having that sense of understanding, and then really importantly, is many times whenever even researchers are meeting with staffers, oftentimes it's part of maybe a professional group, and there's some lobbying involved in it. And what I'm presenting is actually the opposite of that. And so when we talk about advocacy, it's not lobbying, and so it's actually something you could do, on the dime of the university if you're presenting evidence to policymakers and presenting that research in a pretty neutral way and saying, look, I've done this study and this is what the evidence says, and really listening to staffers and saying, what is it that you need? So I know you're interested in, stopping, in reducing human trafficking, right? And maybe it's someone that you disagree with on other areas, but that's something that you can agree on. And so what is it that you need so that I can help you move that forward? And so building that relationship and listening instead of always asking, I think is important.
Great. It sounds like my question was actually in the same vein as several of these questions. I may paraphrase one of them. which is maybe for both of you, what evidence might be compelling to policymakers that mental health is not responsible for gun violence? And how can we convince them?
Yeah, this is a frustrating problem for me on several levels, and so I'm going to use this as an opportunity for therapy. On one hand, there's these folks that use mental health as the boogeyman, and we need to put all these resources into mental health and mental illness and make everything better. Great, do that. But on the other hand, now, to be quite frank, in Texas and some other states, socio-emotional learning is now a bad word, and we can't teach our history in CRT. And so it's just really frustrating that you say on one hand we need these programs, it's mental health, but on the other hand we're going to take everything away from you to be able to deliver this. So instead of answering your question, I just went on a personal vendetta against people, and I apologize. So. I don't know. maybe 6 years ago I would have said to show him evidence. And I'm hoping that Dr. Guido-Wright can save me here, because maybe I've lost a lot of hope.
I'm going to hopefully give you some hope.
All right.
Something that I found kind of shocking, and it was a good reminder for me when I was interviewing a staffer, is that he said what you hear on the news is like 1% of what's actually going on. And a lot of the staffers are working together, and they're working really hard together across the aisle. So the people who are, the elected officials, I'm not taking away from the work they do, and I'm also not taking away from the harmful narratives that they are perpetuating. But at the same time, there is a lot of work that's happening that none of us can see. There's a lot of bills and legislation and policy that we don't even know about because we're not in the day-to-day. And so I would say to try to fight against that 1% that we are seeing that is really detrimental and has created some very real problems for us as a nation, but also to not lose hope in the other 99%, and that there are people who are trying to work together.
Yeah, I would say, to add to that, I think Chris Murphy, who's out of Connecticut, has done a really good job of walking the fine line between the need for mental health resources and gun control. And I think he's done a great job of saying, we're in a unique position now where we can get billions of dollars to help this mental health care. So despite my frustration, I shouldn't just completely be dejected, because that is awesome, and we are in a really cool place right now where our country might actually see resources for mental health that we've never seen before.
There are a few questions here about kind of how those who are in leadership can support their teams. So, for example, what about interventions to help maintain healthy relationships for our colleagues or our faculty at home? Does longer maternity leave help? Do other wellness type programs help?
I'll jump in there and say one thing that I think that gets at with some of the maternity leave and paternity leave is that this is going to involve structural changes that if we want to reduce, so let's go back to gun violence, if we want to reduce gun violence, we have to increase livable wages, affordable housing, child care, all that sort of stuff. If we do a good job of addressing that, we will reduce gun violence and all forms of violence. Back to the first part of your question, yes. Healthy relationship skills are so essential for everyone, not just kids, right? No one in this room were ever taught how to be in a relationship. Not one person.
I learned it from Saved by the Bell, so you take that back.
I've been compared to Zach, so it's fine. But right, so, and to that point, how do we learn to be in a relationship? We learn everything. We learn math, English, writing, all that stuff, how to dribble a basketball. But how do we learn to be in a relationship? By media, which is, with the exception of Saved by the Bell, is terrible. Or we learn from our friends who are equally as bad at it. Or we learn from our parents, which some of them are good, but some of them are terrible. Or even well-intentioned ones, I argue in front of you and then make up elsewhere, and you don't get to see how to resolve conflicts. Or they do it by trial and error. So, you know, I reiterate that as much as I can. We need relationship skills, all of us.
All right, and then I guess since we only have 2 minutes, I'll end with how can we support enhancements to our teams to help translate our research to policy?
How can we, I'm sorry, read that again.
How can we support enhancements to our teams to help translate research to policy? And I'll add in there, since I'm a division chief, how can we support academics to engage in advocacy?
So something that's really practical is, and this is something that whenever I was working under, so before I became vice chair of research for family medicine, I worked under Jeff as an assistant professor. And when I was creating my, plan for, appointment and tenure and promotion, one thing that he said was, when you talk about education, don't just talk about the courses that you're teaching to students, but think about education very broadly. Think about education, you're educating staffers, are you educating other researchers, right? And so something really simple and practical like that, which is, really a mentorship opportunity to say, first, also that's, without saying it, that's saying I support these activities, right? Two, it's saying this is a way, until we can change the system where it's explicitly highlighted, this is a way to still show all the work that you're doing that sometimes doesn't get counted in the same ways. But then, I would also say, being an advocate at, at that system level, in the C-suite, as we say, and being able to really push, APT forward, that, these are issues that can, that need to be focused on, and that our research needs to move to policy, and it needs to move to practice, and that, tenure shouldn't just be, have you published an article, but have you published it, and how has it actually benefited people?
Sounds like you really had a great mentor. Why did you leave? Why did you leave him? That was a
Which
bad
I would
decision.
also add, the research to policy and practice, I think, is an ethical issue as well. And, there might be medical ethics, people, ethicists in here. And for me, that is an ethical issue, that our research, if it's not actually benefiting the people, then it's, then what was the point?
All right, and I'm sorry I didn't get to every question. We'll end one really, really quick one, which is how many times were you both on NPR?
It's a great question, actually. So if you listen to Ernie Manous, Town Square, I'm on there about once a week. And then I was just on the national NPR earlier today. I'm not sure you guys knew that.
I've been on the Houston one once. I haven't made it national status yet. But.
Thank y'all.
Thank you.
There were a couple other ones
Oh,
for
cool,
you.
thank you.
So
Awesome.
these are the ones that are for you. I think I sort of answered.
That's pretty funny.
I'm not sure who has an announcement about lunch, but.
It's great to stand and wave people eating lunch, huh? Thank you for moderating.
All right, so thank you so much, everyone. We'll go ahead and have a break for lunch. So if you guys could go ahead and pick up your lunch out in the waiting area. During the lunchtime, after everyone's kind of reassembled, we will display a great public service announcement video, and we'll do that a little bit later. But enjoy your lunch. Thank you so much.
In Harris County, approximately 150 children are injured or killed by guns every year, and that number is quickly rising in our city. 40% of homes in Texas contain firearms. As a community, our goal is to ensure that our children stay safe by doing one simple thing: safely storing our firearms.
The cases I dread the most are those in which children are injured or injure others with guns, especially from accidental shootings or suicides.
Our research has shown that in almost a third of these cases, tragedies like these could have been avoided by safely storing guns in homes. It's our responsibility as adults to safely store our firearms. Because one slip-up, one unplanned moment, can lead to unspeakable tragedy.
My 14-year-old daughter, Adrienne, was shot and killed by my best friend's 14-year-old son after he left a loaded gun on their kitchen table. Her death has affected so many people's lives forever. The boy who fired the gun had extensive gun safety training, but that training didn't prevent what happened because children can make mistakes. I am still a gun owner even after our tragedy, and I passionately believe that teaching gun safety to children, and most importantly, responsibly storing our firearms, is crucial to protect our children and any visiting children when they come into our homes. As Americans, owning a firearm is a right, but rights come with responsibilities.
There are many different options to safely store your firearms. Biometric safes allow for quick access to a firearm only by those authorized to use it. You also have the options of using a lockbox or a cable lock, which can be used on any type of firearm.
These cable locks are provided for free by law enforcement. You can request one at your local police department or at the Harris County District Attorney's Office at no cost, no questions asked. When a child is hit by a bullet, that single moment sends an aftershock into the community. The damage goes well beyond the statistics. The good news is, this isn't a random problem. It's something we can help prevent.
As gun owners, we must be aware that within our homes there could be a device that is the difference between life and death for a depressed teenager. In fact, the risk of suicide in teenagers can increase up to 10 times in homes with accessible guns. Other adults in the home with suicidal thoughts, PTSD, or dementia are also at great risk. As a pediatrician,
as a trauma surgeon,
as a police officer and a father,
as your district attorney and a mother,
as a gun owner and a parent.
Lock up your guns
and save a life.
Welcome back, everyone. I hope everyone had a nice lunch. Okay, so in the afternoon session is going to be focused on the work that we're doing here in Houston. The moderator for this session is Dr. Chad Wilson. He is the trauma medical director at Ben Taub, which is a very, very busy trauma center here in Houston. And joining him is his colleague. He will be introducing her. One of our speakers was unable to make it, Deborah Mendoza. She was going to talk about some of the violence intervention programs in Dallas that have been pretty successful, but unfortunately she was unable to join us. And then following that, we've lined up a very exciting panel of people that are doing violence intervention programs, community-based programs in the city of Houston and in Harris County, and to try to get us, the rest of us that don't know what's going on, to try to get us to understand all the great work that's going on in our city and our county, and how we can work together. So thank you.
All right. Step down. Okay. Well, good afternoon. It is a privilege to be here. I am the trauma medical director at Ben Taub. I just actually came out of the operating room about 45 minutes ago. And it's nice to see so many people who are interested in the public health problem that is something that I deal with on the microscopic level. This is just, this really is heartwarming for me personally. So let me go ahead and get started by introducing our first speaker. So our first speaker is Dr. Catherine Seeger. Dr. Seeger is a native Houstonian who is an assistant professor of surgery in the Division of Trauma, Acute Care Surgery at Baylor. She is the associate program director, meaning she helps me do all my work, of our trauma center at Ben Taub Hospital. And she's also currently in charge of the residency curriculum for the Department of Surgery. With no further ado, Dr. Seeger.
All right, good afternoon. Thank you so much for the opportunity to present here today. I particularly want to thank Baylor, UT Health, and the Baker Institute for inviting me to speak here. By way of introduction, I'm Catherine Seeger. As Dr. Wilson said, I'm a trauma surgeon who works at Ben Taub, an assistant professor at Baylor College of Medicine, which is one of the 2 level 1 trauma centers, meaning the highest acuity, or the trauma center is able to serve the highest acuity of patients that serve our city. I don't know how this works. Okay. I have no disclosures. I have a keyboard. It's fine. I want to start by saying I'm from Houston. Dr. Wilson stole my thunder a little bit there. I was born here at St. Luke's Hospital. I graduated from St. Agnes, came back for medical school, which I did at UT Health. Now it was UT Houston at the time. Did my residency training at Baylor. I subsequently took a brief hiatus in Tennessee for my fellowship training in my first couple of years of practice. But it was always really important to me to come back and serve this community. Because of that, addressing firearm and interpersonal violence in our city has always been extremely personal to me. So just stepping back a little, you guys have heard a lot today about the scope of gun violence, particularly in our city. But looking on a little bit more of a national level, let's just, see kind of what's been going on the past several years with gun violence in the country. What we're looking at here is basically age-adjusted death rates for firearm violence across the United States by state. To briefly orient you to the schematic, the lighter blues on the map represent lower rates of firearm-related deaths. And as the blues get darker, they represent progressively higher rates of deaths from firearm injury. And this is just a map of those rates by state nationwide in 2020. This is 2021. So pretty much across the board, but most dramatically in the central and southern U.S., those rates increased, and not insignificantly in most cases. So clearly, the reason we're all here gun violence is a public health issue, is just getting worse. Now I want to take a little bit closer look at some of our local numbers. This is Bentop specifically, so this is what we saw at our hospital over the past 3 years. You can ignore the gray columns. Those are just the total trauma activations per year, so all comers, be them car wrecks, falls, things like that. But the blue columns represent the total number of those patients who presented after a penetrating traumatic injury, so meaning either a firearm injury or a stabbing usually. So as you can see, every year we saw an increase in the number of those injuries. Importantly, this does not account for any patient that was seen at any other hospital in the city of Houston. It doesn't account for any patient who chose not to go to the hospital after their firearm injury. And obviously, nor does it account for victims of firearm violence that never made it to a hospital in the first place because they died on the scene. A little more about Bentop specifically. What I'm here to do today is talk to you a little bit about what it's like to be a trauma surgeon at a level 1 trauma center serving the 4th largest city in the country. To start, the trauma centers in Houston are busy. The American College of Surgeons, which is the governing body that's responsible for verifying trauma centers, recommends usually that you have one level 1 trauma center for about every 1 million residents. Houston has only 2 for the region. So at Bentop specifically, we see about 4,500 trauma activations a year. We've seen generally sustained yearly increases in those patients. And again, as I briefly alluded to before, that's all comers. That's not just firearm violence, but it is a busy trauma center. The rate of penetrating trauma nationwide out of all traumas is about 12 to 18%. So of all patients that are traumatically injured, that percentage tend to be shootings, stabbings, and things of that nature. At our hospital, the percentage of patients that we see that have penetrating injuries is about 25%, which is pretty high. And certainly, a higher percentage, as I said before, than represents the actual population that tends to be injured by that mechanism. Just sort of by way of comparison, at most trauma centers, that rate is about 10% by what they see. So what does that look like on a day-to-day basis? A typical call day starts like this. At around 6:30, we gather for our morning sign-out. Here, we all come together. We discuss the previous day's admissions. We make sure any important clinical information is conveyed to the new team of people taking care of the patients, and discuss plans and operations for the upcoming day. In a perfect world, this is an uninterrupted 30-ish minutes, sometimes longer, depending on how busy the day before was. But in reality, it's really not unusual for the business of the day to be interrupting this conference. And it's interrupted by things like this. So yes, we still use pagers, but the beauty of living in 2022 is that all of the traumas also get sent to our phones. So I can share with you a few of the recent calls myself and some of my colleagues have responded to. This is just a small collection of what we've seen come into the hospital over a few days in the last couple of months. I've redacted the dates just to protect patient privacy, but this is not edited. So what I didn't do was get rid of car wrecks coming in between the gunshot wounds and in between the other things, or any other blunt traumas that may have come in to interrupt sort of the firearm violence. I'm not going to say I didn't use our busier days. I did cherry pick a little, but I wanted to make sure to demonstrate to you guys what we're seeing at our hospitals on a regular basis. So now I want to just take you through a couple of patients that I've taken care of during a recent call. So this is a gentleman who came in, paged out as a middle-aged male who had had a gunshot wound to his chest, reportedly had normal vital signs on his way to the hospital, but was unresponsive. As a trauma surgeon, I can tell you immediately that's a little suspicious sounding. But upon arrival to our hospital, it was noted that he did not have any pulses. So this is probably the most dramatic scenario that we as trauma surgeons get. When we see a patient like this in the emergency room who's been shot and has basically died immediately prior to arrival or immediately when they arrive to us, they get the full court press. Surgery starts immediately. That means in the emergency room, down where we see the patient. Because in a patient like this, that's the only way to try to save them. I'll try not to get too much into the technical aspects of this, but a combination of things kill these patients, particularly ones that have been shot in the chest. One, they're bleeding to death. Two, blood that escapes from their heart can press down on their heart and prevent it from filling. And three, any remaining blood that they do have is really just not enough to fill up the heart and be pumped out of it to the rest of the body. So obviously, this patient met that criteria. We open his chest in the emergency room to get access to his heart and to the big blood vessels leading out of it. We were lucky in this instance, and with blood transfusions, release of the blood pressing down in his heart, and clamping of his aorta, his heart started beating again. At this point, all we've done is get to a place where we can start the surgery he actually needs. What we ultimately found in the patient was 2 holes in the upper chamber of his heart, which fortunately we were able to fix. This particular patient ultimately did pretty well, given what had happened to him. He woke up, which is never really a given in this scenario, although his road to recovery will be really long, but he'll likely be discharged from the hospital. Shortly after this, we were alerted to the impending arrival of our next victim of gun violence for the evening. And this is the information we get in this scenario. We have a 20-ish-year-old male who has multiple gunshot wounds to the abdomen, who's combative and who has low blood pressure. Once again, our team mobilizes. We meet the patients downstairs in the trauma bay, which is where all of the most seriously injured patients are dropped off. On our assessment, he's panicked. He's fighting the people trying to take care of him, which is never a good sign. He has multiple gunshot wounds to his abdomen and severe abdominal pain, and his blood pressure is low. So he's sick. A patient like this needs surgery right away, but at least this time we have the opportunity to move him to an actual operating room to start his operation. So we go to the OR immediately to explore his abdomen. He had multiple injuries to several different segments of his intestines, which, in terms of injuries, are easy enough to fix. But of greater concern, he had multiple injuries to the large veins that drained blood from his legs back to his heart and lower body. We were able to fix the holes in the injured vessels and temporarily address the injuries to his intestines. But just because we were able to stop his bleeding didn't mean he immediately got better. Part of being a trauma surgeon is not only moving quickly, but knowing when to bail out. So when a patient's core temperature drops below a certain level or they remain too unstable to stay in the operating room, we have to make the decision to come to a safe, albeit temporary, stopping point, cut our losses, and bring the patient to the ICU to try to fix the other problems with their abdomen still open before surgery is actually finished. It was very clear that this guy was in this group. He was too sick to stay in the operating room for a complete surgery. So we got him moved to the ICU with the hopes that he would live to fight another day. Again, this was a good day for this guy. We were able to stabilize him enough to take him back to the operating room several times over the next few days, get his surgery finished, and his abdomen closed. He has subsequently been discharged and is doing well at home. Our last patient is a middle-aged male who was paged out as being awake, had suffered a shotgun wound to his abdomen, but had low blood pressure. This would be our last patient of the night. When he arrived, he was awake, he was talking, but his blood pressure was very low. He had a very large wound on his abdominal wall with wadding in it, which would suggest that the gun was just very close when it was fired. And he, like the last patient, needed surgery immediately. So he got blood started and was transported again immediately to the operating room. As you guys can see in this picture above, there are pellets everywhere. He had numerous holes in his stomach and his intestines. What he also had were really innumerable holes in the blood vessels that fed his intestines. In addition to this, it was clear that some parts of his bowel were already not getting enough blood to survive and needed to be removed. So we quickly resected these portions, meaning we took them out, tied off and packed the bleeding vessels to the best of our ability. And this particular patient was so sick at the time of surgery that we were not even able to address all of the holes in his stomach. So he, like the last patient, was closed temporarily and taken to the ICU. In the ICU, he remained very unstable, although he initially improved somewhat. A few hours later, he suddenly declined again, so was taken emergently back to the operating room in an attempt to continue his operation and make sure that he didn't have any, additional injuries that needed to be addressed in the short term to get him through this illness. The holes in his stomach were closed at this time, some additional bowel was removed, and he was once again returned to the ICU to hopefully allow his physiology to recover. As before, he improved briefly, but again, after another several hours, he had yet another precipitous decline. At that point, he was once again taken back to the operating room. At this operation, all of his remaining bowel was dead. For this patient, this is the end of the road, because there are certain injuries that we just cannot do anything about. And this is one of them. When all of someone's bowel is dead, all we can do is allow them to die comfortably and be with their family to the extent that we can. So at this point, he was brought back to the ICU for the last time. We discussed what we found with his family, and once they had had the opportunity to gather at his bedside to be with him, his care was transitioned and comfort measured. He remained awake until his death with his family at his side. So sadly, days like the one I described are often the rule and not the exception. And I think we can all agree that that's becoming more and more common the last few years. So, a couple of things here. How can we as a healthcare community contribute to decreasing gun violence in our country? That is, what role could we play as physicians and hospitals in helping decrease these rates? And really, the big thing I want to talk about with that is hospital violence intervention programs. So I told you a lot about the clinical course of these patients. What I didn't tell you about was the circumstances under which they had their gunshot injuries, the social circumstances from which they came, and what we did as a hospital to try and get the ones that were able to get out of the hospital into a different environment than the one that they came from in order to potentially prevent this from happening again. And that's because right now we don't have an infrastructure at our hospital, I believe neither does Memorial Hermann, to really provide that service to patients. So according to the CDC, homicide was responsible for 19,362 deaths in 2016. In 2020, that number was 24,576. In Texas, there were a little over 2,200 deaths due to homicide in 2021. Although the social and economic costs of homicide are really significant, non-fatal injuries, violent injuries, actually outnumber fatal injuries by more than 100 to 1. So many victims of violence are at increased risk for re-injury. This is something we know. In urban settings, it's estimated that up to 41% of patients treated for violent injury are re-injured within 5 years. One survey of victims of violence at 5-year follow-up found that 20% of the patients treated for violent injury had subsequently died, usually of a violent mechanism. Most hospitals send patients out, like I discussed before, into the exact same environment that they presented in. So there really is nothing that we're doing to address the likelihood of recidivism in these patients, which is really, really high. So it seems to follow that one place we can enact positive change is during these patients' interactions with the healthcare setting. So this is widely considered a teachable moment. I don't love that terminology. I think it sounds a little paternalistic, but it's, you know, it's kind of just the widely used terminology for that. But studies have certainly helped show that this is the case. It's a point in time where people are receptive to interventions that promote positive behavior change. And again, you know, reaching them during these so-called teachable moments is really key to a successful hospital-based intervention. So basically, instead of waiting for the patient to seek care, therapy, for any of the things that contributed them to be, that contributed to them being a victim of violent crime, we bring trauma-informed care to the patient at the point of contact. As an aside, I'm not sure if you guys will get any of this later, but trauma-informed care is basically the recognition that the trauma is not just the physical injuries that somebody shows up to your hospital with. That is, that people presenting after violent victimization are also victims of chronic traumas that are present in their daily lives, and that we really have to get a complete picture of what a patient's life looks like outside the hospital in order to treat them in the most, holistic way. We also need a significant sensitivity to that while we're addressing their acute issues to truly provide the meaningful healthcare that can change their course in the future. So there are a number of well-known examples of these programs around the country. I would say probably the most well-known is the Wraparound Project at UCSF that was started by Rochelle Dickers. If anybody here has any interest, I would really encourage you to look up that program because it's pretty comprehensive. But what exactly is a hospital violence intervention program, and what does it entail? So these are really what are considered to be the components of a successful hospital-based violence intervention program. And this is just a social ecological model of violence prevention that was adapted from the CDC. So the ideal hospital violence intervention program provides intervention at multiple levels to prevent interpersonal violence from one, as we discussed a little in the previous slide, patient contact at the initial interaction, to continued social programs and support after discharge from the hospital, as well as contributions to community outreach and policy advocacy to address certain social determinants of health. So these should really have four major components. The first being intervention. So this is just a brief intervention in the emergency department or at the hospital bedside. Again, this is what happens when they're in the hospital. This is when you figure out who somebody is, where they came from, what contributed to their problem, and start to formulate a plan for what they're going to need after they leave the hospital. The second being care. So that's intensive, long-term, community-based case management services that continue in the months following the injury. So this is not something they just get when they're with you and then goes away once they leave the hospital. Also important, they subsequently have follow-up services, so crisis intervention services, linkage to other community-based services that are not just solely case management based, mentoring, home visits, any follow-up assistance they may need. And really importantly, this has to be provided by culturally competent frontline workers. A lot of our patients come from a population that has a lot of mistrust in the medical community, a lot of mistrust in government programs, and for very good, very valid reasons. So in an ideal world, this is really people from these individuals' communities that they can have an actual trusting relationship with. And then lastly, you need to address the social determinants of health. So conditions in the places where they live, learn, work, play, all affect a wide range of health risks and outcomes. And and violence is not an exception to this. So how do we create hospital violence intervention programs? A group from the American College of Surgeons Committee on Trauma, Injury Prevention, and Control was tasked with outlining a comprehensive approach. Again, this charge was led by Rochelle Dicker, who's done really a lot of work in hospital violence intervention programs. But this is just sort of a summary of the concepts outlined in what they discussed and what their primer is. So right now, we're at step one. Dr. Naik, who you guys all heard from earlier today, in conjunction with the Baker Institute, is the primary investigator for a CDC-funded study that is really going to build what's probably going to be one of the largest and most comprehensive and most granular databases that defines victims and circumstances of firearm violence that will exist in the country, and it'll be about patients in Houston. Hopefully this conference represents part two starting to come into play as well. So we're all here together today to talk about what we can do moving forward to address this problem. So moving forward, projects like these, again, is going to help move toward the goal of helping victims of gun violence in our community on a more global scale. So that's all I have. I want to thank you guys again for the opportunity to present. And if you have any questions, I'm happy to answer them.
All right, well, if you guys can save your questions, I think we're going to have the Q&A after the rest of our presenters for this session finish. Dr. Seeger, thank you for that sobering depiction of what your life is like as a trauma surgeon. That was powerful. If I just may take the privilege of the podium to just brag on Dr. Seeger. I mean, as you probably were able to realize, she's an incredibly gifted technical surgeon. But the thing that's special that you don't always find in surgeons is the care, which is something she has in spades. So this is who I want to be on call if I get hurt. I mean, I love all my partners, but moving on, and correct me if we were going to do this a different way, but I think I'm going to just. We want me to introduce them one at a time? And okay, perfect. All right, so we're going to move on into the review of some Houston community violence prevention programs. And we're going to start, I believe, with Lupe Washington. Yes, come on up. Lupe Washington is the Division Director of Harris County's Community Health and Violence Prevention Services, which provides strategic direction, oversight, and implementation of efforts to address the root causes of pressing public safety challenges through a public health approach. And we got your slides?
I think so. Awesome.
Great.
I'm a little short. Good afternoon. It's really a pleasure to be here this afternoon. Like you said, I am with the Harris County Public Health Department, and I'm really excited to talk about what we've been doing in the last 6 months since I have assumed this role. I started in mid-December. I was charged with starting a couple of programs by March. And so when my boss gave me that charge, we're like, of course, yeah, we're gonna make it happen. And so we have. I'm really proud to talk about our first program, the Holistic Assistance Response Team, which is we call our HEART program. This program is in the Cypress Station area. It's in the northern part of Harris County, and this is where we are contracting with a provider, and we have teams of 2, a certified EMT and a crisis intervention specialist who go out and respond to nonviolent calls. We are working in conjunction with the Harris County Sheriff's Office. They've been wonderful partners in this, and they're the ones who run our 911 response program for the county. And our partners have responded to 275 calls since we launched on March 21st. And these are all nonviolent calls. So these are calls that our sheriff's officers have not had to respond to. And the idea is that our law enforcement partners can go out and respond to the more pressing violent matters in the county. And again, it is a pilot program. All the programs I'm talking about today are pilot programs, so we're just getting started. And so again, our HEART program, they have their own unique vehicles. They don't look like law enforcement vehicles. They have their own uniforms. They're wrapped, and they're actually purple, real pretty. Some SUVs and a van. And our community partner actually went out and they have rented a space near the Ponderosa Fire Department so that can be closer to the area, so when they report, they're ready to start receiving calls right away. We are going to expand. We've responded to 275 calls, and that's just for the most part, having one team of 2 out there from 9 to 5. So when we increase the number of teams, we're hoping to respond to more calls. We also have our community-based violence interruption program. This is where we are hiring outreach specialists in other jurisdictions. They're known as violence interrupters or credible messengers. Like was said earlier, you really have to have people from the community who have lived experience. Those are the people who our residents are going to be able to connect with best. And I'm happy to say that our 2 newest outreach specialists just last week were able to mediate a conflict and prevented a gun violent incident from happening already in just their first week out in the field after their week of training. We are contracting with Dr. Chico Tillman out of the University of Chicago for his expertise and training of our staff, considering there is an element of danger to doing this type of work. This program is being piloted in 4 zip codes. 3 of them are inside the city of Houston, and 1 of them is in the county. And it includes as Sunnyside, South Park, Greater OST, South Union neighborhoods, as well as the Cypress Station area. And so that's where our staff are. Again, I've been very happy that in 6 months I've been able to hire more than half of my team to do this work. And so as our outreach specialists are trained, they're out there, they have a passion. A lot of them are justice impacted themselves. So yes, some of them do have criminal histories. However, there are some incidents where we're not going to be able to hire them if they have something against children, if they have a crime, anything against children, the elderly, or the physically disabled, we're not going to be able to hire them. And also, we're not going to hire anyone who is a registered sex offender. Going to our hospital-based violence interruption program, we are partnering with BENTAB. We are having weekly meetings with the Health Alliance for Violence Intervention. That's who we're contracting with, Javi, to develop this program at BENTAB because it is our level 1 trauma hospital. And we are going to have outreach specialists in the hospital responding to individuals who have been the victim of violence, gun violence, going to BENTAB. Again, the same 4 zip codes that we are servicing for our community-based program, those are the same 4 zip codes we're going to work with for the hospital-based violence interruption program. So we're really hoping that we're going to get that up and going here very quickly, although we are also being approached by HCA Northwest in Cypress Station to start this similar type of program. And because they're not needing any kind of funding, they're just eager to get started. I think we're going to be able to work out that interlocal agreement a little faster. So we're excited about being able to start that. Another program that has been assigned to our division is the CEPTED program. This is crime prevention through environmental design. We have 5 areas across Harris County that have been identified. It was put in our division because 2 of those areas are already areas that we're in. There is a lot of community engagement that has to take place, and again, we've already started that with the other programs that we have. We are going in, asking the community, do you feel safe? What do you like about your neighborhood? What would you like to change? The idea is that we can have more sidewalks, better lighting, perhaps cameras if needed. Whatever is going to make our community members feel safe is what we're going to go out and try and do. The CEPTED program is being funded through ARPA funding, so those are federal dollars. The other programs are being funded completely with our general funding from Harris County. So our Commissioner's Court approved through general funds to fund the majority of the division. And then the last program that we're pretty excited about is a pilot program that we're going to have with our DA's office. They're going to divert, we told them we could just take 100, even though they said they had about 5,000 that they could divert. We're like, okay, we're just going to start with 100. And we are going to work with these low-level offenders to, again, connect them with services. At our department, our executive director is really big on us not using the word referrals. We don't like to give residents a phone number. Hey, good luck, call them, let me know if you get connected. We are actually charged with connecting people to services. We want to make sure that our residents are not getting the runaround. Let's face it, for some of us who are educated, it's difficult to navigate certain services and resources. So we understand the challenge that it is for our residents who need our services, so we're going to help them make those connections. And so these are just the programs that we have in our division. And let's see if I can work this. So some of our ongoing projects that we're really excited about, our mobile units for the health department have been out since the beginning of May at the apartment properties in Cypress Station that have had the highest rates of gun violence. And so we've been out there twice a week providing immunizations, vaccinations, and on Thursdays, HIV services as well to the residents. It's amazing what the need is in the area. We want to meet people where they are. And so we've been really fortunate to be able to go out there to those 2 properties. I just got a message from my staff about an hour ago. Just today, we were able to make contact with 75 residents and give them services that they needed. So we're really excited about that. Again, these are the properties that have had the highest rates of gun violence. In Commissioner's Court, earlier in May, passed a resolution making June Gun Violence Awareness Month. And so we are going to culminate the month with a larger mobile health fair out in the Cypress Station area at Lentz Park on Thursday, June the 30th. So we have a number of our mobile units out there that are going to come out. We're hoping that Precinct 1 is going to be able to provide some transportation from the apartment properties for the residents to the park. This is one of those areas that's on our CEPTED program because there's no sidewalk from those apartments to that park. So we're hoping that that's one of the things that we're going to be able to fix through the crime prevention, through environmental design. We are working in partnership with Precinct 1. They've been very instrumental in helping us launch our programs and being present in at our community engagement meetings. There's a lot of community engagement that began in early January and is ongoing. And we have also partnered with the Sheriff's Office and their community problem-oriented policing team. Again, we are having a gun violence awareness health fair, but we've also are going to begin, it just got approved last week at Commissioner's Court, a countywide violence prevention campaign that's going to come out of our office. So you'll be seeing some billboards coming out of our office as well. And then last but not least, we're having our own violence prevention conference, a 2-day conference in August at NRG. We've already do have some of our headliners. We will have Charles Blow, Ben Jealous, Liz Ryan, who's the director of OJJDP, and we're going to have the awesome Dr. Chico Tillman, who's going to close us out. And in between, we're going to have a lot of other phenomenal speakers. And if you'd like the link on how to register as a professional, just get in touch with me, and I'm happy to send you that link. And I think that's all I have today. Thank you.
Okay, our next speaker is, I believe, going to be Carlton Harris, who is the Executive Director of the Forgotten Third Incorporated, which I believe is a juvenile justice intervention credible messenger program and with a focus on gun violence, gang violence, and dating violence.
Good afternoon, everyone. A little bit about myself, Carlton Harris. Recently was working for the City of Houston, the Houston Health Department. I oversaw the Houston Peace Youth Violence Prevention Initiative, where I helped author our strategic plan, which is focusing on preventing youth violence, promoting youth health, and providing youth opportunities. And under the Prevent Youth Violence, there are 8 objectives: promoting youth health, 4 objectives, and providing youth opportunities, 4 objectives. The main goal for Houston Peace, under the leadership of Mayor Sylvester Turner and also Director Stephen Williams, is to provide a comprehensive healthcare approach so that our youth ages between 10 and 24 can have a level, equitable playing field so that they can be successful, not only in their entrepreneurship or educational goals, but also in everyday living. So I just wanted to mention that regarding Houston Peace. You can still visit that website, which is Houston, the number 4, the word peace.org. I will still be connected to the coalition because the work that I do perfectly aligns with the goals and the missions of the coalition. I know that they'll probably be announcing someone who will be filling my role rather soon. I'm not too sure. But I do want to make mention of Houston Peace and the work that the Houston Health Department is doing for violence prevention, because it is great work, and it is focusing on making sure that our youth are preventing violence, promoting health, and providing opportunities. My new role that I started about a week ago is the executive director of the Forgotten Third. I want to provide a little information regarding the Forgotten Third. Every year we hear that 2 out of 3 individuals recidivate within their first 3 years of being released from prison. They're either violating their probation or parole, or they're catching new offenses. 2 out of 3, 66 2/3%. What we don't hear about is the 1 out of 3 that get out, that stay out, that become successful. Thus, they are the forgotten third. They are credible messengers. These are the ones who have gone through the system, successfully reintegrated back into the community, and have overcome the various barriers that prevent them from becoming successful. They are the forgotten third. I am a forgotten third. At the age of 7, I shot my first gun. This is why firearm and gun violence prevention is very important to me. A little bit about my background: born and raised on the south side of Chicago, former drug dealer, gang member, sentenced to prison at the age of 18 for 4 years, selling controlled substance, carrying a firearm. No desire to change, released from prison after serving 1 year, right back to selling drugs, carrying guns, illegal activity. At the age of 19, I was sentenced to 18 years in prison. It was the second time that I was in prison. Light bulb came on, talking to other individuals about making positive change. Went to Illinois Valley Community College, received my associate's degree while I was in there, dropped my gang affiliation, shifted the paradigm of my thinking, and ultimately my 18-year prison sentence was reduced in half to 9 years, and I've now been out of prison over 22 years. And so the difference of me staying out of prison the first time of 1 year and 22 times is a formula that I learned. So repeat this after me. Say information. Come on, a little more energy. Say information plus application equals transformation. So let me show you really quick how this formula works, and I'm going to tell you how the program works. Think of a number. Don't tell your neighbor what the number is. Make it a small number. Don't make it too big. We're going to do a little math. I want you to take that number. I want you to multiply it by 2. Multiply it by 2. It's our first time talking. Give them a number to add. Not too big, and make it an even number. Make it easy for them. 4. 4. He said add 4. Think of a number, multiply by 2, add 4. Now what I want you to do is take that number and divide it in half. Think of a number, multiply by 2, add 4. Now you're going to divide it by 2 or cut it in half. Very last step. Take the number that you originally thought of from what you have right now. Everyone in this room have 2. If you don't have 2, stand up. So the way the formula works is like this. I found out what transformational change meant and how to operate it and how to work the formula, and that changed the outcome of my life. And so thus I've been out now over 22 years. The formula works if you work it. It doesn't matter where you start, the outcome will be the same. Everyone in here started with a different number when you started out with, but when you work the formula, everyone came up with the outcome of 2. I'm now overseeing a program in partnership with the Harris County Juvenile Probation Department. I'm running a program at Harris County Leadership Academy, and this is a credible messenger facility-based program where they're in the program either 6 months or 3 months, depending upon which program they're in Leadership Academy. Through this programming, they will get holistic cognitive behavior therapy treatment, me talking to them using the iceberg model, talking about the 25 sessions of the majority of the things that our youth are dealing with are beneath the surface, their thoughts, their feelings, their emotions. Providing them with mentors while they're in there, connecting them to mentors prior to them getting out, and connecting them to community-based organizations that can provide the successful wraparound services for them upon release. So connecting them with a mentor while they're in there and connecting them with a mentor prior before they get out and to an organization that can help them with job readiness, mental health. Someone talked about trauma-informed care earlier. These type of successful services that our youth need to become successful. And these are the youth that we're working with, chronically involved in the justice system. They're disconnected from positive supports. They are believed to be beyond the reach of traditional social service. They are resistant to change. They're gang involved. They're categorized as high risk, and they're involved in gun violence. All of those characteristics I can identify with. I was all of them. But I learned how to work the formula. And so through the Forgotten Third, we're working with our youth in the justice system, teaching them how to work the formula. The formula work if you work it. I have a young man here that I've been working with for over 6 years. I was only supposed to work with him for 6 months, but I've been working with him for over 6 years. He's not recidivated. He's not caught a new case. He's no longer gang involved. He's now working as a credible messenger. He's currently authoring a book 6 years later. So it'll work if we work it. If we want to stop gun violence on the front end, we have to do the primary prevention, and that may include us intervening while our youth are involved in the justice system, because reentry begins on day one of incarceration. We start while they're in there, and there's a continuum of services for them once they're released back into the community. That way we reduce gun violence, one life at a time, one family at a time, one community at a time. Thank you.
All right. Doing okay on time? Okay. Our next speaker is going to be Crystal Okorafor. She is the Deputy Inspector General for the City of Houston's newly created Office of Policing Reform and Accountability. Appointed by Mayor Turner, she is the first to hold this position, and it will be investigating complaints and working closely with the Independent Police Oversight Board to restore trust in the police among Houston's many diverse communities and to provide greater transparency for citizens.
Thank you. Wow, you were really great, Carlton. That was awesome. Thank you guys so much for having me. I really appreciate it. My name is Crystal Okorafor, and overseeing the Office of Policing Reform and Accountability, I also now oversee Mayor Turner's new violence prevention plan, which is the One Safe Houston. And as we've spoken at great length today from all of the speakers, there's not one way to stop violence. It's got to be a comprehensive approach that takes into so many different factors. It can't just be the police department. It can't just be, getting guns off the streets. It's got to be giving people the mental health services they need. It's got to be looking at domestic violence. It's got to be so many different ways to facilitate it. And so Mayor Turner's plan initially started out with, nope, that didn't change it. There. It started out with $44 million of ARPA federal funding, and it is now increased because of the success of the program since it was announced on February 2nd to over $53 million. And of that money, you can see that the majority of the funding is going towards crisis intervention, response, and recovery. It's taking approximately 70% of the funding of the $53 million. $10 million of the dollars are going towards the police enhancements and overtime for patrol, for additional officers to make up for the shortage of officers that we have in Houston. We're additionally hiring more people in the Parks Department for park rangers. There is a gun buyback program that's going to be happening later this summer with Commissioner Ellison and Mayor Turner. The Houston Forensic Science Center is getting $3 million to help with the backlog of the criminal justice system. They are getting money for overtime to get the cases so that they can do the research and do the testing that's needed so that when those cases go before a jury to go to trial, prosecutors aren't waiting on those to be, for the testing to be done. They're also getting additional equipment. There is also going to be $3 million going to the Houston Health Department, and you're going to hear more information about that from our next speaker, in relation to the community violence interruptions, credible messengers, and then also another $1 million for the reentry program, which helps individuals that have been through the criminal justice system, as Carlton was talking about. And then there's $9 million for domestic violence. And that is super key because we've talked about how domestic violence has gone up significantly since the pandemic, and we've seen it increase over the years, not even pre-COVID times. Since 2020, and from 2020 to 2021, there was a 50% increase in homicides among domestic violence. And so the mayor has given this almost $10 million so that we have 24/7 domestic violence response teams. They come out and they have caseworkers and people that have been trained to handle these cases. It is a specific group of officers that have additional training. They're also helping out with emergency shelters for these, not women, for individuals that have been victims of domestic violence. They, so far this year, have gone out to over 1,000 scenes, and they've assisted with 500 individuals getting emergency shelter. And part of that $9.6 million is to help with the shelter crisis that we have here in Houston. We only have approximately 200 beds for all the millions of people that are here in the city of Houston. And so now HPD is able to, out of the ARPA funding, give those individuals housing. So if you don't have somewhere to go, and we all know that those 72 hours after something like this happens and someone's arrested are the most dangerous times for those individuals. And so now we can get them out of the home, and if there's not a place to go at Hawks or some of the other shelters, we can put them in a hotel that's got that individualized training so that they know not to give out somebody's personal information and things like that. And it's critical that we have these resources. And COVID has brought a lot of horrible things, but this additional funding so that we can fund so many programs that are needed for our city, it's just really been impactful. Of those 1,000 plus scenes, there are over 600 children that were at those scenes. And that's a staggering number because we talked about what is happening to the trauma that the children are seeing. And so we're able to get them the information and get them resources that they need also. And then we've done forensic exams. Part of that funding is so that if there is a situation where they arrive at a scene and a forensic exam needs to be done, they're going to be able to, at a later date, do those exams at the scene versus having to bring someone to a hospital where they then are going to have to find childcare and all these other things. And so they're stopping what could be a hindrance so that we can get the resources that they need at the scene. And then also we have a ton of money going towards mental health initiatives. This is major because it might not solve things, but this is a critical part to making our city better and safer. And so I'm going to go into those key wins we've seen since the initiation of the program. So we have had 125 officers since February 2nd when the mayor announced it. Since then, they have done just those 125, not the entire police department. They have executed 700 felony arrests. They have recovered over 500 guns, and they've also recovered 312 automobiles. Last year alone, there were 36,000 guns stolen out of from individuals in our city, and that's just what's reported, right? So how many guns were really taken in Houston last year? It's probably not, it's a very high number. And so that is why we're having that gun buyback program, so that if you have a gun, and no one's saying get rid of your guns, but if you want to get rid of your gun, we have a place where you can go, and it's going to be an anonymous gun buyback program. So we're not asking for your ID. There'll be no information taken from anyone as far as what's going on, where the gun came from. We're just going to take the gun and we'll give you funds for that. Additionally, with the mental health crisis intervention, the almost $23 million, that's gone towards 3 different programs. First off, we have the CERT teams. The CERT teams are a grouping of teams with an officer and a mental health clinician, and they arrive on the scene to help out in situations where they need police, but they also need that mental health services. From the first quarter of the year, they have gone out to 600 calls, and of those 600 calls, I think it's important to note that they only made 1 arrest. 600 scenes, 1 arrest, because they are taking and trying to figure out what that person needs and de-escalating situations and not just putting people back into the prison system. And then we have, they've also helped with emergency mental health medical orders, and so they've gotten done over 120 of those in the first quarter. We also have the MCOT teams, and there's 20 CERT teams, and so they're working around the clock. and then there's 18 MCOT teams. And these are teams where they're going out to a scene and it's just a clinician or a mental health person. There's no police involvement whatsoever. So if someone is having a mental health episode or whatever and it's safe where we don't need to have police intervention, they are going out to those scenes. And of those, so far in the first quarter, they have diverted 766 calls away from the Houston Police Department and 347 away from the Houston Fire Department. So that's approximately almost 1,000 calls when the fire department and the police aren't even coming to those mental health scenes so that they can go to our high priority situations that are so critical at this time. Another thing that we've done is the Cadillac converter ordinance. We were all stunned to hear about the deputy that was killed when they came outside about their Cadillac, while their Cadillac converter was being stolen. This is not something new. It's something that is tragic that's happening around the country. And so what we've done is we've made it where you have to show proof of ownership in order to sell a Cadillac converter in the city of Houston. And so that is going to hopefully eliminate some of the thefts. And because our ordinance that we've drafted is so great, I mean, we're amazing. But the state is looking at trying to pass legislation that mimics what we've done here in the city of Houston, because we are breaking ground and making important changes that are needed. Another thing that we've passed here since February 2nd is the camera ordinance. The camera ordinance is requiring in nightclubs, sexual-oriented businesses, convenience stores, and game rooms to have outward-facing cameras that show their entrances and exits. We've all seen that technology plays an important role in the police department. They were able to find the shooter from the Galleria because of all the cameras that they have in that Galleria area. And so this camera ordinance is going to make it so that if there is a situation that takes place outside of a convenience store and HPD responds to that scene, the owner of that business has to provide that surveillance video to the police department within 72 hours of a request. They're also going to have to hold on to that information and to store it for 30 days from any time. So they'll have to hold that video so that the police department can get to it. Also, there was 15 additional park rangers that are going to be hired. Of those, so far, we've got 3 underway. And then we've got the community reentry program that Ms. Latasha is going to talk about soon. But they have a graduation this week, and they have expanded their program because of the success that it has seen with kind of really taking a person as a whole and giving them all the resources they need, not just like a business card and like call this number. They are really a wraparound service. And so, although homicide is increased with COVID, and we've seen it, we have seen a decrease since the beginning of the One Safe Houston program. So on the slide, you'll see that in 2020, we started out at 28 homicides for the city of Houston as of February 2nd. That number has increased from 37 in 2021 to 48 in 2022. And that's when Mayor Turner announced it. So it was a 30% increase from 2022 to 2021 in February of this year. As of June 1st of this year, since we've implemented these programs, we are at a negative 2% from last year. I am excited about the decrease in numbers. Unfortunately, 1 death is too many, and we're still above where we were in 2020, but we're at least trending in the right direction, and I think it's important to look at that. And not only are the homicides rate decreasing because of what the police department's doing and what we're doing as a whole within the One Safe Houston, we've also seen a decrease in all of the violent crime categories. The robberies were down 14%. Sexual assaults were down 33%, and aggravated assaults are down 9%. And so we're excited about the trend, and we hope that we continue to see it going down as we initiate more of these initiatives. For more information, please go to the website here at www.houstontx.gov/OneSafeHouston. We update it constantly with information about resources, funding, how things are being implemented. And this One Safe Houston is getting a lot of important publicity. In fact, the President Biden's President Biden's administration has been super excited about it, and Mayor Turner and Chief Fenner were there about a month ago, maybe 2 now, to talk about how this ARPA funding is being used to help with the funding, help decrease crime here in public safety. And so please visit the website for additional information as it comes out. Thank you.
All right, thank you so much. Our next speaker is Latasha Selexman. Great, all right, who is the Director of the City of Houston Community Reentry Network Program and the MBK Redirect Program. Her role is to provide oversight and direction for both initiatives by promoting public health and safety for individuals and families who have been impacted by the criminal justice system.
Alrighty. All right, good afternoon, everybody. I am so excited about everything that everybody's doing to prevent and reduce gun violence here in the Houston area. Oh, wrong way. Okay, that's me. So just a minute here, I want to talk about the mission of the Houston Health Department and really what we do with the community. We really partner and work with individuals and the community to promote and protect the health and well-being of Houstonians. So what we're doing now is to do the same kind of work as it relates to gun violence. Let me make sure I did it, okay. Okay, so our mission is to prevent, disrupt, and stop the spread of violence by implementing the following evidence-informed programs. So some of them are evidence-informed. We've also heard that they are evidence-producing, and some of them are evidence-based programs. So there are three. We have CVI, we have credible messengers, and we also have the reentry program. So the first one I want to talk about is CVI, and that stands for the Community Violence Interruption Program. I get it kind of mixed up sometimes. Sometimes I say intervention, but interruption is correct. So that's the first initiative or strategy they were going to implement. With the Community Violence Interruption Program, it's the immediate response. So whenever there is a conflict, you have people who at some point are involved in violent activities. We want to get in there with the community. We're going to make sure that we engage community-based organizations who are going to hire individuals. You probably heard them call today credible messengers. You've heard them call violence interrupters, same kind of individuals. And they actually get in there in the mix. They know the people in the communities who are the perpetrators and who are the victims, and they're going to stop the violence from actually occurring. They are out there in the streets. They know what's going on. We're going to engage with those individuals. They're going to provide the supports. They're going to provide the engagement. They're going to prevent the violent activities from happening. So that's the first group that we're going to engage with. We see these people as the people who have their ear to the street. So once they stop the violence from happening, they are also key in stopping the retaliation from happening. We see violence on the continuum. Once we move them from the community violence interruption group, we're going to also engage the community with credible messengers. So those credible messengers will be the mentors, and primarily what we see is this gun violence or this violent activity happening with older, what I call young adults, because they're still younger than me, right? So they're around 24 to 27, 30 years old. Those are young men within that age group where we really see this happening. And the credible messengers that we have, they're also trusted individuals who are a part of these community-based organizations. The City of Houston is actually, we're running our programs parallel with Harris County. And the community-based organizations that we're going to be engaging with, they're going to hire these credible messengers and the violence interrupters that are already out there in the community who are doing this work currently. These credible messengers are trusted individuals who work in the community, who've been doing this work, who know already the people in the community who have engaged with the individuals who are at highest risk for violence, who are perpetrators, and who have also been victims of these crimes, right? So the credible messengers are trusted to go out there and really get the people the supports that they need, and not just the individuals. The one thing that we recognize is also that their families are in need of some kinds of support, be it basic needs, be it housing, be it workforce development. One of the things that we realize in working with individuals is that a lot of times they would not be engaged in these kinds of activities, but for the fact they don't have access to many of the resources, or they live in these under-resourced communities. They don't have the access to health care. They don't have the access to workforce that would be readily available in some of the other communities that they just don't live in, right? And so we want to provide these kinds of resources within the communities that they live in. The last program that we're implementing as a part of the public health response is going to be an expansion of our current community reentry network program. So right now, one of the things that Crystal mentioned was about our reentry program. We're having a graduation on Thursday. If you'd like to come, you feel free to contact me. But as a part of our reentry program, right now we service about 500, or provide supports for about 500 individuals annually. And a large part of it is due to our staffing. Of course, with staffing, you have a limited capacity, but with the expansion in reentry, we're going to be able to serve about a 50% increase on that number. So, like I said before, we see violence in the continuum. We see young people, and then primarily an older cohort of people between the age of about 24 to about 30 really perpetrating the violence in this area. And so, you know, the younger people are really watching that older cohort and what they're doing. They're becoming engaged. They're following along that continuum with these older people, from what I've seen in working with this redirect group, who's really, it's a diversionary program. But as they follow along with this older group that I'm working with, the reentry gentlemen who I engage with that are much older, many of them have spent time in prison 10, 20, 30, 40, 50 years, even longer than I've been alive, right? And they come out and they say, I see a young man who looks just like I did before I went in. And I don't want them to follow down the same path. And so what can I do to help this young man not follow down the same path, not become a victim or a perpetrator of gun violence? What can I do? This is why I said it's a continuum. And so as a part of what we do, we want to prevent these individuals from following down that same path. We get them involved with those community-based organizations that are currently doing the work, and we get in there, we figure out what are those things that they need as a part of the reentry program, where there are a few things that we've identified that they need. Number one, they need the basic needs kinds of supports, those Maslow's hierarchy of needs. If people don't have those basic needs supported, you're not going to be able to tell them about jobs. You're not going to be able to tell them anything else, because they're going to need food. That's the ultimate thing that they need initially, right? The next thing that they say that they need is a job, of course, right? If you have food, then of course you want a job then. So then we're going to help them with workforce development. I think I have that up there. So then after they have that, of course, housing. That's one of the basic needs that people have. People need stable housing. And then the other thing that they need is access to care. As a part of access to care, stable, basic mental health services is it. I know that there was some talk about it a little bit earlier about mental health and how it relates to gun violence. Well, I'll tell you this. One of the things that we find as a part of our program, about 30 to 35% of the people leaving the Texas Department of Criminal Justice have a diagnosed behavioral health condition, and that's diagnosed. Many people leaving incarceration have an undiagnosed behavioral health condition. It's nothing more than PTSD. And so we really want to be able to provide more people an opportunity to be assessed. As a part of our program, a large part of what we do is an assessment. And so we want to make sure that people are able to get access to care. As a part of the health department, of course, what we want to do is make sure that people have access to good health care. So I want to go back just a little bit and let you know that with this program, as what we're doing with One Safe Houston, is really looking at a public health approach to all of these strategies that we're going to implement through public health for individuals who are engaged in gun violence. So let me go forward just a little bit here. So how do we get to this point? So we got here and really decided, how will we implement this? So could we use the money that we've been allocated? Crystal talked about the funding that we've been allocated to do the work that we have here. Will it spread and cover the whole city of Houston? Well, probably not. So we have to start somewhere, right? So what we did, we looked at, Dr. Hafiz, I believe, talked about SVI, And we looked at actually SVI, and we looked at CCVI as well, and we also looked at the high rates of gun violence. And so as we looked at that, we looked at low COVID vaccination rates, we looked at high COVID people with high COVID rates, right? People who really, areas where they had people who were really infected with COVID high. And so what we found was that people in a certain age group that we were really priority areas, we looked at that, and we found was that we really should target the northeast quadrant of Houston to start this priority target area to start the program off. And so that's where we're going to start the program for the first 12 months of the project to show proof of how the program is going. And then what we're going to do is move forward from there. And I'll tell you that the reentry program, as she said, that part of it, it's already been started. It's already throughout the greater Houston area. But we'll continue to focus the new initiative, CVI, Incredible Messengers, on the northern side of Houston. And so we'll be able to really look at the results from there and really grow and build what we're implementing from there so that we can show results in how the strategies that we are implementing as a part of the One Safe Houston public health strategies are building on the work that we're doing. I have to say that we have really partnered across the country and looking at the cities that have already implemented this work in other areas. And it's been really interesting. In Austin, they've done some work. We've looked at Minneapolis. We've looked at Dallas. We've looked at a number of areas. We're fortunate to be able to really partner and work parallel with Harris County and the work that they're doing. And we're grateful to have been able to learn, to gather many lessons learned, really partner with national experts in this area to really get some guidance and some traction on the direction that we want to go and the work that we're going to do. And with all of this information that we've gained, we really believe that the work we're going to do in Incredible Messengers and also CVI will really help us reduce gun violence using a public health approach. All right, thank you.
Okay, our last presenter before we have our Q&A session is Victor Gonzalez, who is the Division Manager of the Mayor's Office of Gang Prevention and Intervention for the City of Houston. Since 1994, the Mayor's Anti-Gang Office, renamed the Mayor's Office of Gang Prevention and Intervention, has worked to provide comprehensive responses to youth violence, juvenile delinquency through direct services, collaboration, education, and policy development.
Good afternoon. Happy to be here. It's always nice to come back to Rice University every now and then. I'm not in academia. I'm from the streets. That's where I grew up. That's how I learned to do this work. I'm a product of some of the things that everybody's been talking about. I've been doing this about 37 years. I was calculating in the back because I'm listening to things and I'm like, man, you're getting old. I turned 56 this year. And when I've watched and listened to things that are going on in our city, I've been in the office now 23 and a half years. Worked a nonprofit. Got in touch with the mayor's anti-gang office when Adrian Garcia and Kim Ogg were there. And I knew Adrian from the streets. He was a cop. He was in the clubs that I used to monitor and deal with extracurricular activities. So I knew Adrian, and I knew a lot of what was going on. And by nature of my background, I just didn't trust police, and they didn't trust me. And I didn't like them, and they didn't like me in the 90s. We didn't get along. I'm dealing with kids that they're trying to arrest, and I'm trying to help those kids find another way to live. And it's not always easy when you're doing this work. This is lonely work. Sometimes it's only catered to a few people that can put up with the stress. You know, Doc, doing how you do and dealing the stuff that you deal with, you know, my hat's off to you being so young. I'm looking at you, I'm like, this young lady doing what she does, and it's passion. It's passion, it's compassion, it's love of what you do. I've been doing this so long. My wife says, when are you going to retire? And I said, I don't know. I have a consultant business on the side. I do a lot with the National Gang Center, OJJDP, BJA at DC. So I do a lot of work on the national level providing TA about gang outreach work. That's my niche. Violence interrupters, credible messengers. I've heard those names for a long time, and people have tried to come in to Houston and pitch it, and now it's here. And the biggest thing I can say to you new programs that are out there on the grind like we've been for all those years is that let's continue to work together in Houston. That's all I've tried to do since I've been there, is to bring people together that want to help this population, but also we need to have some accountability in place. I think sometimes when I was doing this work early on, the word from the police was, that's the hug-a-thug dude. You know, he hugging thugs, and he's not going to do nothing but protect them. He's not going to do anything to help us on this end. When they really didn't understand, I'm trying to create quiet and peace on the streets too. I just do it different. I have conversations with OGs. I have conversations with old guys that I can get to that you can't. And sometimes your approach with kids isn't always the best, and sometimes we have to change our approach, our tone. Not to say that we let them get away with stuff and turn a blind eye to stuff, especially when we're talking about safety. In our city, it's one of the biggest things I look at, not only for the kids we deal with, but my staff. I've got several staff that have been with me a long time. I'm transitioning now. My 12, 13-year guys are moving up or moving on, and so I'm in a transition. I've been talking to health about some programming that we're going to be doing. Housing just provided us some additional money to add some additional bodies. Lupe and I go way back to the gang supervision, enhanced gang supervision program that we started with probation back in 1999. We still have that program going on today. It's called something different, but we've had a lot of history here. And in Houston, I wanted to be able to give you a better idea, a little insight on the office. You know, we're here to help the families, the community, the schools, the kids, the people that live in the projects. I'm an apartment kid, apartment complex. I'm a food stamp kid. Government cheese, best cheese ever. I don't care what anybody says. Government cheese you can put on anything. Bread, tortilla, toast, drop it on a piece of Spam, it's good. That's the kid I am. Those are the types of kids we're reaching out to. Those are the types of kids that we're dealing with, the families that are struggling. But I had to learn over the years that being in our office, I was going to have to bridge gaps between agencies that probably didn't agree with my approach or didn't agree with my vision. And it was trying to sell a gang member that can be somebody different. It's like selling a TV to somebody that's doesn't have a backside on the remote and it's got tape all over the remote and we don't have no knob on it, but I want $200 for it. It works. And a person will be like, man, I just go to Walmart, buy me one for $3 and it's going to be nice. I'm going to have Wi-Fi and everything else on it. Talking about gang members is not always something that people want to hear. You hear gang member, you hear murderer, you hear thief, you hear robber, you hear somebody that's not very well liked in the community for the things that they do. It happens. It is what it is. It's crime. I'm not okay with it. I don't like the violence. The kids know it. The adults know it. Everybody that knows me know I'm not with that violence on the street, especially when it comes to guns. Because nowadays guns are not being carried like we carry IDs. We're beefing over social media beefs. We're beefing over disrespect. We're beefing over girls, over guys. I mean, we're beefing over stuff that I'm like, well, how did it get to this point? Where I have to look at the criminal justice agencies, our DA's office, all the stuff that I hear with bond reform, everything that's going on in our city right now. It's time to wake up and really talk about bridging gaps. Like I've had to bridge gaps with agencies who now trust us. I'm on the right side of the fence. I'm not trying to hide. I'm out here trying to do the best I can with a difficult population that takes time to work. It's not just going to change over a matter of months. It never does. Through our strategy, services, and collaborations, the goal is to reduce violence. I follow the comprehensive gang model. I'm a gang outreach specialist, gang intervention specialist by trade. That's what we call us. We've done violence intervention. We are that messenger in the street that people trust when we've established ourselves in certain areas of the city. I only work in certain parts of the city because I only have so many people to do gang intervention and prevention with individual members, multidisciplinary partnerships. Again, we've got to share some information, some client accountability. We've got to be able to talk with one another because what I've learned doing this work is we share a lot of people in this work and we overlap services. When I was listening to you talk, Doc, I was thinking of a kid, Luis Delgado, who came out. And the ugliest part of my job is to hear a mother crying when her son's dying in her arms. And it was a kid I took to Benton. We got him a job. He got hit by a car on his first day, right off the bus. They hit him off the city bus, Metro. I go pick him up at the car wash. A week later, he gets killed. And the mother is calling me at 2 in the morning. We're on the phone, and somebody kicked the door and popped him in the head. And you could hear him gurgling and blood, and she's describing, and I'm trying to coach her the best way I can, like I've done many times with kids who have injuries, with the homies calling, what do I do? And at the end of the day, it was the ugliest thing to have to hear that boy die on that phone. And that mother lost it. She lost it. And so then I go to Benton, and I got to see the boy. Wrapped up, tubed up, as we say with the kids. But it's a thing that you have to understand. The work is so difficult. I have several people. I have my horses. I call them my horses, my gang violence reduction team. They're my senior staff. They're the ones that are in the middle of the trenches with the most active gangs that we end up dealing with in our city. Like I mentioned, I'm only in certain sides of the city. I'm not everywhere. I'm where the gang crime is. If you want to reduce crime, you've got to go where it is. If you want to deal with the kids that are involved in the crime, you got to go where they are. You've got to tap into the gangs. You've got to know the signs. You've got to know what it is. You've got to know what that means. When you're working with them and they're conversating with you, what is it that they're saying to you that sometimes they can't say in language that we all understand? We are different people. So my horses, my gang violence reduction team, they're the ones that are the frontline workers dealing with that population. My early intervention, they're my rookies. They're my babies. They're coming up. They work with my middle school kids. And every now and then an elementary school kid like we had the other day, we called the school to come visit, and they said, please take him home. And this kid's like in the 3rd or 4th grade. I mean, he hell on wheels. The kid knows a little bit about gangs. He mimics gang signs. He don't know what he's doing, but he's already picked it up, and he's already displaying that stuff, and he's turning the school upside down. So my staff gets out there, my Southside Gang Violence Support Project, I only had one person on that. COVID has kind of killed it. We've done what we can here to close out the grant that's going to finish out in October. But they're doing case management, incident response and mediation, gang violence reduction teams. We have 4 meetings in the city where I have people that are working with kids in those different areas of the city. And we are talking about, it's for lack of a better term, staffing. It's a staffing. We're trying to find the resources that they need, get them those resources. If there's challenges or barriers to the agencies that we're working with, we try to find ways to break those. Where are the loopholes? Where do we need to do to help this kid gain access, this family to gain access to services? I have a lot of folks that support us, that help us at the drop of a dime with drug treatment, vocational trade, job, tattoo removal, anything that these kids are going to need. I've been around long enough to be able to have some resources in place. But I'm going to tell you now, if you're just getting in it, you're going to do a lot of maintenance, because we had a lot of turnover here in Houston when it comes to different things that are going on with agencies. Public awareness, if you need training, I don't care if it's 2 or 3 people, you've got a group of professionals that want training on Houston gangs, how to deal with gangs, let us know, give us a call, we can help with that. We do a lot for schools. We go a lot to schools and talk to kids, some in small classrooms and some in big auditoriums, just depends on the school. Prevention, COVID has kind of hurt that for us, but it's starting to pick back up. After school programs, alternative activities, we started to do something about 2 years ago with the Dynamo MLS, and we picked Jane Long as a pilot in Southwest Houston, where the Cholos and MS are a big recruiting ground for those 2 gangs. And we started doing 5 weeks of soccer with the kids after school. Our busiest day was damn near 70 kids. And then after that, we had a low average, maybe 35, but now Jane Long has picked it up and kept it running. That spun off Sugar Grove. Sugar Grove wanted to get involved. We got Sugar Grove involved. We did that over there. Numbers stuck around 50. And we're going to be building that project with an after-school program that's very consistent. When you get into the non-civilian employees, we're looking at a social casework management model. We're looking at linking them, a lot of hand-holding in the beginning. I'm not going to give you that here, go find it, go get it. I don't work that way. I ain't like that. We're going to walk you through it. It's mandatory, my staff. You walk them through it, get them comfortable, introduce them, let them know who it is. If I need to go lay groundwork down before you get over there so you as a staff feel comfortable, let me know and I'll lay the groundwork so that people know what to expect when our clients come through. Because our clients are tatted up. I've had guys with tatted all over their face and their head, all over their body, and people are not always okay with that. They get scared. They get a little intimidated. And so we have to be able to work through those things when we're dealing with our different agencies. Home visits and school visits, even in the detention center if we need to, down at Congress or any one of the other youth village or leadership out in Katy. We'll get out there and meet with them. Got to have the families. Families got to buy in. You got to get with the families, and they don't trust. It takes a lot of work to get them to understand what you're about. We are city government, so sometimes, we're the police, y'all undercover. You can call that all you want. Then I start talking that gang stuff, and they go, okay, you're not the police. You're not the police by any means. You know what's up. You start talking about the gang dynamics on the streets, hearing what's happening, just enough to get them to understand, we understand your situation, we understand your child, we're different. We're here to help you, but we got to have your support. Conflict resolutions, mediations, we get in the middle of all kinds of things, from shootings in the streets to a beef on a campus. Real simple, real quick, knock it out and get it done. This is just a little bit of what we probably on an average you would see with this. 600 referrals that come through. We may not meet them all because some come, they want information, they don't want to follow through, they move around. We might open up 500 case managed clients, 50 gang-related incident responses. That'll vary. We average about 100 gang awareness presentations, anywhere from 8,000 or 9,000 kids to 4,000 or 5,000 adults, doing all kinds of training for citizens in the community. We've done HOAs, civic associations, you name it, we've done it. I've done churches, anybody and anybody, anything in any agency or anybody that wants to learn, we're there to teach you. If you want to learn this stuff, even if you want to do something virtual, we can do it virtual. COVID forced us to go where we had to go. You're talking about 20,000 gang members, they say, in the city. I think it's a lot more than that. When you look at our cliques, it still meets the definition of what a gang is. The younger population is picking up these guns like sometimes I eat a Snickers bar. I mean, it's just so common. To be on social media, posting it, and getting that satisfaction when you talk to them, they say, man, they know not to mess with me, Vic. They know I'm protected. They know I'm not going to play. Their self-esteem, the power that they feel holding that gun, the way they carry themselves with such confidence when they have a gun in their hand. But when you get them behind the scenes and that gun ain't there, and you dig a little deep about what's really going on in their lives, their heart's broken. It's broken, it's lost, it's confused, they hurt, there's a lot of pain, and they don't know how to deal with it other than to act out and be angry. And now they got guns in their hands, and now we're shooting people like it's no big deal. I'm here I just took over the office to close. I just took over the office roughly almost a year. And so I've been trying to wrap my head around that, getting from the streets to the administrative level at another level. But I'm here to partner with anybody that can fit in our role strategically as a city, because I believe that the quicker we get to situations on the front end, or in a situation where we have something at a hospital where the gang's following to make sure the person's dead, they're watching, they're sending people in, they're trying to get a real name, you got to go John Doe, you got to change it up, to the funeral services. So much goes on with this that it takes a lot of collaboration from a lot of people. Do not hesitate to reach out to our office. I'm here to conversate with you, listen to you. It's the one thing that I've learned, that a long time ago when I was young, I'm going to do this, I'm going to die doing this, and I don't care what anybody says, I'll do it myself. But I've learned with age, you got to work smarter, and not harder. And people are good people. When you latch on to good people, good work gets done. So kudos to the county, to the city where we're moving. It's just additional work. That's going to help me free my staff up to concentrate on other areas that I've needed to. But to everybody that was here today, I appreciate you coming. And for the folks that coordinated this, I really thank you for inviting our office. We're a true partner if you ever need anything. Thank you.
Could I actually invite all of the presenters for the community violence programs to come back up? I'm going to stay standing with Dr. Inayat.
That was amazing. Wow. I'm so inspired by you all. So we have a few cards, and we'll walk around and take more cards. And we have about 15 minutes of questions. This is a great group of people here doing a lot of excellent work. Please feel free to ask questions. If you'd like, you could, when we're done with the cards and you don't feel like writing a card and you think of a last minute question, it's okay to raise your hand. As long as we have time, we'll try to get to you. Okay, so question number one, how can we better collaborate between groups to truly leverage and scale up all of these efforts, such as trauma centers and these community programs? I had a very similar question. It's great that we're starting a HPIP with Ben Taub, and I hope we include my colleagues here. That would be awesome. But there's a lot of other hospitals as well in Houston and other trauma centers, and there's so much great work that's going on. Us working in the hospitals, we feel very siloed. We don't get to interact with the community, and it's so important to have that interaction. So how can we better leverage those the work that you all are doing?
Go ahead.
I think it starts with having those small conversations. I mean, what are the needs? I mean, you've heard from several different people today, and you've learned about some new programming. And usually what happens in these situations, that leads to another conversation, that leads to some more programming that you weren't aware of. I think a lot of times it's educating ourselves on all the programs that we have in our city and in our county. A resource inventory, I guess is probably the best way to say it, is what is out there that maybe could latch onto something that you have, even if it's a small idea. But I think it starts with a small conversation of what needs you have, and then what people can we bring to the table that can maybe stretch out the services that they have. Because I know I've wanted to work with Ben Taub for a long time, but I'll admit it's time for me. And really finding the right person, because every time I thought I found somebody was being moved around. So for me, it was, well, you show up when you show up with a client, because that's usually when it happens. But for us, it would be a small conversation. It would be the needs. I tell you what I have, how I can support, and then we'd be realistic about what we can do to get started with something small that eventually will grow, and then look at the funding opportunities, because that's going to be, if it goes well, you're going to need money. You're going to need money and bodies to put it in place.
And I'd like to add, when we have challenges like this, or we have initiatives like this, we do something called asset mapping. We know, or we have figured out what's in the community, and figuring that out, we identify the kinds of assets that are already in the community, and we pool the resources that we have together. So one of the things that I mentioned was that we're running our program, our violence intervention program, parallel to what Harris County has. So we identify what's already out in the community, because we don't ever want to run any program in the community without the community having a say. It makes it less effective if we are not aware of what the community wants and let them really guide the work that we're going to do. And so we really want to get out there and just complement what the community already has going on, and really provide them the undergirding in the work that they do. We're just kind of we're just the undergirding, and just working together, the city and the county and whatever other entities we are able to bring in as a resource. That's just kind of how I think we work best in what we do.
And I think it's important to, like Latasha and Victor both said, to know what everybody's doing, because there are only a certain amount of dollars going around, only a certain amount of staff. And like we mentioned, we're working in partnership with the City of Houston so that we're being good stewards of the dollars that are being given to the programs, and we're not overlapping, we're not duplicating service areas, and we're not duplicating the services. But we're working together, and we're in constant communication. We're in meetings very frequently. And another part is we're going to measure the programs. You know, especially Harris County is a performance-based county, performance-based budget county. And so we're going to have to demonstrate that what we're doing is working. So from day one, we're collecting our data. And one of the great things that we've done with the city is we're saying, okay, what are y'all measuring? What are you looking at? You know, so that we can partner and we can, you know, look at the same things to show the impact, you know, not just your outcome measures, but what impact are we really having in our community? And it does involve speaking to the community. Like, we've been having community engagement meetings since early January. And I'll tell you, some of them have been heated. You know, and they tell us, well, y'all are coming in, and we've had so many programs come in, and they come and go, and we're having to take a step back and explain, like, okay, well, we're not a grant-funded program. We're here to listen, and we want to hear from you on what direction we need to take with our programs. And the other thing I failed to mention during my presentation was that another initiative that the Harris County Public Health Department is launching is Access Harris. That is a coordinated care system where any of the residents that are going to be involved in my program, if they have compounding issues, we are working with all the safety net agencies in Houston and Harris County, that all of those safety net partners can have access to one dashboard for that resident. So if they're on probation or they're getting mental health services, people know what's happening with that one resident. Because many times, as a former juvenile probation officer for over 20 years, we set families up for failure because we have all these expectations. You know, oh, you have this many meetings, oh, but you have a mental health appointment, but you have a drug treatment program, and you got to go see your PO. You know, oh, you missed your appointment, all the whys. But if everybody's working together and looking at one dashboard for this care coordination plan, I think that's going to be successful. So we're really excited about getting that going as well.
And lastly, if I can add, I like what Latasha said, and I often say this, that when we're doing programming in communities, we have to realize that the community does not need a seat at the table. We must realize that the community is the table, right? And so once you realize the community is the table and we're going to serve them as public servants, then our priorities are in order. Oftentimes, what I see with the conflict and collaboration is roles and responsibilities are not clearly defined when you're cross-pollinating with other organizations and agencies, whether they be government entities or community-based organizations. And I think the main thing is the focus has to be on the population that we're serving. What's the end result? How is this affecting the youth? What's in the best interest of the youth? And I really believe that many hands make light work. And I also believe that if nobody cares who get the credit, we can do more work also. I think one of the key issues when you're talking about collaboration, and I've talked to Victor several times, anything with gang, Victor, I'm picking up the phone and calling him, and he investigated one youth that was in my program at the time. Now, Carlton, that's not really what's going on. I dug a little deeper. It's knowing your personnel also, right? Who's the subject matter expert in this particular area? Right. Let me call this person because I can depend on them for some sound advice and some information that's going to make the outcome of the youth or the young adult that we're serving as best as possible.
Egos need to be left at the door.
Yes, sir.
I've been in this a long time. Egos, leave them. Politics, there's no need for politics when we're talking about kids. That's just my opinion, right? Somebody might say something different, but when it comes to kids, man, we gotta really look at what's really going on. And I watch egos get in the way, agendas, you know, get in the way of doing some good work, funding not going a certain way, jealousy. They do this, they do. I don't care what you do, man. Do you? I do me. We come together. We do together, and the people are going to benefit from it. I've been around so long that was probably one of the biggest things I had to get over was ego. It was like, you know, leave those people, don't mess with them. They don't think like you. They're not in that same mindset or space that you're in. They'll come back around. They just need to be educated. They need to understand what gang violence is. They need to understand why kids play with guns and use guns the way they do. They don't understand yet. They come from a different space. So it's a matter of us being able to educate. But man, egos, gotta leave them at the door. I can't say it enough. Egos gotta go.
All right. Well, thank you all. This question, I believe, was directed at Carlton Harris. The question is, can you elaborate on the iceberg model and how it may apply in other areas in firearm injury prevention?
Absolutely. So the iceberg model is the majority is beneath the surface, right? So if you just imagine a Titanic when they hit the iceberg, you only see a top of it, but the majority of it is beneath the surface. So when you're working with youth and young adults, we see the behavior, but you don't see the thoughts, you don't see the feelings, you don't see the emotions, you don't see the beliefs, you don't see those internal things. We see the external manifestation of their thoughts or the external manifestation of their beliefs. I often put it this way, through our eye gate and our ear gate, things enter into our mind, which creates a thought, but it manifests in our behavior. So if I want to do behavior modification, I need to work on the transformative thinking. But if I want to transform the way that they're thinking, I have to change what they're seeing and what they're hearing. So when we have youth that are going back into the same environment, that are continuing to see crime and violence, they're becoming desensitized to it, and it's becoming normal. So what's abnormal to us have become normal to them, right? And so this is their thought, this is their belief, this is their emotion. This is what some people categorize as our youth being resilient, but it's really that they've just become desensitized to what they've seen every single day, that it becomes normal. And I'll use an example of a young man that I was mentoring through our diversion program, and he told me when he first met me, he didn't know my story, didn't know my history, didn't know anything about my upbringing, and he said, "Mr. Carlson, you don't understand. I see death every day." That's what he told me. So I think really having a good conversation with the population that we're serving, digging a little bit deeper, stop trying to put a Band-Aid on something that needs surgery, and really getting to the root cause of the problem. Because even if you look at crime, crime is associated with economics. The higher the crime rates are in the most underserved communities where there are lack of opportunities. So it's like hand in glove. So those are the things, that's the iceberg model. The things that are not seen, the things that are internal, the things that we take for granted that this young person understands thoughts, beliefs, emotions, when we understand that the frontal lobe of their brain is still fully developing, and not fully developing until they're about 25. So you can use that iceberg model in any situation as it relates to crime and violence. And again, I think about myself learning to shoot a gun at 7. That was a taught behavior. My uncle literally put the gun in my hand, held my hands up in the air, and helped me pull the trigger and said, "Now you are a man." I learned that. And so from that young age, it framed my thinking and my belief system that I'm not a man unless I know how to operate a firearm. And I learned that at 7, and it carried me to my teen years, which ultimately led me to making bad decisions and bad choices. That was a contributing factor.
Wow. Okay, unfortunately, we only have time for one question, and this was for Victor. So you're clearly very passionate about your work, and thank God for you. First of all, how can you meet the needs of the entire city with only 9 people?
I ask myself that all the time.
We need about 100 Victors out there. And then secondly, how does your program evolve and grow in settings where you did not always have support? And I think that's indicating, you said there's certain areas where you work. How do you pick those areas, or how do you find new areas? How do you evolve and grow?
So learning from the comprehensive gang model, what I learned was, I'll never forget when they first came to Houston, and they put the model in my neighborhood where I grew up. And I'm listening to these folks from Chicago and OJJDP out of DC, and I'm listening to them, and I'm like, man, y'all know nothing about my neighborhood. What are you gonna do to change the way things are in my neighborhood? And I laughed and I laughed, and I sat there, and I was young and full of myself. I got this. And it was the base that I had to work from, and it was an assessment that I needed to understand. It was something that HPD had all that information. I didn't have it. They weren't going to give it to me. When I moved into the mayor's office, anti-gang office at that time, Adrian Garcia was our, Commissioner Garcia now, would share data with me, and I was looking at the data. But my work in the nonprofit for many years, I would hear about other sides of town. I knew of other sides of town because I would work near the area that I was working in already. So I knew a little bit about the streets, but the assessment, being able to do an assessment and see I'm very visual, watching what was going on paper and matching it up with what was going on the streets when we were doing the work has to match for me. Each area of the city, there was always top 3 or 4 areas, and so I look at those top 3 or 4 areas, and they don't change much. The year that something is going on, the activity may change, and the bodies and the people change, but the cliques are still there. South Lawn, Big Bed, Free Money, you got Murder Mob, I got Cholos, Primera MS, I got Brown Pride, I got, Five Deuce Hoover on this side, 5-9 Bounty Hunter on that side. They link up, they don't link up, we operate separate, 60s do this. The ability to be able to understand that allows me to understand where my staff needs to be, because we can't be everywhere. So I'm in the schools in that area, I'm in the parks in that area, I'm in the apartments in that area. If there's projects, we're in the projects in that area, and we stay doing service in that area. Does it take us to another side of the freeway? On occasion, it will. But it doesn't mean that I'm gonna just stop doing what I'm doing here. When I heard what was happening with the health department, both city and county, and I heard Lupe and them were going up that way, much needed help. Things have calmed down. They still got some drama, stuff's still popping off, but at least now there's additional bodies, and it's a matter of sitting down with Lupe and figuring out, what are you doing so I don't step on your toes, and you're not stepping on mine. We're doing what we need to do and do it effectively. So I have to be able to be very smart in how I do this. Those meetings, those gang violence reduction team meetings, it allows me to be in areas where I can't be all the time, because the people that work that area are there. My staff, probation, parole, law enforcement, school folks that work that area. We're working with people that are dealing with the kids that are in those gangs causing all that violence. That's how I keep up with it, because there's no other way to do it. Now, can I get to the suburbs every now and then for a phone call? I'll try, because the suburbs do have their issues. Can I get to other areas that are maybe a little quieter? If I have to service them, I have to service them, because we're city government agency, and I'm not going to turn my back on a parent that really needs help, but I have to concentrate on my staff's efforts and where we're going based on data. I have to look at it, and then I compare it to my street knowledge and what I've been doing all these years, and pass that on to my staff.
Okay, great. Thank you so much. I think we're out of time. Thank you all.
Thank you.
What amazing work that's being done in our Houston area, and I'm just incredibly proud to be here and to learn about all these amazing programs. I have the joy of bringing it all back home and to go over policy with everyone, because that's the piece here that we're all talking about and going over is how do we impact or understand how to impact policy. So we're going to go over an overview of federal, state, and local policy. I have no relevant disclosures, as I did earlier. I had no disclosures. So we're going to go over some historical context as well as an overview of the legislative policy. This is by no means meant to be comprehensive, so because there's a lot of policies about firearms, but we're just going to try to focus on the firearm policies at federal, state, and local levels and review some of the impacts of those policies on firearm ownership and injury, and also talk a little bit about what's currently going on the federal level as well. So everyone knows as we start talking about policy, we have to start with Second Amendment, or 2A, and certainly when we think about Second Amendment, everyone talks about how whether or not this is the debate between the militia versus independent individual right to carry. So recall at the time of the drafting of the Constitution, the Federalists versus the Anti-Federalists made two general concessions. Number one, they gave the Constitution total legal authority over the Army and the militia. But at the same time, they granted that the federal government should not have the authority to disarm the citizenry. So that's why you have these two together, right? But they did also say at the same time that the federal government could grant the states the right to regulate guns. And so this 2A is kind of how it was drafted originally. This was further codified in the 14th Amendment to state that the individual right to carry guns was granted, because recall, black men did not have the right to carry guns until the 14th Amendment after the Civil War. And so 14th Amendment further solidified, yes, the individual right to bear arms was granted. So what we saw afterwards was a series of key federal firearm acts. So in 1934, we saw the first regulation and manufacturing and transfer of firearms through our favorite form, taxation, right? And so we also saw some regulation of some very narrow scope of firearms. In 1938, we saw the creation of licensing requirements for those who manufacture, import, or sell firearms, the creation of the Federal Firearm Licensing, the FFL. And so for those that go for licensing, we talk about firearm retailers being FFLs. This is where this term was originally oriented from. It also required record keeping for those who sell firearms and prohibited certain sales, like you couldn't sell to someone who was a felon and things like that. And this was law of the land until 1968 with the Gun Control Act of 1968, which is the current law that we have right now. And as you can see, it has a fairly all-encompassing prohibition of the sale of firearms for folks who, are unlawful, fugitive of justice, if you're addicted to a controlled substance, underage, dishonorably discharged from the military, convicted of a misdemeanor of domestic violence, subject to a court order or a restraining order from harm for domestic violence or child abuse. But it does not include those who, are on the terror watch list, so that's something to be considered of, or does not include those if you've had a juvenile offense or convicted of a violent or gun-related misdemeanor. The Gun Control Act of 1968 also provides for background checks when purchasing from someone who's engaged in the business of dealing firearms. So the way the language is written is kind of vague, right? So it excludes those who do occasional sales, hobbyists, someone who does a personal sale. So it really is kind of this loose definition of who is someone who sells firearms and someone who does those regular sales. What we saw with this was in 1968, we saw the Firearm Owners Protection Act, and this really liberalized some of the restrictions on firearm sellers also. It allows for FFLs to also sell at gun shows, as well as it prevents the federal government from having any kind of central database on the FFLs for having record keeping. So no central database is allowed. We also saw in 1993 the Brady Handgun Violence Prevention Act. And so this instituted a 5-day waiting period for purchasing a handgun to allow for the completion of a background check. So that's important to recall, okay? So this allows time for the FFL to work with their local firearms or their local law enforcement in order to complete this background check. And so this was law of the land up until, we start doing our instant background check systems. In 1994, we saw the passage of the federal assault weapons ban. And so this prohibits the manufacturing, transfer, and possession of semi-automatic weapons, prohibit large capacity feeding devices, and also banned 19 specific models by name. So this was passed in 1994, and it had a 10-year sunset provision. So it did sunset in 2004, and it was not renewed at that time. In 1996, we also saw the Dickey Amendment, which prohibits any federal funding from the CDC to be used for research on gun control. The Dickey Amendment is still active. As a result from this, there were no funds that were dispersed for firearm research until 2019. We also saw in 2005 the Protection of Lawful Commerce in Arms Act, and also the Child Safety Lock Act. In the Protection of Lawful Commerce in Arms Act, what that does is it prohibits any qualified civil liberty action in either a state or a federal court against a manufacturer or a seller of firearms or ammunition. So what that means is without any kind of exception. So unless there's a defect in the firearm or in their warranty, or if you knowingly sold the firearm to someone who is going to perform some kind of crime, you aren't allowed to prosecute or bring a lawsuit up against the firearm manufacturer or a seller. Also with that act, they did require that every handgun sale or transfer needed to include a safety device, either a locking device or a safe storage device. In 2007, we saw the National Instant Criminal Background Check System Improvement Amendments Act. So what this did was it provided financial incentives to states to use the instant background check system. So states could start doing these instant background checks. What this essentially did was nullified the Brady Act, because remember, the Brady Act was only in place to do the 5-day waiting system to allow for the background check system to happen. So if you have an instant background check, you no longer need a 5-day waiting period. What we saw was several Supreme Court challenges in order to challenge the Second Amendment, and these are the two most notable ones. In 2008, we saw District of Columbia versus Heller. In District of Columbia, they attempted to forbid the ownership of firearms, and it was deemed per the Second Amendment the Supreme Court by a ruling of 5-4 was no. Second Amendment rights do hold up individual right to carry, and the District of Columbia could not restrict ownership to individuals at that time. What we saw in 2010 was a similar legislation that was passed by the city of Chicago, where they tried to forbid ownership of firearms within the city of Chicago. Again, the Supreme Court ruled 5-4, no, you cannot ban ownership of firearms within a person's home. But they did state that you could ban possession of firearms within certain areas of the city, right? So you can say, no, you are allowed to own your firearm in your home, but you can restrict locations within the city where you can have them. But they also did another step forward, and they said that, you know, what cities could not do is that they could not pass legislation on weapons where they were not typically possessed by law-abiding citizens for lawful purposes. So it's important to remember that language, right? Because that had a significant influence on firearm ownership in America. So what you saw here was a lot of people had theorized that after the sunset provision from 2004, remember, the firearm assault weapons ban was passed there. I'm going to see if this pointer will work. Is it working? Huh. Yeah. Oh, here we go. So you saw here in 2004, right? That was when the assault weapons ban was lifted. And there was a theory that people would go out and want to buy a bunch of assault weapons and rifles. And so in this, this yellow line is where the rifles are. And you did not actually see from 2004 until 2008 any real increase in that mass purchasing of rifles. We assumed that there would be after that, but there really was not when you saw this lift of the assault weapons ban, right? You saw a little increase after 2008, and that was expected because there was this concern with the election of Obama that he would somehow reinstitute the assault weapons ban, and so there was a little bit more of a purchasing there. But you really see it take off around 2010, and that's for both pistols and rifles. And the reason you see this is because of this language that was introduced with the McDonald versus City of Chicago Supreme Court decision, with this language around not typically possessed by law-abiding citizens for lawful purposes language, right? And so the idea was firearm owners were wanting to mass purchase firearms because they wanted to show that law-abiding citizens were owning firearms for lawful purposes. And so you saw this mass purchasing, and you can see the effect of that legislation and the impact of that from the Supreme Court decision there. Other impacts of federal legislation, we saw significant ones on research. Firearm injury and gun violence is the least researched cause of death, and the second least funded cause of death after falls. Falls is the least funded. Falls is way down in the corner there. And then you can see, you know, when you look at all these other, if I can, this is very difficult with this pointer. I'm going to just give up on that. You can see, you know, as far as when it looks at firearms in red, you can see comparatively there's more annual number of deaths. Oh, I can aim at the screen too. Ah, look at this. Okay, there's more annual number of deaths in firearms than there is compared to prostate cancer, and then comparatively amount of funding from prostate cancer here versus the amount of firearm funding. Significant differences, right? So the amount of funding and dollars that we invest in our research to firearms is significantly lower compared to the amount of deaths that there are. Direct impact from legislation. What's currently going on in the current legislation from a federal level, 2022, the House passed the Protecting Our Kids Act, which did call for the raising of the purchase age for the semi-automatic centerfire rifle to age 21 years, banning bump stocks, restricting those large capacity magazines, also implementing gun buyback programs, prohibiting those straw purchasing. For those who don't know what straw purchasing is when you go in and you are intentionally wanting to purchase a firearm and then giving it to someone who legally cannot purchase a firearm on their own. And then also requiring all firearms to be traceable. This is kind of restricting the those ghost guns, or like creating your own like 3D version of your firearm. And then also making enhancements to our safe storage laws and implementing grant programs to improve safe storage. What we have in our bipartisan Senate framework, we don't actually know what the legislative language is, so I really can't comment as far as what that really is. The official language has not been released yet, but this is what the framework has been proposed, is to incentivize states to incorporate red flag laws and enhancing those background checks for purchasers who are under the age of 21 years. Also closing the boyfriend loophole, because again, you can't, you prohibit sales on people who are convicted of domestic violence, and also for those who are have a restraining order against them, but not necessarily for those who are involved in non-marital type positions. So you're looking at like people who are maybe not cohabitating with someone. So you have this like boyfriend loophole. What if your boyfriend is someone who is in a domestic violence situation? So they want to close that loophole in there. The bipartisan framework also calls for a stricter definition of what an FFL is, so that way you can really further define this engaged in the business of dealing with firearms a little bit more stricter, so that way we can maybe enhance who's requiring to do those background checks, as well as increasing mental health and school safety funding. So that was a whirlwind tour of the federal legislation, and we're going to move on to the state. And if you wonder where the state of Texas lies on their beliefs on firearms and our rights to own firearms, it's in Article 1, Section 23, right away at the very beginning. It's in our state constitution, where we have the right to bear arms, and that the state wants to grant that very immediately to us. In Texas, our ownership laws are that you have to have a minimum age of 21 to purchase a handgun, because that is the federal law. Our minimum age to purchase a long gun is 18 years. However, minimum age for possession of a firearm is really, there's no minimum age as long as you have permission of your parent or guardian. So you can be gifted a firearm at any age in the state of Texas. If you want to officially transfer a handgun to someone, then federal handgun transfer laws do apply. In Texas, I kind of approach this as a do and do not type approach, because there's a lot of laws and regulations around firearms. So in Texas, our laws do not restrict types of guns. So we don't have restrictions on ghost guns or untraceable guns. We do not restrict any kind of bulk sales, so you can go in and buy as much as you want in a single sale. We don't restrict on sales of assault weapons or high capacity or high caliber, like your 50 caliber firearms. We only require those background checks for the FFLs, so they're not for universal sales or for personal or individual sales or even at gun shows. We do not require licensing, we do not require registration, and we do not require someone to report loss or theft of their firearm. What we do require is we regulate the sale of armor-piercing bullets. You cannot buy ammunition if you are intoxicated or if you are within 5 years of incarceration from a felony. We prohibit possession and sale of fully automatic firearms, so no machine guns in the state of Texas. We prohibit straw purchasing, and we prohibit selling firearms to someone who is knowingly lying on a background check. In Texas, we have been allowed to carry long guns for a very long time. And in 2021, it was passed that you are allowed to openly carry a holstered or a concealed handgun without a license. You are allowed to use lethal force in Texas when defending your property. And we also have the stand your ground doctrine, which removes the duty to retreat before using deadly force. In Texas, state law dominates. What this means is we have preemption laws in municipalities and counties, which means state law supersedes any and all local laws. It goes even further that we have joined 5 other states in the country to become a Second Amendment sanctuary state through the passage of that act in 2021. What that states even further is that there is legislation that not only prohibits but also penalizes local governments, public employees, and law enforcement from providing any assistance to a federal agency in imposing any restrictions that does not currently exist under a Texas law that relates to any registry, licensing, requiring of any background check on private sales or transfers, including gun shows, and also any confiscation programs. So Texas has made it very clear that Texas state legislation is in charge of developing the policies around firearms, and this is where they are the decision makers on those policies. In general, in Texas, whenever there is gun violence, the tradition is that in the gun violence, it usually loosens the restrictions on carrying firearms. And we've seen that especially after Sutherland Springs, where churches were then allowed to have parishioners carry guns in services. And then we also saw constitutional carry or permitless carry happen after El Paso. Texas is one of 34 other states that has child access prevention laws, which allows for criminal liability for negligent storage. So there's three types of general types of child access prevention laws, which are a child may access a firearm versus that they have accessed a firearm versus that they have used a firearm. Texas law falls into the have accessed firearm, in which it penalizes an adult if a gun is readily dischargeable and accessed by a child that is under 17 years of age. And the evidence around this CAP laws, or child access prevention laws, are that they can reduce suicide and unintentional injuries and deaths by children by 54%. ERPOs, or extreme risk protection orders, or red flag laws. Texas does not have one, but they are ones where family members or law enforcement can temporarily remove a person's firearm if needed, if they are deemed an imminent risk to themselves or others. In states where they have been implemented, they've been shown to reduce suicide between like 7 and 14%, and have been theorized that they may also help prevent mass shootings and gun homicides. 19 other states in the District of Columbia have these orders in place. What we do see is states that have strong firearm safety laws do correlate to lower firearm-related pediatric mortalities. And what you see in states where they have universal background checks for the 5 years previous, you saw a 35% decrease in the pediatric deaths related to firearms. And what you see in this graph right here, states with stronger firearm laws have lower pediatric mortality rates, and those with weaker laws have higher pediatric mortality rates. The governor's action to gun violence, we saw this picture earlier, the Santa Fe roundtables, where they initially called for a variety of things in their response to Santa Fe. And what came out of there was Senate Bill 11 in the 86th legislature, which called for school behavioral threat assessments, where they looked at comprehensive programs in order to identify children who might be at risk of hurting themselves or others, and how to identify them early and to implement intervention programs in order to help prevent any events that may happen, expanding mental health interventions, creating the Texas Mental Health Consortium, funding and increasing schools' securities, as well as implementing bleeding control measures to be taught in schools, and creating a task force within the Texas Education Agency on mental health services and training, and appropriated $100 million to this service. What we saw after El Paso and Midland, Odessa was the creation of a statewide active shooter alert system and the passage of the Lie and Try bill, making it illegal to lie on your background check, and also the passage of permitless carry. We also saw the passage of the Keep 'em Safe Texas program, which is a partnership with the Texas Department of Public Safety focused on safe storage, as well as in 2021, the waiving of sales tax and the promotion of tax exemption for purchasing of safety devices. Moving on to our local policy. Surprisingly, there's not a lot because we have preemption laws that exist that restrict what local regions can pass. So largely the things that are specifically related to Texas local policy restricts on reckless discharge of firearms, and you're not allowed to hunt in the city, in case you were wondering. But we do have the opportunities to do intervention programs and campaigns, and that's where a lot of the funding, and you guys have heard a lot about these programs already, so I'm not going to spend a whole lot of time focusing on that. But our Houston Safe Storage campaign that you've seen through the District Attorney's Office with 25 billboards that are across the city, the PSA that you guys had the opportunity to view at lunch, and then cable lock programs, and even partnerships with our HISD program, our schools, to train adults and parents and staff on safe storage, and even partnering with Academy to have their logos displayed to view the importance of safe storage. And for those that didn't have the opportunity to view at lunch, if you just go to YouTube and then type in the search bar, the importance of safe storage, you'll be able to pop up the video and view it for yourself. And then many of the Houston programs and the investment that the city has done into these programs has really been commendable, and the panel before us really got to highlight many of these intervention programs, as well as the Mayor's Commission Against Gun Violence, bringing together this very diverse group of key stakeholders to provide these recommendations on legislation, budget, because we all know if you don't fund something, it can't be really successful. And I'm just really amazed to hear what many of these programs and policies were able to do with such little staff. Really, when I think about it, I'm like 9 people for the whole city of Houston, and look at what you can do with those. So really give people a little bit of money and they can stretch that quarter to make it last, and see how we can make these interventions. And then also the One Safe Houston program, which was just launched, and we heard so many great things about the One Safe Houston program already, to really see how we can intervene and reduce crime and violence in the city and really make an impact on firearm injury prevention. So again, not going to speak a lot about this other than this is another great example of how we can use local policy approaches through fiscal investments, and you don't really need to have those policy investments in order to impact firearm injury. So knowing those levels of policy, knowing where those spheres of influence can be, because you can't really work on a local level at passing policy from different ways, but you can intervene through those investments is really knowing. So thinking about, is this legislation? Is this regulation? Can you go this through a different funding route is going to be an important thing. And knowing who your decision makers are is another key thing. And when you think about who your decision makers are, you can use some information to help influence them. So looking at things like the gun violence poll, which was recently pulled, the data was pulled from this right after Uvalde. And this was a fairly balanced poll from, you think about it, from Dems and Republicans and independents. And this is the data from just firearm owners. And they were asked, would you support a representative if their policy was that they would require background checks for gun shows or private sales? 69% said definitely yes. And then would they support red flag laws? 61% said definitely yes. So this is information that you can share with folks as well and decision makers. So when we think about what influences policy, these are the three things that influence policy: scientific knowledge, social strategy, and political will. And so what we're talking about here today and here at the Baker Institute is developing that scientific knowledge, right? So we get the information, we get that research. We've heard a lot about today with the research to policy. How do you translate that research and that information into something that legislators can digest and use and be able to translate that into something that can become and influence the social strategy, right? And how does that social strategy then that we've seen and implemented in there, how can you take that and how does that translate into political will? But you need all three of those in order to influence policy. And so understanding policy is an essential key because you have to understand the background behind the policy in order to understand why things are the way they are today. Why is this such a difficult conversation to have? You have to understand the background behind it in order to be able to address the policy, because it's not just as simple as saying, pass a bill, right? The history behind it is important and imperative to understand. And understanding the research is important in order to provide the evidence, because the evidence can help us divide those viable social strategies, because we did that very effectively. You can see here in this graph, we used our research and our evidence to come up with the social strategies in order to reduce motor vehicle crashes, which is that first blue line. We did that. We came up with car seats, came up with seatbelt laws. We defined better roadways, speed limits. We made our intersections safer. And we helped children not die from car crashes over decades. And now motor vehicle crashes are not the leading cause of death in children. It's firearms. So there's no reason to think that we can't take a similar approach in order to help reduce firearm injury and death in children. So thank you so much for your time. I believe we are up to have Dr. Knott give us a few closing remarks.
Thank you, Sandy. That was great. Before we move on to the coffee break and then our panel session with our city leaders and state representatives, which we're all very, very excited about, I just wanted to summarize what we've learned today. Some of you came in after lunch and may not have been here for the morning sessions, so I just wanted to put everyone on the same page. So first of all, we heard from the mayor this morning, which was a real treat. He had a very strong message about gun violence, how there's a lot of guns in Texas, how it's increasing, and how we've put programs into place they do seem to be working, but there's a lot of work that needs to be done. Then we heard about some research here in the Harris County area that showed that about 2,000 adults are injured by guns per year. That includes fatal and non-fatal injuries, and about 200 children are injured by guns per year. We learned that between 2018 and 2019, there's been an increase in gun violence in children by 76%. We learned that homicides are more common than suicides in adults in Harris County, which is different from the national numbers where suicides are more common, which shows how many homicides we have here. We learned that unintentional or accidental shootings in children happen very often. Almost 20% of children who are injured are shot by this, and that firearms from at home, family firearms in homes of people's homes and families' homes and friends' homes and cars are responsible for the vast majority of unintentional shootings and suicides. We saw some of the hot spots and the areas where these things are happening. We saw some of the differences based on shooting intents. We saw the trend of firearm violence in Houston, which goes through peaks and valleys, and unfortunately is on an upslope here and may not be at a peak yet, but most likely it's going to get even worse before it gets better. We heard about safe storage and interventions such as training residents on how to provide safe storage guidance. We learn about perceptions that firearm owners have regarding safe storage, how gun retailers can be very helpful partners as their trusted messengers. We heard about a wonderful public campaign in Austin that has been funded by the city and that has had great outcomes and great results by a very passionate parent who lost a child to an accidental shooting. We heard about suicide prevention in veterans, and although in a really wonderful program, the Vision Coalition that has done a lot of work in that arena. We heard about the rising mental health crisis in teenagers and the TCHAT program, which is telemedicine counseling for students in schools, that is funded but could probably require about 10 times more because this is a really big problem. We heard about violence prevention interventions for firearm violence, but also dating violence and other teen violence. That should be good for all children, not just children in affected areas, but for all children, and starting at a young age. We heard about how to talk to policymakers, translating research to policy. Then in the afternoon, we heard a wonderful perspective from a trauma surgeon, a day in the life of a trauma surgeon, and how much gun violence we're seeing here at our trauma centers in Houston. How bad it really is. We're all siloed. We all care about this greatly, otherwise we wouldn't be here. But sometimes we all don't know what each other is doing. And so I think it was really nice for others to see what we see, and then for us to know what goes on in the community, because that's not something that we hear about a lot from the medicine side. And so hearing about all the wonderful community-based programs that we have, the One Safe program, that's an example of great use of federal dollars. The City of Houston anti-gang interventions, the Harris Health Public Health Department and the Houston Health Department, and all the programs that they have that are separate but equal, it sounds like, and everyone doing wonderful work together. And these are all fairly new, so I really hope to see some great outcomes from them in the years to come. And then finally, we heard from my partner, Dr. McKay, about policy at the state, federal level, and that wraps up the day. So that was a quick tour of what we've learned today. It's been so wonderful to see everyone here. Thank you so much. And thank you so much to the Baker Institute for hosting this fabulous event. We hope to have more of these. So this is just the first. And next we will move on to the coffee break. Thank you.
He didn't come, so just.
Good afternoon. Thank you, everyone, for sticking around. And I'd like to welcome everyone to our panel discussion. First of all, I'd like to welcome our panelists and introduce them. First of all, we have Sheriff Ed Gonzalez, who serves as the 30th Sheriff of Harris County, one of the largest sheriff's office in the state, and he has for the past 6 years, so thank you for being here. We have the Honorable Ann Johnson, who serves as the state representative for Texas House District 134, which encompasses our Texas Medical Center. Thank you for being here. We also have the Honorable Kim Ogg, who serves as the district attorney for Harris County since 2016. Thank you for being here as well. And at the end, we have the Honorable Senator John Whitmire, who serves as our Texas State Senator in the 15th Senatorial District, encompassing the North Houston and Harris County, and has been in service for over 35 years. So, to frame up this, I want to thank everyone here for their participation in this wonderful conference, and we've had such a full day of presentations in both research and programs around firearm injury prevention. But before we get started, it's important to know your audience. So as a show of hands, if you feel comfortable, raise your hand, panelists included, if you are a firearm owner. Raise your hand.
If you're what?
A firearm owner.
If you own a firearm, okay? And for the audience, so that our panelists can kind of know who they're speaking to, who here is in the healthcare industry? A lot of healthcare. Awesome. And then who here is in firearm injury prevention research? Injury prevention research in general. Excellent. About half of the room there. And what about in law enforcement or criminal justice? Oh, excellent. Excellent. So we have a nice, diverse audience here for our panelists. All right, so this first question is for all of our panelist members. We're going to start with the elephant in the room, Uvalde. The deadliest school shooting that Texas has seen occurred as the school year was ending and at the time when children were just getting back to normal with the stressors of the pandemic. Houston ISD has 276 schools with over 190,000 students. As Texas leaders, what are the one or two things that you feel are essential to continue or implement to ensure the trust of our parents in the safety of our schools? I'm going to ask DA Ogg to weigh in first.
Well, thank you, Doctor. I think the three things that Houstonians and all Texans want to know when we send our children to school is what is their safety plan, what is their safety protocol with the agencies who would respond, and what training have they had. I think if we can answer those three questions, it will give our resident parents greater comfort level just in knowing that we are at least prepared. I don't know that we'll ever be ready for a mass shooting, but we would at least be prepared.
Sheriff Gonzalez?
Thank you. Just to add to what District Attorney Ogg stated, and I'm a product of the Houston Independent School District, so to me, as a parent, as a member of this community, making sure that our schools are safe is a top priority for myself and many other police leaders. We're very fortunate here that we work very collaboratively. There's a lot of resources in Greater Harris County, and while Houston Independent School District may be the largest, we also work very collaboratively with all the number of ISDs that are out there and some of the smaller charter schools as well that may not have all the police resources handy. So it's something that we're going to continue to do. We spoke about it today. Internally, we have a meeting tomorrow. We're scheduling a lot more updated tabletops as well. Obviously, as a response in Uvalde is being reviewed and dissected as well it should be. There's lessons to be learned there as well. You know, when Santa Fe occurred, the shooting here in Santa Fe, I remember responding that day myself, even from Harris County, going over there. It's like an all-hands-on-deck approach. I was there on the ground as all the deployment was being rolled out, And so obviously got a firsthand view of that response there. And there's always something to learn from each response. So we're always learning, again, internally from lessons learned that we may have had here, as well as learning from others and across the country. And sadly, there's been far too many examples in this country from Columbine on to now. And so we just want to make sure that we're prepared, because we've got to take some serious action, because it's not a matter of if, it's going to be when it happens again, because the way, without action, it's going to happen again.
Representative Johnson.
Thank you very much. I think the biggest thing for us is to recognize it's June 21st and we're still not in a special session. So I think you ought to ask the question, are we tired of doing the same thing over and over again and expecting a different result? We can't keep asking law enforcement to solve a problem that they can't respond to reactively, and we need to be proactive. So when you look at mass shooters, there is a commonality among them. And we have had 5 of 10 of the greatest mass shootings in this state in the Abbott administration. And so I don't want to hear the same thing we heard after Santa Fe and El Paso and Sutherland Springs and Midland, Odessa. I would like to hear legislature come back. And it is time to do the thing he did not have the courage to do the last time, which is extreme risk protection orders. We need to give law enforcement the opportunity to prevent things proactively. Now, of course, I'm going to step up and I'm going to vote for whatever we need to do that can keep kids and schools safe. But expecting them to defend against something that we don't politically have the courage to do something about, to prevent, I think is asking the wrong question.
Senator Whitmire.
Thank you. And thank the sponsors for bringing this together. We need more conversations like this, but we've got to leave here with a mission plan. We've got to leave here fired up and quit talking to each other. The legislative committee is meeting as we talk, and they're not talking about the solutions that most of us would propose. I could give you a laundry list of things that I believe would help, but to narrow it down to the most important 2 would be red flag legislation, and then a mental health system that would respond to the documentation that someone's having a psychological, emotional challenge. It works in other states. There's nothing to fear from it. It's a due process procedure that protects everyone's Second Amendment. But the commonality in these shooters are they're having a mental health issue. So if we can detect it early and then have a mental health system, let's speak about the mental health system for a moment. In this city today, if you have a minor or an adult, but I deal with minors quite often, that have not committed a crime, they can't get in the criminal justice system to get what little help you get there, where do you go? You go to the emergency room? We don't have Medicaid expansion. We could put that on the list of to do. So this is not rocket science stuff. The leadership knows the solutions. The members of the legislature know the solutions are partial solutions, certainly first steps, and they refuse to acknowledge it. So I will close with this. Until everyone in this room and the people we know, our families and friends, make this issue the single issue of how you're going to determine how you vote in November, then we're not going to get to where we need to be. You know who's at fault. You should know who your state rep and state senator is, and if they're wrong on this issue, inflation, other issues that are so important, like women's health care, you've got to set other issues aside as you grade people's paper. In society, Texans have to decide enough's enough on gun violence, and we're going to do something about it. And it's not just the mass shootings. We daily are losing, as the sheriff will attest, 3 or 4 folks each night in the evening news that DA Ogg deals with. So you add the 3 or 4 violence on the streets of Houston as it relates to guns and suicides. We're having literally mass shootings each week in the city of Houston and Harris County. So thank you, but we got to leave here fired up.
I couldn't agree more. We have to leave here fired up. And that is one of the reasons why we wanted to bring people together, was to see what we could do collaboratively as a group.
Mm-hmm.
Now, one of the things that leads me into for Representative Johnson and Senator Whitmire is, since you alluded to what we can do, is what experiences have you faced in trying to pass legislation to promote firearm safety And what lessons did you learn from that experience?
Well, I've had Moms Demanding Action have asked me to sponsor their legislation the last 2 sessions for red flag legislation. I can't get a hearing. The Lieutenant Governor will not refer it to a committee. So a moment ago I said elections matter. This fall we have a statewide election at every level. So take notes, know your representative, your senator, have them talk to the leadership. But here's a real frustration. They witness the pain and the tragedies that we do, and they use diversions. They want to talk about hardening a school. Professionals would tell you by the time a mass shooter gets to the school, it's too late. If they can't get in the one door that Senator U.S. Cruz wants to establish, they'll do shootings in the parking lot. If you want to do metal detectors, as the Lieutenant Governor proposed after Santa Fe, that creates a line at the front door of the school, so they would have access to those vulnerable people. So the bottom line is, as I said a moment ago, you know, we could talk about raising age. That's a major step. Large magazines, we could talk about that. But I really, really think if we don't have a red flag where one of you or an emergency room doctor says someone in the emergency room is going to leave there and they're emotionally disturbed and they're going to take it out on domestic abuse victims or whatever altercation they anticipate, you've got to stop them and deal with their being armed at that time. And then you've got to have the mental health services.
So I'm proud to be a gun sense elected official, which means in my first legislative session, I advocated not only for common sense gun safety reforms, but fought vehemently against permitless carry, fought vehemently against long weapons having the right to be in a hotel even if a business didn't want it, fought vehemently against silencers made in Texas so they can avoid federal regulation, fought vehemently against another bill, which is if you happen to be a business and you don't want to provide money to people that manufacture ammunition, well, now you can no longer get a state contract. So when Governor Abbott says he wants to make this a Second Amendment sanctuary city, I will say, as what most reasonable gun owners would say, the Second Amendment has been twisted by some individuals to mean something that it is not. And so these illogical policies in Texas have put us into a position to have weapons everywhere. One of the bills that we offered was an anti-mass shooter bill. So if somebody walked in this room right now and fired off 10 shots and were just not a good enough shot to kill one of us, but hit 10 of us, they could be prosecuted as a second-degree felony, maximum 2 to 20 years, and not stackable. To me, that's nuts. And so I offered legislation to make that a first-degree felony stackable offense. And so we've seen after that bill failed that it would have applied to a number of people who were just failed mass shooters. But I think that the law ought to treat them as seriously as they are. That died in the Senate at the feet of Lieutenant Governor Dan Patrick because the gun owners of America objected to it. A resolution that I had to honor the death of a child who was killed by a gun in a high school here, and just a resolution to honor his life. Not a law, not anything that would have any effect other than to put in Texas history the story of this child, the manner in which he died, and the last phrase, that his life won't be in vain, and we as a state of Texas will take firearm safety measures seriously. Firearm safety measures seriously. The Republicans on the Homeland Committee could not pass that resolution because that phrase offended the gun lobby. So when you say, what have we tried to do? We've tried to do everything that you've asked us to do. But there is a group within the legislature that are beholden to a group of folks that walk around with guns on their hips and shirts that say compromise and death. So they are more rabid than you can imagine. And so until our feeling of urgency politically to make this the number one issue that either gets you to Austin or out of it, you're not going to change it. And so if they won't change the laws, change the people who are there making the laws.
Thank you so much. I do want to acknowledge that for this panel, we did invite several of our Republican leaders to be here with us today. They are also working in the Texas legislature during the hearings today as well. So, so just want to make sure that we're being full in our disclosures as well. You'll also see in your programs today that Chief Finner was to be joining us, and he unfortunately had to make a last-minute cancellation, so we do miss his presence today. Moving forward, I do have questions for Sheriff Gonzalez and DA Ogg. With COVID, we saw a significant increase in pediatric firearm injury, and in our local hospitals at the Texas Medical Center, these injuries were up by as much as between 30 and 65%, predominantly from assault or homicide. Hospital-based violence intervention programs can be helpful in preventing further injury in these affected patients, however, only after the initial event. We want to work upstream to stop the crime from happening. In light of the changing landscape from the pandemic, what priority programs would you like to invest in and to collaborate with to reduce firearm-related street violence? DA Ogg, I'll let you go, or Sheriff Gonzalez.
Well, I go to many of those scenes, and I've seen our children injured, not killed, and it's tragic and it's awful. And I've been in this profession now for many years, and I'll tell you that it's so much more common now to go out to some type of a violent scene, and you see or hear of 30, 40, 100 shots being fired here in an urban setting. I remember in Acres Homes, just recently, about a month ago, going out to a scene, and almost 100 shots were fired. One of the bullets went into an apartment and struck a young child. Luckily, he survived. But we hear and see those stories too often here in an urban setting, and that's just bad. And so I think there's a desperate need for sensible gun laws to be in place. I think it's reasonable. I think we should be smart and thoughtful, look at the data. I see Lupe here with the Harris County Public Health Office. We're working much more closely together at the county level now to try to see how we could look at this in a multidisciplinary way. And so I commend all the different health practitioners and others that are here, because I think we have to look at this from beyond just law enforcement, look at it here, in a variety of different disciplines, and having all hands on deck and seeing how we could develop thoughtful policy, looking at violence interruption programs, other interventions that we could do up front. I see, we have the possibility of working with the City of Houston, with gang intervention programs as well. I see my good friend Victor Gonzalez with the Mayor's Anti-Gang Office, looking and seeing how we could best collaborate and strengthen some of those programs early on, try to intervene, seeing what could be done to educate families and raise awareness, trying to make sure they're keeping their weapons stored and safe and away from the hands of children. And so it's just, again, a multi-pronged approach that's needed. So it's looking at what else could be done there, making sure we're looking at all stakeholders that are in the community, that are in the space, that are doing work to try to, seeing how we could reduce gun violence in our community. So I participated in Mayor Turner's gun violence prevention committee that he had. I'm glad to see we're going to be up and running again to seeing what else we could do and what other recommendations we could do.
Thanks. I had to get my thoughts together. There are so many things that we need to combat firearm violence. So at the District Attorney's Office, I have full appreciation of prevention programs and of research required to help us advance in the long term. The problem is the job of the District Attorney is what's happening now. It's who's in front of us charged with a specific crime where there's generally a victim if it involved firearm violence. So what we need is accountability now at the courthouse. I think there's a feeling in our community that there's not going to be accountability, at least for a long time, and that this sense of complacency is fuel for young people making impulsive decisions and for professional criminals. And where those two groups come together are in gangs. And so we have three primary drivers of violence in Harris County right now. Domestic, at least in homicide. It's domestic violence homicide, gang homicides or gang-related homicides, and professional criminals, repeat violent offenders, often out on bail for long periods of time. There's a backlog at the courthouse. The backlog drives the length of time that people are out on bail. The time that people are out on bail often provides an expanding number of opportunities, not just to get into trouble, but to continue on with violence if they're gang bangers or if they're involved in organized crime, more robberies for profit, that kind of thing. So you have a domino effect. And what would I fix? I would fix the courthouse. That's what I would invest in. 6 years without a place to try cases is irresponsible in terms of our county funding. That would change. 2, I think we need to focus, just like Senator Whitmire said, if you want to change something in Austin, we've got to prioritize. That's the same here. Government works best when we're all focused on one thing at the same time. So to focus on violence, we're also going to have some changes, I think, in our gun laws. So I would support and invest my time and credibility in helping these legislators advance some very simple Second Amendment consistent policies and laws. One, people under 21 do not need to be able to buy an assault rifle ever. They have to wait till they're 21 to buy liquor. So we really need that law changed. Yes, we need red flag laws. I will tell you very quickly, it took over 30 years to get, and it took me becoming DA, to get the mental health system and the criminal justice system records in a compatible format where we could look at each other's records so that we could divert mentally ill, low-level offenders. Likewise, we need to be able to spot high-risk, mentally ill people who may not be offenders yet. So we're going to have to expand somehow the records of our mental health treatment and individuals who've received it, and non-criminal records, hospital and school records. We need somebody to, I think, understand those systems and be able to just answer the red flags. I mean, none of this last shooter, his nickname where he worked was school shooter. I read that. I don't have personal knowledge of that. But I mean, there's a red flag. And not even the type that we're talking about, but clearly somebody who had not socialized well at school, who was not well accepted where he worked. That's what his friends and peers called him, or his coworkers. So I think there's got to be a way to at least see those real pointy heads when they stick up and take note of them and get that person some kind of proactive treatment. And the last set of laws that I would ask for or invest my time and credibility with would be anything that would stop these the sale of these large magazines that carry 50 rounds, and the switch that is used to transform a Glock pistol into an automatic weapon. So there's different things to invest in. And at the DA's office, we believe in prevention. I believe it needs to be invested on, but we need help now for the things that are driving our crime rate. So we need help in domestic violence, gang violence, and repeat violent offenders on bail too long with too much time in between to stay in trouble.
That was so eloquently put, absolutely, as far as the laws that we need right now in order to help improve things. One of the laws that you alluded to was raising purchase age to 21, and that kind of leads me into kind of knowing where your stance is, DA Ogg, but having the rest of the panel weigh in, as well as kind of looking at it from a broader perspective. There's this saying that I learned, I'm not a Texan in full disclosure, I'm a Midwesterner, so I learned this phrase when I moved to Texas, that
as Texas goes, so does the nation. And it really kind of spoke to me. And we saw this example in policy too with Tobacco 21. You know, Texas passed Tobacco 21, and then the whole nation went Tobacco 21. And so where can Texas lead policy change? And in Texas, you have to be 21 to purchase a handgun, right? So is it time, and is the climate right now for Texas to raise the purchase age to 21 for certain types of long guns? And what would the implication be to the nation if Texas took the lead on this? And can Texas take the lead in the climate, especially given the situation we have now? So I'm going to pose this to the rest of the panel, as well as if DAOG has other comments on this question.
Well, as Representative Johnson said a moment ago, we have to be in session before we can take up items. And yesterday, the Democratic caucus in the Senate, we asked the governor to bring us into special session, just for the simple, as a talking point. I made a point yesterday that the public, you, are entitled to know where your state rep and state senators stand on these reasonable gun proposals. And quite often, it's been my experience, even if you have a losing vote, it's valuable to see where people stand. And as I mentioned a moment ago, they won't even talk about red flag laws. They won't talk about raising the age. If we were in session, we could propose legislation and at least take it to them and have a debate. And we should be the leaders in the nation. Unfortunately, we're not. We're not even followers at this point. Florida has a red flag bill, and other states are using it very effectively. It just really gets back to holding people accountable. And while we're talking about holding people accountable, I'm of the opinion locally you cannot continue to allow people that use a weapon in an armed robbery to then get another bond. And it's unheard of, as long as I've been working in the legislature on criminal justice, to hear that someone will get a second bond, but to get up in 5, 6, and 7 bonds is just irresponsible. So the bond system needs to be closely restructured. The judges have to be told, in my judgment, zero tolerance if someone uses a weapon in the commission of a crime. Well, I mean, we ought to just, that ought to be the first principle that people are asked when they run for office, certainly at the Harris County Courthouse. Our district attorney is underfunded. The office needs additional resources. The backlog is a serious matter. And to hear that the building's not adequate is just, we've heard that play too long. Houston has night court for its traffic. Houston could have Saturday courts, whatever it takes to hold someone accountable. And as I've said, if you use a weapon, and the mayor's doing his best, others are doing their best, our law enforcement, but the message ought to be zero tolerance when you pick up a weapon and go put it in someone's face. The only difference in an armed robber and a murderer or a capital murder is they don't pull the trigger. So once you decide to put a gun in someone's face as an armed robber, you have crossed the line of, quite frankly, redemption in my books. We've just got to let people know that they will be held accountable for an armed robbery, because we're seeing repeat offenses by the same individuals. And it's just, you know, we can pass as many laws as we'd like, and we need to focus on prevention and treatment. But on the other hand, once you've been arrested, and it's very hurting the morale of our sheriff and our police departments. They're beginning to see the same actors repeatedly, and that's why you and I quite often don't feel safe.
So I absolutely agree with raising the age. If anybody has a question, I absolutely will go to 21. I'll give you a little silver lining, which is when permitless carry was passed in the House, somebody actually offered an amendment to drop it down to 18, and that was rejected bipartisanly. So I think that gives you some hope. I would also say that should be a signal to the governor: call us back, let us come in, and let us raise the age to 21. Because I think if you did that, you'd reduce about 25% of the mass shootings. To me, that's a statistically significant number. And so I would hope that he would call us back, let us vote on this issue, and let us pass it, and let the nation recognize that that is the right thing to do. I'm glad to hear both DA Ogg and Senator Whitmire bring up the backlog, because I know my friend Sheriff Gonzalez a couple weeks ago said the jail is full. And so I want you to know something. Where are you going to put these folks? And so I don't want to blame him on the back end, and I want to recognize part of the problem of the backlog. I've been down in that system for 20 years. We've been needing new judges and new courts for decades. Yes. And for decades, we haven't been getting them. And so I'm proud to tell you that on October 12th of this last year, Commissioners Court unanimously, bipartisan, unanimously, means all the Republicans and all the Democrats voted to fund 3 new criminal district courts. I offered a bill, and almost all of the Harris County delegation, Republicans and Democrats, said, Governor Abbott, please give us a chance to vote on this bill, because if we pass this bill and add 3 new courts, we can get out of this backlog in 2.5 years. But if we don't pass this bill, and we don't add these courts, you guys are not going to get out of this backlog for 15 years. And so part of my frustration is, are we at a spot where we want to complain about the crime issue, or are we at a spot where we want to solve it? And so you had an overwhelmingly bipartisan, statistically proven way to make you safer today. And unfortunately, the governor was not interested in doing it. So my promise to you is I will continue to advocate for sound public policy that will make you safer. And to start with, given what we're talking about, background checks, extreme risk protection orders, safe storage, raising the age to 21 are a no-brainer. Even our local ministers put an article in the paper, I think a couple days ago, overwhelmingly saying this is an issue of which demands we all come together. And so I look forward to your leading the way on all of us coming together for some of these sound solutions that would actually make a difference.
Absolutely, I support raising the age to 21. To me, it's a no-brainer. It shouldn't be complicated. In my mind, it should be done, and I hope it's given strong consideration. I strongly support it.
I'm going to shift gears a little bit here, and this is specific to DA Ogg and Sheriff Gonzalez. Texas is one of the states that has passed child access prevention laws. However, it is only for those who are under 17 and if they have access to firearm that is readily dischargeable. However, they're not uniformly enforced in all regions. What are some ways that you believe a cap law can be utilized or enforced effectively within our counties? And do we need to make any changes to the state policy in order to allow improved enforcements of those?
Sheriff, you mind if I start?
Yeah.
Okay, on this one, I got this one.
Okay.
You know, I keep waiting for the same problem to cross my desk. In 5.5 years so far, not the same. I'm just waiting for one where I got this one. I know the answer to this. So this negligent access to firearms. Quick education. It used to not be against the law. City of Houston, in about 1994, passed a city ordinance that made negligent access a ticket. A $200 fine. That's the most they could do. It might have had a higher fine, but it was a Class C offense. That was big news. I remember asking somebody, does the mayor know this is happening? Because we were, because gun control was a hotly debated issue even in '94. And so they did that, and then shortly after, the state legislature passed legislation to make negligent access to firearms by a minor as committed by an adult a jailable crime. And now it's at least a felony, but for some time, probably 20 years or so, it was a misdemeanor. So you can see how we dipped our toe in the water and saw how it went. So here's what's happened. It's not consistently enforced. This is what I noticed my first several years. I'd see a child that the sheriff or the police chief, somebody had been shot by usually another minor, or they'd shot themselves. It's very traumatic for officers to see that, investigate that, and of course it's traumatic for the family whose child is both injured, and the family, if it's another family, who was negligent about the placement of their firearm. And so because there's so many emotions and so much trauma involved, the legislature has this 7-day waiting period now before we charge. But it's difficult to enforce the law against a parent whose child was just killed. And yet that's what these laws do. So why would we punish a parent whose child dies or is seriously injured because of their own negligence? Well, first of all, we make it easy for them to not break the law. So the sheriff, the district attorney's office, the police department, all gives away gun locks. They're so simple. You just run them through the barrel of the gun, it can't be fired. Lock it up. They're free. So we made it easier. We also told people about these laws, and there was a long period of time where they knew about them. What our office did that was different is I sent a letter to all 86 law enforcement agencies in Harris County, and I told them it would be required of our office that they bring every single case involving a child killed through potential negligence access by an adult, that they bring every single case to the DA's office, because here's what had been happening. Some cases were brought. It was often against an accused person who was maybe not very responsible, had left the gun on the sofa, or was maybe had a criminal record. But cases where you had maybe a nicer house, or parents who were professional, but they'd been negligent, sometimes those cases didn't get brought to the DA's office. And so immediately what you begin to see is racial disparity, economic disparity, and a real need for uniformity in policy. So now we take every one of those cases to a grand jury, and law enforcement's been instructed by our office to bring all of those cases. We don't have that statewide, Representative and Senator, and we could use a requirement, I think, that means that police will not abandon their discretion about what they think, but that they will bring those cases to the district attorney, and the district attorney's office then would have the responsibility of determining whether to bring charges or not. And what we do is we present them to the grand jury, who's made up of community members, and you decide whether they're indicted or not. And that's how we handle every negligent access to firearm case. I realize that took a lot of time, but it takes a minute to explain. And the answer is easy. We need consistency.
Can't go after that, but I'll just say that I do appreciate the district attorney, her leadership and her team. I do remember that directive a couple years back requesting that all cases be brought to for review, and I thought that was a very positive step. We had one recently, a 4-year-old that gained access to his uncle's pistol that was left unattended, and he shot and killed himself. And you're right about the 7-day provision. But again, I think, and you've also been very instrumental in raising awareness in the community about safe storage and the billboards and things like that. And I think we joined you recently for another initiative that you had. And I think it's about raising awareness. And you said consistency as well, that unfortunately, as painful as it is, that's why people need to heed the warning ahead of time and secure their weapons. If they're going to be a gun owner, be a responsible gun owner, because this is 100% preventable. And we've got to make sure that gun owners are responsible, and when they're not, then unfortunately we have to hold them accountable. It's painful, but we have to advocate for that child that lost his or her life by no fault of their own, and we have to continue to raise awareness.
As a point of clarification or even a follow-up, what about for the children that are injured but not necessarily lives lost? Are they still prosecuted or brought up in a similar manner?
Yes.
Okay.
Yes, it's not a policy based in result. It's really designed to prevent this. And so we just have law enforcement bring all their cases.
Excellent. So this question is geared towards Senator Whitmire and Representative Johnson. We've talked a little bit about mass shootings already, but I don't know if the audience is aware, but just to make the audience aware as well. Among the top 10 deadliest mass shootings in America since 1949, Texas makes the list 5 times. El Paso in
2019, Luby's in 1991, Sutherland Springs in 2017, the UT Tower in 1966, and now Uvalde in 2022. Here at the TMC, we have the largest medical center in the world, and with some of the best and brightest research minds in the state and country who might contribute to solving this problem. However, funding for research around firearm injury prevention is sparse, as we've learned, and we need research to develop these and test evidence-based solutions to drive policy. We see signs that bipartisan progress on legislative solutions is possible at the federal level. How do we get to a point where Texas funds firearm injury prevention research at robust levels?
I like how you push that and kick that over to me. I don't know that we can do it in the current climate, and I'll give you an example of that. Last session in the House, there was a bill that wanted to look at the impact of the fiscal challenges of us funding things like SNAP and TANF, benefits for kids on welfare and food. My fear for that is that in a couple years they'll come back and say, look, here's some fat we can trim off these programs and stop giving food assistance to children. So I looked at that bill and I said, oh, if we want to look at social services and determinants of health, why don't we study the data on having failed to implement Medicaid expansion and look at that and figure out if there's some fat we missed on that one. That got put up for a vote, and it was rejected on almost purely partisan grounds. There were Republicans that voted for it and said, yeah, let's look at the data. And I asked a friend of mine, I said, what's the harm in getting the data? And his response was, I think we all know what it's going to show. So I feel the same about this. At the moment that you have a political figure saying that we will be a Second Amendment sanctuary state, we need to buy more guns than California, and you have people that walk around the Capitol with guns on their hips and shirts on their body coming into our hearings to say if you compromise, death, I don't think you're going to get those entities to vote for data or vote for funding on getting data. And so I would also say, I don't know that we need the data. The most recent results that come out will tell you the leading cause of death in children are guns. And so I think we're going to have to be in a position of counting on you all and counting on independent research to tell us what we probably already know. I would not expect the folks that can't even have rational conversations around guns to give you the data that you need to prove your point.
If you don't remember anything, I say, if you don't remember anything but this, nothing happens in the legislature by accident. It's all by intent. So when you write the budget, there's a priority list. And this is just not one of the priorities of the leadership and the majority of the members that control both houses. Of course, they'll say, well, we are short of money, and it didn't make the list. This year we have money. We're going to have billions of dollars of extra revenue this year because of the price of oil. So this year, their excuse that we just don't have enough money for our critical needs and this is a new expense is just false. So what I would like to spend a minute on is where do we go from here? Because I think we've done a real good job of documenting the problem, and we're talking to a very intelligent group of folks that follow current events. What we have to do is each of you have to know who your state rep and state senator is. I used to, at luncheons or meetings, I would start over here and say, let's start over here and tell me your state rep and state senator. And it so embarrassed people, I stopped doing it. And I won't do it today. But if you don't have a working relationship with your senator and your rep, if you do not make yourself accessible to candidate forums this fall, we're really not doing our job, because we really are repeating ourselves. And while we're sitting here talking, there's probably a disturbed person in the state or in our community making some really evil plans, the copycats that we so are concerned about. So it's not science, it's not rocket science, it's very simple. We know the problem we're dealing with. We actually have reasonable proposals to solve it. Now we've got to get your elected officials, our colleagues, to act. And The governor doesn't think he needs to. I think, quite frankly, after Uvalde, that first day or two, and it's really sad. I've seen video clips of his rhetoric after Santa Fe, after Sutherland Springs. He really has talking points that he continues to reuse, and he'll reuse in the future. So, as I said earlier, until we make this the issue that you judge your elected officials by, we're going to continue to live in fear. And I've got 6- and 8-year-old grandsons, and I know their mother. My daughter is afraid to drop them off at school, even summer camp. And we just can't live in that environment. I know with the repeat violence on the street in the county due to guns, we're all beginning to work our schedule where we're not so vulnerable. So, you know, we just have to live like that. We have to hold people accountable that use a gun. We've got to do prevention. And getting back to that funding mechanism, mental health. I actually had the mayor of Stephenville. He was in town last weekend visiting his children, and he wanted to talk to me about home care. He runs a home care vendor providing service. He told me that what he's paying his home care providers, his staff, it ranks 49th in the nation. And he said he told me the Central Texas state rep that he talked to, can we get additional money? I think they're paying the state $10 an hour for nurses assistants. And the state rep said, how do we become 50th in the state? We have some really callous, backward state reps and senators. And it starts at the top. We have money. We need to make social services, mental health a priority. And I know it would be reflected in some of these tragedies that we witnessed, the family abuse, domestic abuse became a real priority a few years ago. We passed meaningful legislation after study groups, and it's making a difference. So we just got to look in our toolbox, raise the age, gun magazines, mental health, the red flag. But we've identified the issues. Now let's do something about it. So I would urge each of you to leave here fired up, talk to your families, your neighbors, and it's amazing. We all run for office. It's amazing what one person can make a difference in a campaign. That's right. And you need to be that one person and partner with others.
Thank you so much.
I just want to just say something real quick. Also at the federal level, I know for decades there was a freeze on funding for gun violence research at the CDC, and I think their budget had billions of dollars, was only about $100,000 to do research on these issues. So I think, I don't know if it's loosened up any here in the last few years, but that's real important as well. We should be looking at the data about this at all levels and really making informed, data-driven decisions here. And it's difficult when we don't have the data to really guide some of our decisions.
But we have our common sense.
Yeah.
We have our common sense. I've seen enough studies in Harris County, just of my office, that would have funded the 100 prosecutors that I asked for. We don't need any more studies, in my opinion. Yes, research, because data is critical. But, you know, I'm frustrated with lack of action that's meaningful at a county level. And until we make some pretty dramatic changes, fix our courthouse, improve our bail system and record, get people to trial speedier. I mean, there are innocent people also waiting. It's not just victims waiting. Everybody has a right to get their case tried, and they're either going to be acquitted or convicted. And so that's what we need. To do that, we need people. So that's all I want to say about data is really important, but we need boots on the ground right now. Bodies are dropping.
And I can't sit here with this information without sharing it with you. And I've spent a career, I've been chairing criminal justice since '93, and the state system works well. We know what we're going to do with you. So I say that I haven't built a career of locking people up. I totally believe in treatment, second chances, alcohol, drugs,
Yes.
mental health. Most of the women in prison don't belong there. They need to be in the community. Many of them are victims themselves. But I do believe, back to my earlier comments, if you put a gun in somebody's face, you ought to be held accountable. The jail is full because people are not being processed, and most of them are violent offenders. Before COVID, TDCJ had 147,000 inmates. 147,000. Today it's 117,000. It's because the courts are not working and holding people accountable. The numbers are continuing to drop. Harris County furnishes the system about a fourth of its clients. The major cities provide the overwhelming number. But as long as people are going to be holding folks up, murdering them, and then getting back on the streets of Houston, Harris County, we're going to live in a dangerous environment. And so while I'm very passionate about nonviolent offenders, work with them, keep them in the community, DWI perpetrators ought to be given every opportunity to go to be sober, because if they're sober, they're not a danger to you. But when someone puts a gun in your face and shoots someone, that person needs to be held accountable. And it's documented, and the data would show no one's being held accountable because they're being backed up in the Harris County Jail. And don't forget, we have, Sheriff, about 500 Harris County defendants in Louisiana. So that numbers continue to grow. We must move those that law enforcement arrest through the court system. There's some innocent people being held down there as well. They deserve their day in court. But it's just very frustrating that I go home this evening and will watch TV, and there's going to be numerous murders. And the worst thing we can do is become desensitized to the violence that we're seeing in our community. It's hurting our quality of life. I think it's hurting Houston's image, and for sure it's going to ultimately affect our economic development. I already have talked to the chamber. People that they're attempting to recruit to Houston, Harris County, businesses, are talking about our crime rate. So we've got our work cut out for us. The subject you brought us together today, we've identified proposals that could solve that. Now that's going to be a political solution as much as anything. So we got to leave here saying we're not going to take it any longer. So let me just thank you for bringing this together. It kind of gets me fired up leaving here today myself.
I think all of us are fired up after today, for sure. You know, and I think it speaks to us needing to hold each other accountable, hold our policymakers accountable as well, but also to hold each other up, right? Because this is, for those of us who have been in the game of firearm injury prevention, it's sometimes our long, dark days, and we need to continue to remind ourselves that while the days sometimes are long and arduous, at the end of it, we're about saving lives and working to impact lives, right? And every life is important for us to impact. And so we must continue on, because, you know, we'll get there. I mean, we will absolutely get there. And that's what we need to do. So in looking at the time, I want to make sure that I give our panelists each an opportunity to make a final comment, and then we will close out our very amazing day filled with so much energy and enthusiasm. So any final comments from anyone else?
I appreciate you getting me at Rice. This is probably the closest I've ever been to being a student at Rice.
Awesome.
Based on GPA and SAT scores.
I just want to thank the Baker Institute of Public Policy and everyone that attended today for this very important conversation. To me, there's not just one thing that we need to be doing. It's going to be a multi-pronged approach. I like to try to compartmentalize things and understand that, look, we've got to do something about suicide, prevention, extreme risk protection orders may not necessarily, all the data isn't there to determine if they would make an impact necessarily on mass shootings, for example, but we know that they would have an impact on suicides, for example, and the data is there because 19 other states already have them. So we can learn from those states, see what's working, what's not working, and make sure that we're improving it here in Texas. We also need to look at intimate partner violence. That's very prevalent and growing tremendously. There's a strong nexus between some of the homicides that we see and domestic violence. We also need to look at, obviously, mass shootings, as well as just the day-to-day gun violence that we're seeing on a regular basis. Each is going to require a different type of approach. And also, another area that's forgotten, the average length of stay right now in the Harris County Jail is over 200 days of incarceration, where the state average is around 60 days. So it tells you how backed up we are here, that is just clogging up the system. And so it's not a very safe situation for even our personnel that are inside. The offenders inside are becoming much more violent. And so we've got to do something about that. But every year here in our community, we have 90,000 children that have a parent that's incarcerated in our jail. And when we talk about juvenile crime, we've got to make sure that we start that intervention early to disrupt that trauma that's going to exist for those children that have a parent that's in our jail. That's 90,000 children every year. They're going to underperform in school. They're probably going to drop out. Many of them are going to become just as involved at some point. The statistics bear that out. So I think when you asked earlier, one of your first questions is, what can we be doing? That's another area that we often don't touch on, but I think it's important because we're going to see the impact, and we're seeing it now. I was getting briefed today on a robbery crew, a violent robbery crew that's going around with weapons, as the senator said. And one of the members of that crew is 14 years old that was arrested. 14 years old, already committing armed robberies with other adults. That's something that should send chills to all of us, because when kids are armed at 14-year-old committing robberies, okay, that's we could see where that's headed. And our jails are going to continue to be full, and we're going to continue to talk about gun violence unless we make serious changes to laws, as well as making sure we're looking at the interventions like mental health at our schools and all the other pieces together. So thank you very much for having us.
Yeah, thank you so much. And I almost thought you said lawn dart days rather than long dark days. But don't forget the lawn dart. The lawn dart in the 80s killed 4 kids, and we banned it. Seriously. The lawn dart. 4 children died, and one of their fathers took on the mission of going to Congress and highlighting the fact that this thing was dangerous for children, and they banned it. Now, I'm not saying ban guns. I believe in the Second Amendment. I noticed when you asked who has a gun, I'm the only one up here that didn't raise my hand. And I think we had a rifle growing up, and my father taught us to respect it, that it was dangerous, and that it was a place where we didn't play with as a kid. And I've also been told, being around law enforcement for 20 years, that don't have a gun unless you're ready to fire it and kill somebody. And personally, I don't know that I could do that, right? But I respect the fact that there are other people that want to do it. I will also tell you that when I talk to people and we talk about permitless carry, average citizens are shocked when you tell them that Texas passed a law that anybody can walk into a place and buy a gun without having to pass a background check in certain places, and zero training on even how to put the bullets in the gun. And people are shocked. They don't know that happened. And so I would ask, as Senator Whitmire and I both have demonstrated in promoting legislation that supports common sense gun safety reform, court backlog, mass shooter, and even the bond issue. He and I both have taken on that issue, and I think both of us have promised to continue to take it on. What frustrates me is I always hear the media talk about cases, and I just wonder what would happen if every day they talked about the number of cases get filed in Harris County that involve a gun. What if the focus every day became about how many crimes were being committed with a gun? And so I don't want to see us get deflected by message from the overwhelming reality that our crime problem is in part a significant issue with Texas letting anybody and everybody find a way to get a gun. And I just think for those of you that respect, and I know all these folks with the badges on do respect the Second Amendment, we have more in common. And we have more that we know that we could do if we could get the political will to do it.
Okay, I'll close it out. Murder is nonpartisan. Guns are nonpartisan, and the Second Amendment was written for all Americans. I have a lot of gratitude for the people that I'm sitting with. We're local. We understand our city and our county and our state. We understand the role that guns have played in our history, all of that. And I just think it's common sense that research is good. I didn't mean to say it wasn't. Research is good, but we need to use our common sense. I think I can run these numbers each day, Representative Johnson, about exactly how many people were charged with crimes of violence or possession, illegal possession of a weapon. And for it to be illegal, you have to have it while you're committing another crime. So you're in possession of some type of drug and you're carrying a weapon. That now creates an illegal way or a set of elements for carrying a weapon. Otherwise, you can carry them just about anywhere, anytime you want. So I have a lot of confidence that with the type of educated and experienced legislators that you've got, that they will work with their counterparts on a nonpartisan way to attack and reduce gun violence. And I think we just have to keep working with both sides. I like the idea of telling how many each day are involve guns. Good idea, Representative Johnson, and maybe that's something we publish every day. McDonald's tells you how many they've served. So maybe by putting it in people's consciousness, it would help. So I'm gonna do that. I'm gonna take a look at that and see if we can't make that public. And finally, I just want to close out and thank the sheriff and his deputies do a great job. They are also understaffed and sometimes outgunned, and they do a great job. And Sheriff, I want to thank you. I would say the same about Chief Finner. These are men that I've known all my careers, and you are in good hands here. So I'm going to urge us all to be super grateful to the Baker Institute, to you, Dr. McKay, of course, to you, Doctor, and for all of you for coming. If any of you can get to any one legislator, just have a conversation, another DA, people who can vote or influence this issue directly, it's worth your time. That is exactly how the law changes. It is really one person at a time. So each one of you have the potential to make the same difference that we do. Take your experience, leave here fired up, and together, Houston can change this. We have a history of pulling together to solve problems. Thank you.
I'll just quickly conclude by saying we don't have to live like this. And we're all public servants. Everyone I'm looking at, whether you're ever on the ballot or not, you're a public servant. So we need to leave here and do our public service to change this policy. And I do believe that we will be successful. It's just unfortunately going to take a little longer than it should because we got some folks that are afraid to stand up to special interests. But we can be that special interest that balances the NRA and other irresponsible groups. So thank you for having us. This has been very helpful, and let's leave here as game changers. Thank y'all.
Thank you so much, everyone. Be fired up.
Thank you. Thank you, Ann. Just fine.